1. Prostate cancer, most frequently diagnosed in men over 65, often begins its insidious course when normal prostate cells mutate their DNA, leading to uncontrolled growth influenced by male hormones like testosterone, creating a local lesion that can sometimes remain asymptomatic for years until peripheral nerves are affected, causing characteristic lower back pain or radical changes in urinary patterns. 2. The prostate-specific antigen (PSA) test, although controversial due to its potential for false positives, remains a crucial tool in the early detection of prostate cancer, with elevated levels suggesting the need for further investigative procedures such as a digital rectal exam, DRE, or magnetic resonance imaging (MRI) to visualize suspect areas within the gland. 3. One innovative area in prostate cancer treatment is the use of high-intensity focused ultrasound, HIFU, which precisely targets cancerous tissues via sound waves, thereby minimizing damage to surrounding healthy tissues, an advantage that is especially palpable in situations where traditional radiation therapy would pose a higher risk to neighboring structures. 4. In understanding the pathophysiology of prostate cancer, it's crucial to recognize the role of genetic alterations, such as PTEN loss or TMPRSS2-ERG fusion, which can drive aggressive phenotypes and underlie castration-resistant pathways, often necessitating the subsequent use of androgen receptor pathway inhibitors like enzalutamide. 5. The concept of active surveillance in prostate cancer acknowledges that many tumors grow so slowly that immediate treatment might be unnecessary. Thus, the patient undergoes regular monitoring for any indication of progression, often reserved for those with low-risk profiles to avoid the morbidities associated with premature intervention. 6. Multiparametric MRI has revolutionized the diagnostic landscape of prostate cancer, providing detailed images that not only help in defining the tumor's size and extent, but also direct targeted biopsies, offering greater accuracy over traditional random biopsy approaches, especially in distinguishing significant cancers from indolent ones. 7. The genetic landscape of prostate cancer is varied, with tumors often exhibiting a stable genome compared to other malignancies, yet exhibiting mutations in BRCA1 and BRCA2 genes that confer heightened aggressiveness and poorer outcomes, necessitating careful consideration of family history in the clinical context. 8. Prostate cancer pathophysiology can involve transitions from androgen-dependent to androgen-independent states, a conundrum that complicates treatment, enhancing the importance of novel therapies like PARP inhibitors, which exploit DNA repair vulnerabilities specific to cancer cells, thereby increasing the sensitivity of the tumors to subsequent therapies. 9. Proton beam therapy offers a cutting-edge approach for treating prostate cancer, using proton particles that deposit most of their energy directly in the tumor, sparing surrounding tissues with remarkable precision and reducing common side effects like urinary or bowel dysfunction compared to more conventional photon-based radiotherapy. 10. Understanding prostate cancer metastasis requires an appreciation for the molecular changes that allow tumor cells to detach and traverse bodily systems, particularly the lymphatic pathways leading to nearby lymph nodes and bones, where they establish secondary growths, often necessitating systemic treatment modalities beyond localized therapy. 11. The Gleason scoring system remains a cornerstone in predicting prostate cancer behavior, assigning a score based on glandular patterns observed under a microscope, where higher scores indicate a greater degree of aberration, aiding in tailoring management strategies to individual patient risk levels. 12. Androgen deprivation therapy, ADT, has long been a mainstay in the management of advanced prostate cancer, aiming to reduce circulating testosterone through either surgical orchiectomy or pharmaceutical agents such as GnRH agonists, which ultimately starve the cancer of its growth-promoting hormones. 13. Immunotherapy, such as the use of sipuleucel T, represents a novel frontier in prostate cancer treatment, whereby a patient's immune cells are engineered to recognize and combat prostate cancer cells, offering a personalized approach that can extend survival in select patients with advanced disease. 14. There is growing evidence that the microbiome, particularly within the gut, may play an influential role in prostate cancer development and progression, with certain microbial compositions potentially modulating systemic inflammation and hormonal balances that encourage or suppress oncogenic pathways. Radioligand therapy, targeting prostate-specific membrane antigen, PSMA, provides a promising avenue for metastatic prostate cancer, leveraging radioactive isotopes bound to molecules that selectively attach to cancer cells, delivering lethal doses of radiation while sparing healthy tissue to a greater extent than traditional methods. 16. Transperineal prostate biopsy, performed under ultrasound guidance, minimizes infection risk compared to transrectal approaches, and provides more comprehensive sampling of the prostate, enhancing diagnostic precision especially in previously biopsied individuals with persistently elevated PSA levels. 17. Obesity has been implicated in the pathogenesis of more aggressive prostate cancer forms, potentially due to increased levels of inflammatory cytokines and insulin-like growth factors, which may promote tumor growth, highlighting the importance of lifestyle interventions as adjuncts in the prevention and management of prostate cancer. 18. The influence of dietary patterns on prostate cancer risk and progression has gained attention, with studies suggesting that diets rich in tomatoes, due to their lycopene content, and polyphenol-rich foods like green tea, may confer protective effects through their antioxidant and anti-inflammatory properties. 19. Focal therapy, including cryoablation and laser thermal therapy, targets prostate cancer lesions with precision, potentially offering a middle ground between active surveillance and radical treatments, aiming to eradicate cancerous tissues while preserving prostate function and patient quality of life. 20. Circulating tumor cells, CTCs, and DNA, ctDNA, are emerging biomarkers in the blood that may offer real-time insights into prostate cancer dynamics, potentially guiding treatment decisions and prognostication by reflecting tumor burden and molecular changes in response to therapy. 21. Radiotherapy advancements now permit hypofractionated regimens for prostate cancer, where higher doses per session shorten treatment duration, maintaining efficacy while offering greater convenience and reducing time spent by patients undergoing therapy, demonstrating comparable side effect profiles to conventional schedules. 22. The phenomenon of neuroendocrine differentiation in prostate cancer, often occurring in the setting of advanced, treatment-resistant disease, represents a shift in tumor phenotype, where cells acquire neuroendocrine-like features that are less reliant on androgen receptors, complicating therapeutic approaches, and often indicating a poorer prognosis. 23. Dietary supplementation with vitamin D has been investigated for its potential role in reducing prostate cancer risk and progression, given that this nutrient is thought to influence cellular differentiation and proliferation, yet evidence remains mixed, warranting further study to elucidate its impact fully. 24. Magnetic resonance imaging ultrasound (MRI-US) fusion biopsy technology allows for the precise targeting of suspicious areas within the prostate identified on MRI, providing increased accuracy over traditional biopsy techniques, potentially reducing the number of necessary samples and improving cancer detection rates. 25. The advent of genomic profiling in prostate cancer has facilitated the identification of actionable mutations, enabling targeted therapies such as those aimed at the PI3K, AKT, mTOR pathway, which are currently being explored in clinical trials to determine their efficacy in improving outcomes in certain genetic subpopulations. 26. Early-stage prostate cancer may be asymptomatic, but as the disease progresses, symptoms such as difficulty urinating, blood in urine or semen, and erectile dysfunction can develop, emphasizing the importance of regular screening and early intervention to mitigate the impact on quality of life. 27. Hormone-refractory prostate cancer, also known as castration-resistant prostate cancer, CRPC, occurs when the disease progresses despite androgen deprivation, necessitating the use of additional therapies such as chemotherapy with docetaxel or cabazitaxel, which target rapidly dividing cancer cells through distinct cytotoxic mechanisms. 28. The relationship between chronic inflammation and prostate cancer has been a focal point in research, with inflammatory conditions potentially leading to genetic mutations over time, thus providing a fertile ground for cancer development, encouraging explorations into anti-inflammatory compounds as preventive measures. 29. Prostate cancer risk is significantly augmented by family history, with men having a first-degree relative diagnosed with prostate cancer being about twice as likely to develop the disease themselves, suggesting a substantial genetic component that could inform personalized screening strategies. 30. The use of 5-alpha reductase inhibitors in prostate cancer prevention is predicated on their ability to block the conversion of testosterone to dihydrotestosterone, a potent androgen that drives prostatic growth, though these medications are typically reserved for specific cases due to potential side effects. 31. The complexity of the tumor microenvironment in prostate cancer, including interactions between cancer cells, stromal cells, and extracellular matrix components, plays a crucial role in disease progression, influencing tumor growth, resistance to treatment, and metastatic potential, thus providing a rich target for novel therapeutic strategies. 32. Bone-targeted therapies such as bisphosphonates and denosumab play a pivotal role in managing bone metastasis in prostate cancer, working to reduce skeletal-related events by inhibiting osteoclast-mediated bone resorption, thereby enhancing patient quality of life and potentially extending survival. 3. Epidural spinal cord compression is a critical complication of metastatic prostate cancer that requires immediate medical intervention, often involving steroids, radiotherapy, or surgery to alleviate pressure on the spinal cord, thus preventing irreversible neurological damage and preserving functional status. 34. Prostate cancer staging with radiolabeled tracers like choline, or more recently PSMA, in positron emission tomography, PET, scanning, significantly improves detection of both local and distant metastasis, providing a comprehensive picture of disease burden that informs subsequent treatment planning. 35. Contemporary surgical techniques, such as robotic-assisted laparoscopic prostatectomy, have revolutionized prostate cancer surgery by offering enhanced dexterity and visualization, thereby improving outcomes related to oncological control, continence, and erectile function compared to traditional open procedures. 36. Chemoprevention trials in prostate cancer are exploring the use of dietary agents such as soy isoflavones and selenium, hypothesized to exert protective effects through modulation of hormonal and inflammatory pathways, though findings to date remain inconclusive and warrant further investigation. 37. Prostate cancer cell dormancy represents a significant clinical challenge, as disseminated tumor cells may remain quiescent for years before reactivation, complicating treatment strategies and necessitating ongoing research into the triggers of dormancy and potential interventions to eliminate dormant cells. 38. In the landscape of personalized medicine, molecular subtyping of prostate cancer is becoming increasingly important, with classification systems identifying distinct subsets of the disease based on genetic and molecular signatures, which can guide targeted therapeutic interventions and prognostic assessments. 39. The impact of psychosocial factors on prostate cancer outcomes is profound, with stress, depression, and lack of social support been associated with poorer survival, reinforcing the importance of holistic approaches that incorporate mental health and well-being support alongside traditional clinical care. 40. The risk stratification of prostate cancer recurrence post-treatment is enhanced by tools such as the Cancer of the Prostate Risk Assessment (CAPRA) score, which evaluates pre- and post-treatment variables to predict the likelihood of biochemical recurrence, thereby informing ongoing patient monitoring and management decisions. 41. In the exploration of resistance mechanisms, prostate cancer research has unveiled the role of aberrant CRIP signaling and DNA repair processes in conferring treatment resistance, emphasizing the need for combination regimens targeting multiple pathways to delay or overcome resistance in advanced cases. 42. The role of somatic mutations in genes such as SPOP, FOXA1, and CHD1 is being elucidated in the context of prostate cancer, with these mutations associated with specific clinicopathological features and treatment responses, offering the potential for enriched patient stratification in clinical trials. 43. In the realm of advanced imaging, 3D histological reconstruction from biopsy samples provides a deeper insight into the spatial arrangement of cancerous tissues within the prostate, offering potential improvements in understanding tumor biology and enhancing the precision of treatment planning. 44. Genetic counseling and testing for hereditary prostate cancer syndromes, particularly in families with BRCA mutations, are crucial components of risk assessment and management, enabling tailored screening protocols and consideration of prophylactic measures in high-risk individuals. 45. The use of metabolism-targeted therapies, such as inhibitors of fatty acid synthase or those impacting mitochondrial function, represents a burgeoning frontier in prostate cancer treatment, aiming to exploit the metabolic adaptations that cancer cells undergo to support rapid proliferation. 46. Tracking therapeutic responses in prostate cancer through advanced biomarkers, such as changes in circulating microRNA profiles, provides a non-invasive tool to monitor disease dynamics in real time, enabling adjustments to therapeutic regimens in response to detected changes. 47. In assessing and managing the side effects of prostate cancer treatments, integrative approaches combining conventional medical treatment with complementary methods such as acupuncture or yoga may offer relief from therapy-related symptoms, such as fatigue and anxiety, enhancing overall quality of life. 48. Ongoing research into the prostate cancer stem cell hypothesis suggests that tumorigenesis may be driven by a subset of stem-like cells capable of self-renewal and resistance to conventional therapies, presenting a profound challenge but also a potentially transformative target in the quest for more effective long-term treatments. 49. In the journey of a patient with prostate cancer, survivorship programs play an essential role in addressing long-term health outcomes, focusing on lifestyle modifications, routine health screenings, and psychological support as part of an integrated approach to life beyond cancer. Advancements in cryobiopsy for prostate cancer allow for the preservation of tissue architecture and viability for extensive histopathological analyses, providing critical insights into tumor heterogeneity and molecular characterizations that guide personalized treatment plans and novel research directions. 1. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. Two, the hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. 3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. Four. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed, to ensure timely intervention and reduce the risk of severe liver damage. 5. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. Six. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. 7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. 9. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. 11. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. 12. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. 13. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. 14. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. 15. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. 17. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. 18. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. 19. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. 20. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. 21. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. 22. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. 23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. 24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. 25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. 26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. 27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. 28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. 29. The common fibrosis 4 (FIB4) score calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. Hepatitis C coinfection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. Host genetic factors, such as polymorphisms in the IL-28B gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. 43. While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre- or post-transplantation, informing the timing and strategies of antiviral regimens. Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepiciviruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. In gastric cancer, the aberrant activation of the WNT beta-catenin signaling pathway significantly contributes to oncogenesis by promoting cellular proliferation, inhibiting apoptosis, and facilitating tumor invasion through down-regulated E-cadherin expression while enhancing vascular endothelial growth factor-mediated angiogenesis. Precise staging in gastric cancer hinges on advancements in endoscopic ultrasonography, EUS, which surpasses conventional imaging methods by offering real-time, high-resolution evaluation of tumor invasion depth, T-stage, and regional lymph node involvement, end-stage, thereby guiding prognosis and therapeutic approach. A Helicobacter pylori infection, a class 1 carcinogen, initiates chronic atrophic gastritis and mucosal inflammation, progressing to intestinal metaplasia and dysplasia before culminating in gastric adenocarcinoma, highlighting the bacterium's role in the precancerous cascade and underlining the significance of eradication programs. Peritoneal dissemination, a frequent complication of gastric cancer metastasis, eludes conventional imaging techniques but can be sensitively detected through diagnostic laparoscopy, a crucial step in identifying non-visible carcinomatosis and avoiding futile surgical resections. Tumor microenvironment alterations in gastric cancer encompass hypoxia-induced factor activation, leading to epithelial mesenchymal transition, EMT, and fostering resistance to chemotherapy while supporting immune evasion via upregulated programmed death ligand 1, PDL1, creating an immunosuppressive niche. Despite its rarity in the Western Hemisphere, gastric cancer maintains a formidable global incidence, necessitating universal screening measures in high-risk regions such as East Asia, where endemic Helicobacter pylori prevalence and dietary carcinogens like nitrosamines prevail. 7. Immunotherapy, particularly the use of checkpoint inhibitors targeting PD-1 or PD-L1, has emerged as a beacon of hope in advanced gastric cancer, offering durable responses in a subset of patients, although their efficacy is contingent upon biomarkers such as microsatellite instability, MSI, and tumor mutational burden. 8. Hereditary diffuse gastric cancer, HDGC, often resulting from germline mutations in the CDH1 gene encoding E-cadherin, mandates rigorous surveillance and consideration of prophylactic gastrectomy by age 40 for mutation carriers to preclude the development of signet ring cell carcinoma. 9. The application of next-generation sequencing, NGS, in gastric cancer has illuminated an array of actionable genomic alterations, providing a spectrum of targeted therapy options, including anti-HER2 therapies in ERBB2-amplified tumors and MET inhibitors in MET overexpressing cancers. 10. Linitis plastica, a unique subtype of gastric cancer characterized by diffuse infiltration and thickening of the gastric wall leading to a stiff, non-distensible stomach, typically signals a poor prognosis with limited resectional success due to the pervasive tumor spread at diagnosis. 11. Improved nutritional support, a critical component of gastric cancer management, involves multidisciplinary approaches focusing on preoperative optimization through enteral nutrition, essential for reducing postoperative complications and enhancing recovery in malnourished patients. Recent studies highlight the utility of liquid biopsies in gastric cancer, wherein circulating tumor DNA, ctDNA, serves as a non-invasive biomarker for early detection, monitoring treatment response, and identifying resistance mechanisms, fostering personalized, adaptive treatment strategies. 13. Targeting angiogenesis in gastric cancer, notably through agents inhibiting VEGF signaling pathways, offers clinical value in subsets of patients, disrupting neovascularization crucial for tumor growth and metastasis, albeit with careful management of the associated thromboembolic risks. 14. Palliative chemotherapy remains a cornerstone for managing advanced gastric cancer, prioritizing symptom relief and life quality improvement, with regimens such as FOLFOX and FOLFIRI leading the standard offerings supplemented with targeted biological agents in suitable genetic profiles. 15. The integration of tumor-infiltrating lymphocyte (TIL) analyses within the histopathological evaluation of gastric cancer biopsies provides prognostic insights, with an abundant presence often correlating with improved survival outcomes and potential responsiveness to immunotherapeutic interventions. 16. ROS-producing gastric cancer cells demonstrate an altered redox state, leveraging increased oxidative stress to activate survival pathways while promoting genomic instability. Thus, antioxidant defense targeting provides a promising therapeutic angle worth actively exploring. 17. Patients with early gastric cancer detected through dedicated surveillance often benefit from endoscopic submucosal dissection (ESD), a minimally invasive technique ensuring curative resection with organ preservation in localized, non-ulcerated tumors confined to the mucosa and submucosa. 18. Tumor-associated macrophages (TAMs) within the gastric cancer microenvironment exhibit plasticity, toggling between protumorigenic (M2) and anti-tumor (M1) phenotypes, thus serving as pivotal targets in immunomodulatory therapy perspectives geared toward reprogramming TAMs to suppress tumor progression. 19. Gastric carcinogenesis in older adults often presents with distinctive molecular fingerprints and comorbid supportive care requirements, underscoring the importance of tailored therapeutic approaches balancing aggressiveness with the patient's physiological reserve and quality of life considerations. Lurian classification of gastric adenocarcinoma into intestinal and diffuse types remains crucial in prognosis determination and therapeutic decisions, given the differential response rates to conventional chemotherapeutic regimens and varying propensities for peritoneal dissemination. 21. Neuroendocrine tumors of the stomach, though rare in comparison to adenocarcinomas, exhibit unique diagnostic markers such as chromogranin A and synaptophysin, necessitating specific management strategies including somatostatin analogs and surgical resection for localized disease. Heterogeneity in gastric cancer, governed by multiple histological and molecular subtypes, complicates treatment standardization. Hence, precise molecular profiling and histochemical analysis are crucial for tailoring individualized therapeutic regimens in the precision medicine paradigm. The phenomenon of tumor budding, characterized by single cells or small clusters at the invasive front of gastric cancer, serves as a highly significant adverse prognostic predictor, correlating with aggressive behavior, lymphatic invasion, and early metastatic potential. Specific perineural invasion in gastric cancer portends a graver prognosis, elucidating the tumor's predilection for local infiltration along nerve sheaths, necessitating vigilant histological assessment to inform comprehensive treatment planning and adjunctive radiotherapy consideration. Tumor hypoxia in gastric cancer dynamically modulates crucial survival pathways such as HIF-1 alpha, promoting glycolytic metabolism, epithelial mesenchymal transition, and resistance to chemo and radiotherapy, unveiling potential vulnerabilities for therapeutic exploitation through hypoxia-modifying agents. Non-invasive breath tests investigating volatile organic compounds, VOX, have been proposed as innovative diagnostic tools for gastric cancer, exploiting metabolic changes to differentiate cancer patients from healthy individuals, pending further validation for clinical implementation. Gastric cancer-associated fibroblasts, CAF, foster a supportive stromal environment conducive to cancer cell proliferation and invasion by secreting growth factors, matrix remodeling enzymes, and modulating extracellular matrix components, marking them as key targets for stroma-disruptive therapies. Radiofrequency ablation, RFA, for gastric cancer liver metastasis adds a minimally invasive option to local control strategies, significantly prolonging survival in selected cases and synergizing with systemic chemotherapy to enhance overall management outcomes. Microsatellite instability, MSI, high status in gastric cancer not only predicts responsiveness to immune checkpoint inhibitors but also correlates with improved prognoses and distinct clinicopathological features, advocating for routine incorporation of MSI testing in diagnostic workups. Complementary therapies such as traditional Chinese medicine, TCM, have shown promise in adjunctive gastric cancer management, achieving symptom palliation and quality of life improvement, underscoring the importance of integrating evidence-based complementary approaches within mainstream oncology practice. Amplified research into the gut microbiota gastric cancer axis posits that dysbiosis can modulate immune responses and therapeutic outcomes, suggesting the vast potential of microbiome-targeted interventions to enhance patient prognoses and therapy efficacies. 32. The prophylactic use of aspirin in patients at high risk for gastric cancer is undergoing investigation, hinged on its anticarcinogenic properties achieved through cyclooxygenase 2, COX2, inhibition, albeit balanced against gastrointestinal bleeding risks necessitating thorough risk assessments. Positive Epstein-Barr virus, EBV, status in gastric cancer has emerged as a distinct molecular subtype associated with lymphoepithelioma like histology, heavy lymphoid infiltration, and exclusive therapeutic vulnerabilities amenable to immune-modulating agent exploitation. The innovative use of artificial intelligence algorithms in gastric cancer has unlocked novel pathways for enhancing diagnosis accuracy, prognostic modeling, and treatment stratification, exemplifying a pioneering frontier in augmenting oncological clinical decision support systems. Vitamin and micronutrient supplements, particularly vitamin D and selenium, are subjects of ongoing inquiry into their potential roles in gastric cancer risk reduction and survivorship care, reflecting a growing focus on lifestyle interventions in cancer prevention paradigms. Synchronous and metachronous gastric cancer involvement necessitates stringent surveillance post-resection, with ongoing follow-up endoscopy to detect secondary malignancies, providing early intervention opportunities that may bolster long-term survival prospects. Predictive nomograms in gastric cancer integrate diverse clinical, pathological, and molecular markers, formulating individualized survival and recurrence estimations, which can be instrumental in informing patient-centric therapeutic decision-making and care planning. Photodynamic therapy, PDT, offers a novel technique for superficial gastric cancer ablation, employing light-activated photosensitizers to selectively induce cytotoxicity, thereby furnishing an option for patients ineligible for standard surgical procedures or as palliative treatment. The CHEK2 gene mutation, associated with heightened cancer susceptibility, extends its implications to gastric cancer predisposition, requiring vigilant genetic counseling and monitoring in affected families to preemptively address emergent malignancies. Intratumor heterogeneity in gastric cancer, manifested by distinct subclonal populations, influences treatment responsiveness and therapeutic resistance, necessitating comprehensive sampling and advanced sequencing approaches to effectively tailor multimodal interventions. The implementation of enhanced recovery after surgery, ERAS, protocols in gastric cancer resection aims to minimize hospital stays, expedite functional recovery, and curb postoperative complications via multidisciplinary tactical measures harmonizing patient perioperative care. P53 mutation status in gastric cancer represents a crucial determinant in prognostication, potentially guiding therapeutic selections, as its loss of function often signals aggressive behavior and poor clinical outcomes, pointing to the importance of integrating genetic profiling in routine diagnosis. The identification and manipulation of long non-coding RNAs, LNCRNAs, in gastric cancer research have uncovered a wealth of novel biomarkers and therapeutic targets, spotlighting their role in oncogenic signaling cascades, metastasis, and chemoresistance, thereby enriching innovative therapy development. Ethnopharmacological investigations into natural compounds, notably curcumin and resveratrol, demonstrate tentative anticancerous effects against gastric cancer cell lines, proposing an expansive trajectory for phytochemicals in complementary therapy refining and integrative cancer management. Gastric cancer treatment paradigms continue to evolve, embracing hyperthermic intraperitoneal chemotherapy, HIPEC, as an adjunct to cytoreductive surgery in peritoneal metastasis, showing promise in prolonging survival and restricting local recurrence in meticulously selected patient cohorts. (46) The HER2 positivity in gastric adenocarcinomas, markedly present among a subset of patients, is capitalized upon in precision oncology through the administration of trastuzumab-based regimens, vindicating the stratification of patients by HER2 status to enhance targeted treatment efficacy. (47) CD44, a prominent stem cell marker, defines a self-renewing subpopulation in gastric cancer that drives tumorigenicity and therapeutic resistance, substantiating urgent research into CSC-targeted strategies intended to thwart gastric cancer relapse and metastasis. (48) Telemedicine platforms offer burgeoning potential in gastric cancer care, enabling remote patient monitoring, continuity of care, and prompt management of treatment adverse effects, thus extending healthcare accessibility, particularly in underserved and geographically isolated populations. (49) Exploring epigenetic regulations, such as DNA methylation and histone modification angles in gastric cancer, unfolds an intricate landscape of silenced tumor suppressors and activated oncogenes, providing fertile ground for devising epigenetic modifier-based treatments with precision. (50) Altered glucose metabolism in gastric cancer, underscored by elevated aerobic glycolysis, known as the Warburg effect, marks a physiological advantage for tumor growth and survival under hypoxic conditions, channeling intrigue toward metabolism-targeted therapies for effective cancer elimination. (1) Cerebral aneurysms, which occur due to weakened blood vessels in the brain, can remain asymptomatic until they rupture. This highlights the need for proactive screening in individuals with high risk factors like hypertension, smoking, or family history of aneurysms, as early detection through imaging modalities such as MRI and CT angiography can be critical for prevention. (2) The pathophysiology of cerebral aneurysms involves complex hemodynamic changes that exert excess pressure on arterial walls, where undeveloped collagen and elastin fibers fail to provide adequate resistance, leading to focal dilation, while genetic predispositions may further exacerbate these vulnerabilities by altering vascular structural integrity. (3) Technological advancements in endovascular techniques have revolutionized the treatment of cerebral aneurysms, with the deployment of flow diverters and stent-assisted coiling offering minimally invasive options that significantly reduce recovery time, complications, and the risk of recurrence when compared to traditional surgical clipping. (4) An underlying cause of cerebral aneurysms is hemodynamic stress, which arises from turbulent blood flow, primarily at bifurcations of cerebral arteries where high shear stress leads to endothelial injury and subsequent vascular wall remodeling, setting the stage for aneurysm formation as the vascular architecture becomes compromised. (5) Ruptured cerebral aneurysms are a cause of subarachnoid hemorrhage, a serious clinical condition associated with elevated mortality and morbidity, where rapid intervention is crucial. Key symptoms like sudden severe headache, neck stiffness, and altered consciousness should prompt immediate diagnostic evaluations including CT scan and lumbar puncture. (6) The genetic factors contributing to cerebral aneurysms can include mutations in genes related to connective tissue formation such as COL3A1, which disrupts collagen synthesis leading to weakened arterial walls, highlighting the importance of genetic counseling for at-risk individuals and their families. (7) Early signs of an unruptured cerebral aneurysm might present subtly, with neurological deficits manifesting as cranial nerve palsies, localized headaches, or transient visual disturbances, a situation that necessitates vigilant clinical evaluations and neuroimaging where high-resolution detectors can reveal early aneurysmal changes. 8. Risk factors for cerebral aneurysms include modifiable lifestyle influences such as smoking, which accelerates atherosclerosis and hypertension by promoting endothelial dysfunction, along with non-modifiable factors like age and female gender. Therefore, lifestyle modification and regular screening are integral to disease management and prevention. 9. In cases where surgical intervention is indicated, microsurgical clipping requires precise intracranial navigation to apply a titanium clip at the neck of the aneurysm, effectively isolating it from cerebral circulation to prevent rupture, significantly lowering the chances of hemorrhagic events with a relatively low complication rate. 10. Intracranial pressure (ICP) monitoring is critical in patients with suspected or confirmed ruptured cerebral aneurysms, as elevated ICP can lead to compromised cerebral perfusion and herniation. Aggressive management with mannitol, hypertonic saline, or CSF drainage may be necessary to maintain optimal cerebral hemodynamics. 11. Dual antiplatelet therapy is recommended post-coiling in aneurysm management to prevent thromboembolic complications, as the presence of foreign material in the cerebral circulation can stimulate platelet aggregation and thrombus formation, which might otherwise negate the benefits of endovascular repair. 12. The detection of cerebral aneurysms has been greatly improved with the use of 3D rotational angiography, which provides high-resolution images that assist in assessing aneurysm morphology and characteristics to aid clinicians in formulating customized intervention strategies, thereby enhancing patient outcomes. 13. With growing evidence of inflammation contributing to aneurysm formation, researchers are exploring pharmacotherapeutics aimed at mitigating inflammatory pathways, as inflammatory cytokines like TNF-alpha and IL-6 play a significant role in destabilizing the vascular matrix and facilitating aneurysmal growth. 14. Vasospasm is a common sequel to subarachnoid hemorrhage caused by cerebral aneurysm rupture, where intense cerebral artery vasoconstriction can lead to ischemic complications. Treatment approaches like nimodipine administration aim to alleviate these occurrences by inhibiting calcium influx into vascular smooth muscle cells. 15. Asymptomatic patients with small cerebral aneurysms often undergo a watchful waiting approach, where routine non-invasive imaging studies like MR angiography are employed at regular intervals to monitor aneurysm growth and the potential requirement for intervention, thus minimizing unnecessary surgical risks in stable cases. 16. Histological examination of aneurysmal sacs has shown macrophage infiltration and apoptosis within the medial layer, suggesting that therapeutic approaches targeting apoptotic pathways may hold promise in stabilizing aneurysmal walls and preventing subsequent enlargement or rupture. 17. The interplay of genetics and environment in cerebral aneurysm pathogenesis is becoming clearer with genome-wide association studies identifying loci like 9p21.3 associated with vascular disease susceptibility, promoting avenues for personalized medicine and targeted therapies for high-risk individuals. Hypertension is a primary contributor to the formation and rupture of cerebral aneurysms, as chronic pressure overload results in endothelial injury and vascular remodeling, necessitating stringent blood pressure control and antihypertensive therapy as preventive measures in patients with known or suspected aneurysmal disease. 19. Dietary modification, including reducing sodium intake and increasing fruit and vegetable consumption, may lower aneurysm formation risk by mitigating hypertension and vascular inflammation, thereby complementing clinical management strategies and enhancing overall vascular health outcomes. 20. Neurointerventionalists are at the forefront of treating stable cerebral aneurysms with cutting-edge techniques that include the use of embolic agents or coils engineered to promote thrombosis within the aneurysm sac, effectively excluding it from circulation and reducing the likelihood of future rupture. 21. Advances in computational fluid dynamics modeling allow researchers to simulate blood flow patterns within cerebral vasculature, offering insights into the hemodynamic forces that contribute to aneurysm formation and influencing the design of novel flow-modifying devices for individualized aneurysm management. 22. Effective public awareness campaigns and education initiatives about cerebral aneurysm symptoms and risk factors play a crucial role in early detection and intervention, as they empower individuals to seek timely medical evaluations and adhere to preventive health measures, reducing overall aneurysm-related morbidity. 23. Postoperative management of cerebral aneurysm patients focuses heavily on rehabilitation therapies, which might include physical, occupational, or cognitive therapies, to address any neurological deficits or impairments resulting from aneurysm rupture or surgical intervention, facilitating improved functional recovery. 24. The presence of multiple cerebral aneurysms in individuals is not uncommon, necessitating a comprehensive diagnostic approach that involves advanced imaging studies to map the entirety of the cerebral vasculature, ensuring all potential sites of aneurysm formation are identified and appropriately managed. 25. Pharmacological agents like statins, known for their lipid-lowering effects, are being investigated for their vascular protective properties, which might extend to reducing the growth and rupture risk of cerebral aneurysms by enhancing endothelial function and reducing vascular inflammation. 26. Epidemiological studies reveal regional variations in cerebral aneurysm prevalence and rupture rates, likely reflecting differences in genetic predispositions, lifestyle factors, and healthcare access, underscoring the need for tailored public health strategies to address these disparities and improve regional outcomes. 27. Imaging biomarkers are being developed to enhance the prediction of cerebral aneurysm rupture risk, with studies investigating the correlation between aneurysm wall enhancement on MRI and instability, which could guide clinical decision-making and the timing of interventional therapies. 28. With family history being a significant risk factor for cerebral aneurysms, first-degree relatives of affected individuals are likely to benefit from early screening strategies, helping to identify potentially life-threatening aneurysms before they rupture and in settings where genetic counseling and testing are available. 29. Innovative biodegradable stents are the subject of ongoing research aimed at decreasing long-term thrombogenicity and foreign body reactions associated with aneurysm repair, offering the potential for safer, more effective long-term outcomes in patients undergoing endovascular treatment. 30. Cognitive outcomes post-aneurysm rupture depend on rupture severity, treatment modality, and promptness of medical intervention, with comprehensive neuropsychological assessments and supportive therapies being essential to improve cognitive recovery and enhance patients' quality of life. 31. Artificial intelligence and machine learning algorithms are increasingly being applied to cerebral aneurysm imaging for enhanced diagnostic accuracy, by improving the identification of aneurysm characteristics that indicate rupture propensity, thus optimizing individual patient management plans. 32. Glucocorticoids have emerged as a potential therapeutic option in the acute management of cerebral aneurysms by reducing perianeurysmal edema and inflammatory response, although their long-term efficacy and safety profile require further clinical investigation to inform treatment protocols. 3. The role of neurotransmitters in cerebral aneurysm rupture is being explored, with particular attention to serotonin and its effects on vascular tone and platelet aggregation, possibly revealing novel pharmacological targets for the prevention of aneurysm-related hemorrhagic events. 34. Interdisciplinary teams consisting of neurologists, neurosurgeons, and interventional radiologists are crucial in the comprehensive management of cerebral aneurysms, facilitating personalized treatment pathways that integrate medical, surgical, and rehabilitative care tailored to patient-specific health profiles. '35. Cerebrovascular autoregulation can be disrupted post-aneurysm intervention, necessitating meticulous monitoring of cerebral perfusion pressure to prevent secondary ischemic injury, with management strategies involving both pharmacologic and supportive measures to stabilize cerebral blood flow and oxygenation. '36. Nutrition plays a role in aneurysm recovery, where a diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory foods can support vascular health, aiding in the reduction of sequelae associated with aneurysm formation and rupture, and contributing to more favorable long-term outcomes. '37. Serological biomarkers such as matrix metalloproteinases are under investigation for their potential to predict cerebral aneurysm growth and rupture, as their involvement in extracellular matrix degradation may provide insights into aneurysm pathogenesis and offer targets for therapeutic intervention. '38. The development of patient simulation models in cerebral aneurysm education provides interactive opportunities for medical professionals to rehearse complex scenarios, enhance diagnostic acuity, and practice innovative treatment techniques, thereby improving clinical skills and patient safety. '39. The connection between brain aneurysms and polycystic kidney disease is well documented. Specifically, individuals with autosomal dominant polycystic kidney disease have an increased risk of intracranial aneurysms due to inherent vascular abnormalities, necessitating proactive screening measures. '40. Environmental influences such as pollution and low socioeconomic status have been implicated in cerebral aneurysm development, possibly through effects on systemic inflammation and access to healthcare, highlighting the importance of addressing social determinants of health in prevention strategies. '41. MicroRNAs are emerging as key regulatory molecules in the pathogenesis of cerebral aneurysms, where their modulation of gene expression related to vascular remodeling and inflammatory processes may provide novel therapeutic targets to halt or reverse aneurysmal progression. '42. Nanomedicine is finding application in cerebral aneurysm therapy, with nanoparticulate systems being designed to deliver drugs or genes directly to aneurysmal sites, thereby enhancing localized action while reducing systemic side effects, opening new frontiers for minimally invasive treatment strategies. '43. For patients contraindicated for surgery, balloon-assisted coiling provides a viable alternative for aneurysm management, where a balloon is temporarily inflated in the parent vessel to aid coil placement, proving particularly effective in achieving complete occlusion of wide-necked aneurysms. '44. The connection between hormonal factors and aneurysm formation, particularly in postmenopausal women, is under scrutiny, with studies examining the protective role of estrogen on vascular integrity, potentially offering insights into hormone replacement therapy as a preventive measure against aneurysm development. '45. Workplace challenges faced by individuals with cerebral aneurysms require specific rehabilitation strategies, ensuring an effective return-to-work process that addresses cognitive, emotional, and physical reconditioning, thereby enabling seamless reintegration and productive living post-intervention. '46. Circulating endothelial cells have been proposed as potential biomarkers for detecting aneurysm instability, providing a non-invasive means to assess endothelial damage and disruption, which are critical factors in aneurysm integrity and associated hemorrhagic risk. '47. The use of computational fluid dynamics in analyzing hemodynamic impacts post-endovascular therapy is essential, as these models provide valuable insights into flow modification effects, contributing to the refinement of devices and techniques aimed at improving treatment efficacy and patient outcomes. Cross-disciplinary research involving epidemiologists, geneticists, and neuroscientists is pivotal in uncovering the multifaceted etiologies of cerebral aneurysms, building comprehensive models that integrate genetic, environmental, and lifestyle factors to inform preventative healthcare policies. Preclinical studies using animal models of cerebral aneurysms are vital for understanding disease progression and testing potential therapeutic approaches, providing a controlled environment to investigate pathophysiological mechanisms and evaluate the translational potential of novel treatments. The future of cerebral aneurysm management lies in personalized medicine, where advancements in genomic profiling and biomarker identification will facilitate tailored therapeutic interventions and preventive strategies, ensuring optimal outcomes based on individual genetic, physiological, and lifestyle contexts. A cerebral aneurysm is a localized dilation in a blood vessel within the brain, often forming at artery junctions due to intrinsic weaknesses in the vessel wall that can be exacerbated by conditions like hypertension and atherosclerosis, raising the risk of rupture, which can lead to a potentially life-threatening hemorrhagic stroke. The rupture of a cerebral aneurysm results in a subarachnoid hemorrhage, characterized by a sudden, severe headache often described as a thunderclap, or worst headache of life, due to the rapid increase in intracranial pressure, with symptoms potentially including neck stiffness, photophobia, nausea, vomiting, and impaired consciousness. Many cerebral aneurysms remain asymptomatic until rupture, but unruptured aneurysms may occasionally cause symptoms by pressing on surrounding brain tissue or nerves, potentially leading to focal neurological deficits such as vision changes, pain above or behind an eye, or numbness on one side of the face. The pathophysiology of cerebral aneurysms involves a complex interplay of genetic factors, hemodynamic stress, inflammation, and extracellular matrix remodeling that weakens the blood vessel wall, primarily affecting the internal elastic lamina and media layers, making the vessel more prone to dilation and rupture. The gold standard for diagnosing cerebral aneurysms non-invasively is magnetic resonance angiography, MRA, or computed tomography angiography, CTA, which provides detailed images of blood vessels in the brain, allowing clinicians to identify even small aneurysms and assess their size, shape, and location. Risk factors for the development and rupture of cerebral aneurysms include smoking, hypertension, family history, age over 40, female gender, alcohol abuse, and certain genetic disorders such as polycystic kidney disease or Ehlers-Danlos syndrome, which can contribute to connective tissue weaknesses. Management of unruptured cerebral aneurysms involves a careful balance between regular monitoring and surgical intervention, with decisions influenced by the size, location, morphology of the aneurysm, and patient-related factors such as age, health status, and risk tolerance, to minimize potential rupture complications. Endovascular coiling is a minimally invasive procedure commonly used to treat cerebral aneurysms by inserting a catheter through the blood vessels to the site of the aneurysm, where detachable coils are placed to induce clotting, effectively sealing off the aneurysm and reducing the likelihood of rupture. Surgical clipping of a cerebral aneurysm involves an open craniotomy to access the aneurysm directly, allowing a neurosurgeon to place a metal clip at the neck of the aneurysm, thereby isolating it from the parent vessel, which is a more invasive but often definitive treatment compared to endovascular techniques. 10. The choice between coiling and clipping may depend on various factors, such as the aneurysm's size, shape, and location, as well as the patient's overall health and the availability of experienced surgical and endovascular teams, with both methods having their unique risks and benefits in terms of efficacy and recovery. Cerebral vasospasm is a potential complication following the rupture of a cerebral aneurysm, where the sudden release of blood into the subarachnoid space leads to narrowing of cerebral arteries, which can significantly reduce blood flow and cause further brain injury, often peaking 3 to 14 days after the initial hemorrhage. Nimodipine, a calcium channel blocker, is routinely administered orally in the acute management of subarachnoid hemorrhage from a ruptured cerebral aneurysm to prevent or mitigate the effects of cerebral vasospasm and associated ischemic deficits, despite its hypotensive effect requiring cautious monitoring of blood pressure. The Hunt and Hess scale in the World Federation of Neurosurgical Societies (WFNS) scale are clinical grading systems used to assess the severity of aneurysmal subarachnoid hemorrhage, helping to predict outcomes by evaluating factors like the patient's level of consciousness, presence of focal neurological deficits, and overall clinical condition. The Fisher scale, based on the amount and distribution of blood seen on initial CT scans, is used to grade subarachnoid hemorrhage from a ruptured cerebral aneurysm, offering prognostic information regarding the likelihood of vasospasm, with higher grades indicating an increased risk and need for vigilant monitoring and intervention. Seizures may occur after the rupture of a cerebral aneurysm due to the acute brain injury and cortical irritation caused by subarachnoid hemorrhage or increased intracranial pressure, necessitating prophylactic or therapeutic anticonvulsant medication in some patients to manage and prevent further neurological complications. Genetic testing for individuals with familial history of cerebral aneurysms may help identify underlying hereditary factors, especially in cases of connective tissue disorders like Marfan syndrome, providing insights into potential predispositions and enabling proactive monitoring or early intervention to manage increased rupture risks. Acute management of a ruptured cerebral aneurysm focuses on stabilizing the patient's condition through airway management, blood pressure control, intracranial pressure monitoring, and potentially early surgical intervention to prevent rebleeding and manage complications that could worsen patient outcomes. Secondary complications like hydrocephalus, an accumulation of cerebrospinal fluid due to impaired reabsorption following subarachnoid hemorrhage, may require the placement of a temporary external ventricular drain or a permanent ventriculoperitoneal shunt to alleviate pressure in the ventricles, preventing further damage to brain tissue. Lifestyle modifications, including smoking cessation, alcohol moderation, regular blood pressure monitoring, and a heart-healthy diet, are recommended for individuals at risk of cerebral aneurysms to reduce modifiable risk factors associated with aneurysm development and rupture, contributing to improved long-term outcomes. High-resolution vessel wall imaging using MRI can provide insights into the morphology and histopathology of cerebral aneurysms, allowing the visualization of intraluminal thrombus, aneurysm wall inflammation, or instability, thus helping in the stratification of rupture risk and guiding clinical management decisions. Computational fluid dynamics is an emerging tool that allows the assessment of hemodynamic forces at play within and around cerebral aneurysms, providing valuable data on flow patterns that may influence aneurysm growth and rupture risk, and can aid in the customization of treatment approaches or the development of new interventions. 22. The role of inflammation in cerebral aneurysm pathogenesis is under active research, with evidence suggesting that an inflammatory response within the aneurysm wall contributes to wall degeneration and rupture, highlighting potential therapeutic targets for anti-inflammatory agents that could stabilize aneurysms or slow their progression. 23. In the acute phase of cerebral aneurysm rupture, managing intracranial pressure is paramount, often requiring sedation, hyperosmolar therapy, and careful ventilation strategies to ensure adequate cerebral perfusion, while avoiding interventions that could exacerbate swelling or lead to secondary brain injury. 24. Advances in endovascular technology, such as flow-diverting stents, provide alternatives for treating wide-necked or complex cerebral aneurysms, working by redirecting blood flow away from the aneurysm sac, promoting healing and vessel remodeling, and broadening the options for minimally invasive treatment. 25. The size and shape of a cerebral aneurysm are critical determinants in assessing rupture risk, with large, greater than 7 mm, and irregularly shaped aneurysms are those exhibiting daughter sacs, carrying a higher propensity for rupture compared to small, smooth-walled aneurysms, which may warrant closer monitoring or more immediate intervention. 1. Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. 2. The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. 3. Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. 4. The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. 5. Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. 6. The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. 7. The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. 8. 8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. 11. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. 21. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. 22. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. 23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. 24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. 31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. 34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. 35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. 36. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. 37. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. 38. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. 39. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. 40. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. 41. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. 42. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. 43. Innovative surgical techniques in skull-based tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. 44. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. 46. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. 1. Cardiac arrhythmia refers to any disruption in the heart's normal rhythm, commonly resulting from chaotic electrical impulses within the heart muscle, which can lead to various symptoms such as palpitations, dizziness, syncope, or in severe cases, sudden cardiac death, emphasizing the importance of comprehensive cardiovascular examination and electrocardiogram (ECG) evaluation as part of the diagnostic process. 2. The pathophysiology of cardiac arrhythmias often involves alterations in ion channel function, which can be attributed to genetic mutations, myocardial ischemia, or structural heart changes, leading to the development of conditions like atrial fibrillation, ventricular tachycardia, and other conduction disorders that necessitate tailored therapeutic strategies to mitigate risks and manage symptoms. 3. Atrial fibrillation, the most prevalent form of cardiac arrhythmia, is characterized by rapid, irregular beating of the atrial chambers and can increase the risk of stroke and heart failure, making anticoagulation therapy an essential component of management alongside rate control medications like beta blockers or calcium channel blockers to improve patient outcomes. 4. Ventricular fibrillation is a life-threatening cardiac arrhythmia caused by disorganized electrical activity in the ventricles, leading to cardiac arrest if not promptly treated with immediate defibrillation and advanced cardiac life support measures, underscoring the critical need for emergency response and intervention. 5. The diagnostic approach for cardiac arrhythmias often involves Holter monitoring or event monitors, which provide continuous ECG recordings over 24 hours or longer, enabling clinicians to capture transient episodes of arrhythmia, correlating them with symptoms and aiding in the accurate identification of both the type and cause of arrhythmia. 6. Supraventricular tachycardia, SVT, is a common arrhythmia originating above the ventricles, characterized by an abnormally fast heartbeat, often exceeding 150 beats per minute, which can be managed acutely with vagal maneuvers, adenosine, or, in recurrent cases, catheter ablation, highlighting the importance of individualized patient care. 7. Long QT syndrome is a potentially dangerous arrhythmia disorder that prolongs ventricular repolarization, predisposing individuals to torsades de pointes, a form of polymorphic ventricular tachycardia, necessitating regular monitoring, avoidance of QT prolonging medications, and possibly the use of beta blockers or implantable cardioverter defibrillators, ICDs, in high-risk patients. 8. Bradycardia is an arrhythmic condition defined by a heart rate of fewer than 60 beats per minute, which can be physiological or pathological, requiring thorough assessment to determine if management with pacemaker implantation is required to prevent symptoms like fatigue, dizziness, or syncope associated with insufficient cardiac output. 9. Wolff-Parkinson-White syndrome is an arrhythmia condition caused by an accessory pathway that allows electrical impulses to bypass the heart's normal conduction system, leading to episodes of tachycardia that can be effectively treated with catheter ablation to prevent recurrence and improve quality of life. Ten. Premature ventricular contractions, PVCs, are early heartbeats originating in the ventricles, and while often benign, frequent PVCs should be evaluated with an electrocardiogram and echocardiogram to rule out underlying structural heart disease. Beta blockers may be considered if symptomatic or if there is an associated cardiomyopathy. 11. Carotid sinus hypersensitivity, a cause of bradyarrhythmia, results from exaggerated response to stimulation of the carotid sinus, leading to episodes of syncope or presyncope that can impact quality of life and require head-up tilt testing for diagnosis, with dual-chamber pacemaker implantation being an effective treatment for recurrent symptomatic cases. The ventricular tachycardia storm, characterized by frequent episodes of ventricular tachycardia requiring repeated interventions within a short period, is a critical arrhythmic emergency demanding aggressive treatment, including antiarrhythmic drugs, catheter ablation, and in some cases, sympathetic blockade, highlighting the importance of prompt therapy to prevent cardiomyopathy. 13. Sinus tachycardia, a common arrhythmic condition where the heart rate exceeds 100 beats per minute, can result from physiological responses to exercise or stress, but requires assessment to exclude underlying cardiac or systemic pathology, with management focusing on treating the root causes, reducing anxiety, and avoiding stimulants. 14. Atrioventricular nodal reentrant tachycardia, AVNRT, is a type of reentrant supraventricular tachycardia that can cause palpitations and lightheadedness, often diagnosed through characteristic ECG findings and effectively managed with the use of adenosine, rate-controlling medications, or radiofrequency catheter ablation for definitive treatment. 15. Atrial flutter, an arrhythmia characterized by a rapid and regular atrial rate, typically presents with a sawtooth pattern on ECG and can lead to rapid ventricular responses, necessitating rate control or rhythm control strategies similar to those used in atrial fibrillation, including electrical cardioversion, antiarrhythmic drugs, and potentially catheter ablation. 16. The Brugada syndrome is an inherited arrhythmic disorder with a distinct ECG pattern predisposing individuals to sudden cardiac death, particularly at rest or during sleep, where risk stratification is critical, and patients may benefit from ICD implantation to prevent life-threatening arrhythmic events despite being often asymptomatic. 17. Junctional rhythm refers to an arrhythmic condition where the heart's electrical activity originates in or near the atrioventricular node, leading to slower heart rates and occasionally retrograde atrial conduction, necessitating evaluation for causes such as digitalis toxicity or intrinsic conduction system disease with management tailored to the underlying etiology. 18. The multifocal atrial tachycardia, typically associated with underlying lung disease or metabolic disturbances, presents as an irregular rhythm with at least 3 different P-wave morphologies on ECG, requiring a multifaceted approach to treatment that includes correction of underlying conditions and the cautious use of rate-controlling agents. 19. Antiarrhythmic drugs play a pivotal role in the management of various arrhythmias, classified into different classes based on their electrophysiological properties, necessitating careful selection and monitoring due to potential proarrhythmic effects and interactions with other medications, emphasizing their use in conjunction with non-pharmacological methods when appropriate. 20. A V-block, or atrioventricular block, is a type of heart block where the electrical conduction between the atria and ventricles is impaired, which can range from first-degree blocks with delayed conduction to third-degree blocks with complete dissociation, requiring pacemaker intervention in symptomatic high-grade blocks to maintain adequate hemodynamic stability. 21. Sick sinus syndrome, involving dysfunction of the sinus node, can result in episodes of bradycardia, sinus arrest, or alternating bradycardia-tachycardia syndrome, with symptomatic patients often requiring the implantation of a permanent pacemaker to alleviate symptoms and improve heart rate responses during daily activities. Catecholaminergic polymorphic ventricular tachycardia is an inherited condition where adrenergic stress can trigger life-threatening arrhythmias in structurally normal hearts, mandating a combination of lifestyle modifications, beta blockers for arrhythmia prevention, and ICDs for high-risk patients to prevent sudden cardiac events during emotional or physical stress. 23. Digoxin, a cardiac glycoside used in the management of certain arrhythmias and heart failure, works by increasing vagal tone and improving heart contractility. However, it demands careful dose adjustment and monitoring to avoid toxicity characterized by gastrointestinal disturbances, visual changes, and potentially life-threatening arrhythmias due to its narrow therapeutic window. 24. Transvenous pacemaker insertion is a standard intervention for symptomatic bradyarrhythmias, involving the placement of pacing electrodes through the venous system to the heart, providing reliable electrical stimulation to correct slow heart rates, with advancements in technology offering options for dual-chamber or even leadless pacemakers tailored to patient-specific needs. 25. Idiopathic ventricular fibrillation refers to VF occurring in the absence of identifiable structural heart disease or known trigger factors, necessitating comprehensive evaluation to exclude reversible causes or genetic predispositions, with ICD therapy often being the cornerstone of prevention against recurrence and sudden cardiac death. 26. The tilt table test is a diagnostic tool used to evaluate unexplained episodes of syncope or presyncope, designed to provoke symptoms through postural changes, allowing assessment of autonomic function and vasoactive responses, with results guiding treatment options like lifestyle changes, medical therapies, or pacemaker implantation, particularly in neurally mediated syncope. 27. Atrial tachycardia, resulting from an abnormal focus of impulse generation outside the sinus node, often appears as regular narrow complex tachycardia on ECG, and management may involve pharmacological agents like calcium channel blockers or beta blockers and consider non-pharmacological approaches like catheter ablation for long-term control. 28. Amiodarone is a broad-spectrum antiarrhythmic agent effective against a wide range of arrhythmias, including atrial fibrillation and ventricular tachycardia, although its use may be limited by side effects such as thyroid dysfunction, pulmonary fibrosis, and liver toxicity, demanding vigilant long-term monitoring and consideration of risk-benefit balance. 29. AVRT, or atrioventricular reciprocating tachycardia, commonly results from an accessory pathway like in Wolff-Parkinson-White syndrome, presenting on ECG with delta waves, and treatment options include vagal maneuvers, pharmacological interventions, or catheter ablation to sever the accessory pathway for definitive resolution of the arrhythmia. 30. The Maze procedure, a surgical intervention for atrial fibrillation, involves creating a series of strategically placed incisions or ablations in the atria to disrupt reentrant circuits and restore sinus rhythm, typically reserved for patients undergoing cardiac surgery for other indications or those who have failed catheter-based therapies. 31. Beta blockers, often used in the management of various arrhythmias, work by blocking beta-adrenergic receptors, reducing heart rate, and decreasing myocardial oxygen demand, proving effective in rate control for atrial fibrillation and preventing recurrent ventricular arrhythmias, with the selection of specific agents guided by patient comorbidities and cardiovascular risk. 32. Lown-Ganon-Levine syndrome is characterized by a short PR interval without the presence of delta waves on the ECG, resulting from accelerated atrioventricular conduction, with management focusing on symptom alleviation through the use of medications like verapamil or catheter ablation, tailored to individual patient presentation and pathway determination. 3. Electrolyte imbalances, such as hypokalemia and hypomagnesemia, are common reversible causes of arrhythmias, leading to increased cardiac excitability and the risk of ventricular tachyarrhythmias, necessitating prompt correction of deficiencies through oral or intravenous supplementation alongside continuous cardiac monitoring for patients at risk. 34. The physiological basis of reentry arrhythmias, a frequent mechanism in conditions like atrial flutter and ventricular tachycardia, involves the presence of anatomical or functional circuit pathways that allow a reentrant current of electrical activity, perpetuating tachycardia, and is typically managed through targeted ablation therapy to interrupt these circuits. 35. Sinus node dysfunction is often implicated in nocturnal bradycardia, resulting from an interplay of autonomic factors and sleep-disordered breathing, highlighting the importance of assessing for conditions like obstructive sleep apnea, which may exacerbate this arrhythmia, with therapeutic approaches including positive airway pressure therapy and pacemaker considerations for persistent symptoms. 36. In atrial fibrillation management, novel oral anticoagulants, NOACs, play a key role in stroke prevention, offering alternatives to traditional warfarin therapy free from frequent INR monitoring, with choices of dabigatran, rivaroxaban, apixaban, or edoxaban being driven by patient renal function, bleeding risks, and individual patient preferences. 37. Familial atrial fibrillation, a heritable form of arrhythmia, highlights the role of genetic predisposition in arrhythmogenesis, necessitating genetic counseling and consideration of vigilance in family members, with treatment strategies paralleling those of sporadic atrial fibrillation, emphasizing the balance of rate versus rhythm control approaches. 38. The implantable cardioverter defibrillator, ICD, remains a cornerstone in preventing sudden cardiac death in high-risk population segments like those with ischemic cardiomyopathy or inherited channelopathies, capable of delivering life-saving shocks or anti-tachycardia pacing to terminate ventricular tachyarrhythmias and restore sinus rhythm. 39. Premature atrial contractions, PACs, frequent ectopic beats originating in the atria, are usually benign but can serve as a precursor to more significant arrhythmias like atrial fibrillation, with lifestyle modifications being advised if symptomatic and consideration of beta blockers or calcium channel blockers for suppression. 40. The vagal maneuvers, simple physical techniques aimed at stimulating the vagus nerve, can induce reflexive slowing of heart rate, proving advantageous in terminating reentrant arrhythmias like supraventricular tachycardia, and should be included in initial therapeutic instruction for patients at risk of acute episodes alongside medical therapies. 41. QT interval prolongation, an ECG finding indicative of delayed cardiac repolarization, poses a significant arrhythmia risk for developing torsades de pointes, requiring careful evaluation and avoidance of QT prolonging substances, with therapeutic correction focusing on withdrawal of offending agents, electrolyte repletion, or use of specific antiarrhythmics. 42. The Holter monitor, a portable device providing continuous ECG recording over a day or more, plays a vital role in uncovering paroxysmal arrhythmias difficult to detect with standard examinations, guiding diagnosis and therapeutic decisions by correlating symptomatic episodes with underlying cardiac rhythm abnormalities. 43. Dopamine receptor agonists, sometimes involved in the management of Parkinson's disease or prolactinomas, carry the potential for inducing arrhythmic events through disturbance of sympathetic and parasympathetic balance, underscoring the need for baseline cardiac assessment and ongoing ECG monitoring to prevent adverse cardiac outcomes. 44. Accessory pathways in the heart predispose to arrhythmias by allowing electrical impulses to bypass normal conduction, creating scenarios like Wolff-Parkinson-White syndrome, with catheter ablation offering definitive management by selectively destroying the pathway, leading to permanent resolution and prevention of recurrence. 45. Recurrence of atrial fibrillation post-cardioversion is common and often necessitates the use of antiarrhythmic medications for rhythm maintenance, underscoring the need for consideration of rate control, lifestyle interventions, and assessment of secondary causes to sustain sinus rhythm and improve patient quality of life. '46. Ventricular premature beats, VPBs, or extrasystoles are isolated electrical impulses originating in the ventricles, commonly detected on routine ECGs, and while often benign, warrant evaluation for possible underlying heart disease in symptomatic patients or those with frequent VPBs, utilizing treatment strategies like beta blockers if deemed necessary. '47. The electrophysiological study, EPS, serves as a diagnostic tool for elucidating complex arrhythmia mechanisms, guiding therapeutic interventions by mapping cardiac electrical activity, and determining the exact location of aberrant pathways, forming a basis for decisions regarding catheter ablation or device therapy in refractory cases. '48. Respiratory sinus arrhythmia, a benign variation of heart rate with breathing, reflects the normal interaction between the respiratory cycle and the parasympathetic nervous system, often more pronounced in younger individuals and athletes, representing a physiological, non-pathological finding with no need for clinical intervention. '49. QRS widening on ECG signifies impaired conduction through the ventricles, seen commonly in bundle branch blocks, electrolyte imbalances, or drug effects, requiring assessment to determine if chronic or acute changes necessitate further cardiac workup, with specific treatment guided by underlying etiology and associated symptoms. '50. The Has-Bled score is a clinical tool used to estimate bleeding risk in patients with atrial fibrillation undergoing anticoagulation therapy, aiding in individualized risk assessment and optimization of therapeutic strategies, balancing the benefits of stroke mitigation against the potential for major bleeding complications. '1. Colon cancer, also known as colorectal cancer, is characterized by malignant growths that arise in the lining of the large intestine, initiated by genetic mutations and environmental factors, progressing in a multi-step sequence from benign polyps to invasive cancer, and is heavily influenced by lifestyle factors such as diet and physical activity. '2. The clinical presentation of colon cancer commonly includes symptoms like rectal bleeding, changes in bowel habits such as diarrhea or constipation, unintended weight loss, and persistent abdominal discomfort, though early-stage colon cancer is often asymptomatic, highlighting the importance of regular screening for early detection. '3. One vital innovation in colon cancer screening is the fecal immunochemical test, FIT, a non-invasive test that detects hidden blood in stool using antibodies specific to human hemoglobin, offering a highly sensitive option for annual screening that enhances early detection and reduces mortality significantly. '4. The pathophysiology of colon cancer is deeply rooted in the adenoma-carcinoma sequence, where benign adenomatous polyps undergo genetic alterations, such as APC, KRAS, and P53 mutations, leading to dysplastic changes in progression to carcinoma, underscoring the importance of polypectomy in interrupting this sequence. '5. Surgical resection remains the cornerstone of curative treatment for localized colon cancer, with the extent of surgery tailored to the cancer's location and stage. Minimally invasive techniques like laparoscopic or robotic surgery are increasingly used for their benefits in reducing postoperative recovery time and complications. '6. Adjuvant chemotherapy, particularly with fluoropyrimidines such as 5-fluorouracil in combination with oxaliplatin, is indicated for stage 3 colon cancer following surgery to eliminate microscopic remnants of cancer cells, decreasing recurrence risk and improving survival outcomes, although it is generally not recommended in stage 1 cases. Recent breakthroughs in genetic testing have unveiled the role of mismatch repair, MMR, gene mutations and microsatellite instability, MSI, in colon cancer, leading to the implementation of universal MSI testing in patients with newly diagnosed colon cancer to guide immunotherapy decisions. Targeted therapies have revolutionized the management of metastatic colon cancer, particularly monoclonal antibodies like bevacizumab, which inhibits vascular endothelial growth factor, VEGF, and thus tumor angiogenesis, and cetuximab, which targets the epidermal growth factor receptor, EGFR, depending on the tumor's ROS mutation status. Immunotherapy has emerged as a pivotal treatment strategy for mismatch repair deficient colon cancer, particularly using immune checkpoint inhibitors such as pembrolizumab, which enhance the host immune response against tumor cells and are primarily useful in patients with metastatic and unresectable disease. Colonoscopy is the gold standard in colon cancer screening, allowing for direct visualization and removal of precancerous polyps, and while sedation is typically employed to enhance patient comfort, advances such as virtual colonoscopy using CT imaging are being explored for those who cannot undergo conventional techniques. 11. A groundbreaking approach in the prevention of colon cancer involves the use of aspirin, which has been shown through studies such as the CAP, Colorectal Adenoma Carcinoma Prevention Program, trials, to reduce adenoma formation and consequently, cancer incidence in individuals with hereditary cancer syndromes. Surveillance colonoscopy protocols post-polypectomy or cancer resection are critical and are tailored based on the initial findings, such as polyp number, size, and histological characteristics, to monitor for new polyp formation or recurrence of cancer, showing the dynamic nature of the surveillance landscape. 13. A lesser-known presentation of colon cancer is the occurrence of paraneoplastic syndromes, where the cancer produces substances leading to remote effects such as Trousseau's syndrome, characterized by unexplained venous thrombosis, emphasizing the need to consider malignancy in atypical clinical presentations. Genetic syndromes such as Lynch syndrome, hereditary non-polyposis colorectal cancer, characterized by germline mutations in MMR genes, predispose individuals to early-onset colon cancer, stressing the importance of genetic counseling and testing for at-risk families to implement appropriate surveillance strategies. Emerging data suggests the pivotal role of the gut microbiome in colon cancer development, where dysbiosis and the presence of certain bacterial species such as Fusobacterium nucleatum can enhance tumorigenesis by creating a pro-inflammatory environment, offering potential new avenues for prevention and treatment. A unique manifestation of advanced colon cancer is the formation of malignant bowel obstruction, where the tumor obstructs intestinal flow, requiring urgent intervention that may involve surgical resection, endoscopic stenting, or decompression via nasogastric tubes to alleviate symptoms and improve patient quality of life. Tumor markers such as carcinoembryonic antigen, C, play a critical role in monitoring colon cancer treatment response and recurrence, especially in metastatic cases, although their nonspecific nature makes them less valuable for initial diagnosis, highlighting the nuance in biomarker utilization. 18. A significant innovation in personalized medicine for colon cancer involves the use of circulating tumor DNA, ctDNA, as a non-invasive biomarker that has shown promise in identifying minimal residual disease, guiding adjuvant therapy decisions, and providing real-time insights into tumor dynamics and resistance mechanisms. 19. Occupational risk factors for colon cancer, such as sedentary work environments and prolonged sitting, have been identified as contributing to increased risk, emphasizing the need for public health interventions that encourage regular physical activity as a preventive measure alongside dietary modifications. 20. In a novel approach to colon cancer treatment, radiofrequency ablation and cryoablation are being used selectively to target and destroy hepatic metastasis, demonstrating the expansion of local ablative technologies and providing additional options for patients with limited metastatic disease. 21. Advances in imaging, such as diffusion-weighted MRI, have improved the preoperative assessment of colon cancer by offering superior soft tissue contrast, enabling more accurate staging and involvement of surrounding structures, which directly influences surgical planning and prognostication. 22. Recognizing the impact of diet and nutrition on colon cancer, studies indicate that high fiber intake, along with diets rich in fruits, vegetables, and whole grains, contributes to a lower risk of cancer development through mechanisms involving fecal bulk increase and reduction of intestinal transit time. 23. Quality of life assessments are integral to the management of colon cancer, where tools like the EORTC-QLQC30 questionnaire are employed to evaluate the patient's well-being and functional status, ensuring holistic care that extends beyond mere survival to encompass physical, emotional, and social health. 24. Colon cancer incidence has demonstrated a concerning rise in younger adults, under the age of 50, attributed to a combination of lifestyle factors and genetic predispositions, prompting a re-evaluation of screening guidelines to potentially lower the age at which screening initiates for average-risk individuals. 25. The role of inflammation in colon cancer is highlighted by conditions such as ulcerative colitis and Crohn's disease, where chronic inflammation induces dysplastic changes, necessitating a rigorous surveillance program and prophylactic colectomy considerations to mitigate cancer risk in these high-risk populations. 26. Epigenetic alterations, such as DNA methylation and histone modification, contribute significantly to colon cancer pathogenesis by silencing tumor suppressor genes, representing potential targets for novel therapeutic interventions aimed at reversing these changes to restore normal cellular function. 27. Herbal medicines and dietary supplements are being explored for their potential chemopreventive properties in colon cancer, with compounds like curcumin and resveratrol showing promising results in preclinical models, although clinical validation is required to confirm their efficacy and safety. 28. Disparities in colon cancer outcomes have been observed among different racial and socioeconomic groups, likely due to variations in access to healthcare, screening, and treatment options, highlighting the urgent need for equitable health policies and targeted interventions to bridge these gaps. 29. Integrated care models involving multidisciplinary teams have become a cornerstone in colon cancer treatment, ensuring that patients receive coordinated and comprehensive care that spans surgical, medical, and supportive services, optimizing treatment outcomes and patient satisfaction. 30. The ability of colon cancer to metastasize to distant organs such as the liver and lungs chiefly stems from its adaptation to evade immune surveillance and spread through the lymphatic and vascular systems, presenting a major challenge that necessitates systemic therapy alongside local control measures. 31. Increasing evidence suggests that vitamin D, owing to its role in cell growth regulation and immune function, may play a protective role in preventing colon cancer, with ongoing research assessing its supplementation as a potential intervention to reduce cancer risk in deficiency states. (32) Patients with colon cancer have shown improved prognostic outcomes with regular follow-up and implementation of survivorship care plans, which include adherence to surveillance protocols, healthy lifestyle adoption, and management of long-term treatment effects, according to guidelines from oncology societies. (3) Advanced genomic profiling techniques, such as next-generation sequencing, have unveiled the complex mutational landscape of colon cancer, identifying actionable mutations and resistance mechanisms, paving the way for precision oncology strategies tailored to each patient's unique tumor profile. (34) The implementation of enhanced recovery after surgery (ERAS) protocols in colon cancer surgery has been instrumental in reducing hospital stay lengths and postoperative complications by emphasizing early mobilization, optimal nutrition, and multimodal analgesia, reflecting a shift towards patient-centered surgical pathways. (35) Lynch syndrome-associated colon cancers typically manifest a distinct pathological phenotype, characterized by poor differentiation, lymphocytic infiltration, and mucin production, contributing to differential prognosis and therapy response compared to sporadic colon cancers, underscoring the importance of molecular classification. (36) Circulating microRNAs, small non-coding RNA molecules, are emerging as promising biomarkers for early detection, prognosis, and monitoring therapeutic response in colon cancer, with their stability in bodily fluids enabling non-invasive testing advancements that could significantly transform current diagnostic practices. (37) An intriguing area of research is the role of ferroptosis, a type of programmed cell death characterized by iron-dependent lipid peroxidation, in colon cancer, offering a potential target for novel treatments aimed at inducing cancer cell death through this unique pathway. (38) The risk of metachronous colon cancer necessitates vigilant surveillance in patients with a history of colon cancer resection, as the development of new primary cancers in the remaining intestine remains a possibility, and adherence to tailored follow-up schedules is essential for early detection and intervention. (39) Nutrigenomics, the study of gene-diet interactions, is gaining traction in colon cancer research, where genetic variants may affect individual responses to dietary components, potentially informing personalized dietary recommendations that could mitigate cancer risk or progression. (40) Radiotherapy, although not a primary treatment for colon cancer due to the radiosensitivity of surrounding tissues, can be utilized in specific scenarios such as in cases of local recurrence or for palliation of symptoms, particularly when surgery and chemotherapy are not feasible options. (41) Bowel function and quality of life after colon cancer surgery are significant concerns, with some patients experiencing altered bowel habits and fecal incontinence, necessitating preoperative counseling, pelvic floor rehabilitation, and dietary interventions to address these complications effectively. (42) The discovery of cell-free DNA, released from apoptotic or necrotic tumor cells into the bloodstream, has garnered attention as an invaluable tool for non-invasive surveillance and early detection of recurrence in colon cancer patients undergoing surveillance post-treatment. (43) Advances in three-dimensional, 3D, printing technologies have found applications in colon cancer surgical planning, allowing for the creation of patient-specific anatomical models that aid in complex resection strategies, enhancing preoperative assessment and intraoperative guidance. 44. A novel therapeutic avenue being investigated involves monoclonal antibodies targeting claudins, a family of proteins overexpressed in colon cancer that contribute to tumor invasiveness and heterogeneity, showing potential in preclinical studies for slowing disease progression and enhancing standard treatment. 45. Colon cancer prevention initiatives have increasingly targeted modifiable risk factors such as obesity, which is associated with chronic inflammation and insulin resistance, with interventions promoting healthy weight management showing promise in reducing incidence rates and improving overall population health outcomes. 46. Emotional and psychological support for colon cancer patients, often overshadowed by the focus on physical treatment, plays a vital role in comprehensive care, as demonstrated in studies highlighting improved treatment adherence and quality of life when mental health resources are integrated into oncology care pathways. 47. Explorations into the role of long non-coding RNAs, LNCRNAs, in colon cancer have revealed their influence on gene expression regulation and tumor progression, offering a rich target landscape for potential therapeutic interventions aimed at modulating these non-coding regions to impede cancer development. 48. Prehabilitation programs, focused on optimizing physical and nutritional status before colon cancer surgery, have emerged as an innovative approach to improve postoperative outcomes, reducing complications, and enhancing recovery times, in line with trends towards enhancing patient resilience. 49. Colon cancer's survival outcomes have been positively impacted by the adoption of sentinel lymph node mapping, a surgical technique initially used in other malignancies, which aids in precise staging and the determination of lymph node involvement, aiding in treatment decision-making and prognostication. 50. Recent advances in organoid technology, allowing cultivation of patient-derived tumor cells in 3D cultures, have provided a powerful platform for personalized medicine in colon cancer, enabling drug testing, genetic studies, and understanding resistance mechanisms on patient-specific tumor models. 1. Hepatitis B is a viral infection primarily targeting the liver, causing both acute and chronic disease, with unique surface antigens, HBsAg, that serve as essential markers for diagnosis and monitoring. And while its transmission occurs through exposure to infectious body fluids such as blood, semen, and vaginal secretions, some innovative studies suggest potential spillover mechanisms through everyday skin contact, especially during communal activities involving sharp objects. 2. The hepatitis B virus, HBV, cunningly incorporates itself into the host's DNA, which makes complete eradication challenging and thus necessitates prolonged and sometimes lifelong antiviral therapy that primarily involves nucleose T-ide analogs like entecavir and tenofovir to achieve viral suppression, although these therapies do not cure the disease and require careful monitoring for the development of drug resistance and renal or bone complications. 3. Upon HBV infection, a complex interaction ensues within the immune system where cytotoxic T lymphocytes target infected hepatocytes, leading to liver inflammation and potential damage, which paradoxically contributes both to viral clearance in acute cases and liver pathology in chronic cases, a dualistic pathophysiological process that continues to be a subject of intense research. 4. Chronic hepatitis B can progress to severe liver diseases such as cirrhosis or hepatocellular carcinoma, HCC, with the risk of such progression drastically increasing in individuals with co-infections such as hepatitis C or D, emphasizing the need for comprehensive serological screening and integrated management strategies that address comorbid conditions to prevent severe outcomes. 5. The HBV genome operates with a high degree of genetic plasticity, containing 4 partially overlapping open reading frames that encode several multifunctional proteins, and the virus's capacity to generate mutations, especially in the precore and basal core promoter regions, can modify its pathogenic potential and influence the host's immune response, complicating treatment and vaccine design efforts. 6. While hepatitis B vaccination remains a key preventive measure with remarkable efficacy rates in the general population, seroconversion rates can be disappointingly low in certain cohorts such as hemodialysis patients and immunocompromised individuals, prompting exploration into vaccine adjuvants, varied dosing schedules, and alternative routes of administration to improve protective immunogenicity. 7. An intriguing aspect of HBV infection is the formation of subviral particles which are composed mainly of surface antigens but lack genomic DNA, and these particles are thought to serve as decoys that distract the immune system's attention from the infectious virions, thereby facilitating chronicity and making them vital targets in the quest for therapeutic vaccines. 8. The enigmatic role of HBV X protein, HBX, in viral replication, host cell gene regulation, and oncogenesis has been linked to its ability to interact with various cellular proteins and pathways, including ones involved in signal transduction, apoptosis, and cell cycle regulation, presenting a multifaceted challenge in understanding its full implications and therapeutic targeting potential. 9. Advanced imaging techniques such as transient elastography and magnetic resonance elastography are transforming the landscape of non-invasive liver fibrosis assessment in hepatitis B patients, providing critical insights into the extent of fibrosis and guiding treatment decisions, although the interpretation of stiffness values requires a nuanced understanding of potential confounding factors like inflammation or hepatic steatosis. 10. While the discovery of a functional cure for hepatitis B remains an unmet medical need, innovative therapeutic approaches are being explored, including RNA interference strategies to knock down viral gene expression, therapeutic vaccines designed to boost immune clearance, and CRISPR-Cas9 technologies aimed at eliminating cccDNA from hepatocytes, each holding promise but accompanied by unique challenges in specificity and delivery. 11. Acute hepatitis B infections can be asymptomatic or present with a spectrum of symptoms ranging from mild flu-like manifestations to severe fulminant hepatic failure, where the extreme form is characterized by rapid deterioration of liver functions, coagulopathy, encephalopathy, and a high mortality rate unless emergent interventions such as liver transplantation are pursued. 12. The prevalence of hepatitis B shows significant geographical variation, with the highest burdens in sub-Saharan Africa and East Asia, often due to vertical transmission from mother to child during childbirth, a scenario that underscores the importance of neonatal vaccination programs and the administration of hepatitis B immunoglobulin in preventing mother-to-child transmission in endemic regions. 13. Serological testing for hepatitis B antigen, HBAg, plays a crucial role in clinical practice, as its presence typically indicates high replicative activity and increased infectivity, guiding prognosis and therapeutic evaluation, although its correlation with liver disease progression is nuanced, particularly in the context of HBV genotype variation and shifts in the immune-tolerant phase. 14. Hepatitis B infection can be modulated by the presence of the hepatitis delta virus, HDV, a satellite virus that requires HBV for replication and can cause more aggressive liver disease characterized by more rapid progression to cirrhosis, higher rates of decompensation, and an increased risk of hepatocellular carcinoma, mandating a different therapeutic approach and the prioritization of HDV screening in HBV-infected patients. 15. The discovery of occult hepatitis B infection, where individuals remain HBsAg negative but with HBV DNA detectable in liver tissue or blood, has significant clinical implications, especially in immunocompromised patients undergoing chemotherapy or organ transplantation, as reactivation of the virus can occur with profound liver failure unless prophylactic antiviral therapy is instituted. 16. HBV replication is elegantly orchestrated through the formation of covalently closed circular DNA, cccDNA, which acts as a mini chromosome within the nucleus of infected hepatocytes, providing a template for episodic viral replication and a reservoir for reactivation, positioning it as a prime target for novel therapeutic strategies aimed at achieving sustained virological response. (17) The rise of antiviral-resistant hepatitis B strains poses a considerable challenge to clinical management, with resistances to lamivudine and adefovir being notable, and necessitates routine surveillance to detect genetic mutations that confer resistance, thereby ensuring timely modifications in therapy to prevent disease progression and liver-related complications. (18) Understanding the immunological paradox wherein chronic hepatitis B persists despite an intact immune system involves recognizing HBV's ability to induce immune tolerance, partly through the upregulation of checkpoint molecules like PD-1 and TIM-3, which inhibit effective T-cell responses, making checkpoint blockade an exciting area of research for potential therapeutic interventions. (19) The intricate relationship between hepatitis B and liver cancer has been delineated by observations of HBV integration into the host genome, the promotion of genomic instability, and the expression of oncogenic viral proteins, with chronic HBV infection being one of the few viral etiologies directly associated with carcinogenesis, highlighting the preventive potential of early antiviral therapy and vaccination. (20) Innovative approaches to hepatitis B treatment also explore the use of therapeutic protein inhibitors targeting viral assembly and secretion, which aim to reduce serum levels of HBs AG, consequently simplifying clinical monitoring and potentially aiding in restoring the host's immune control over infection, opening avenues for additional combination regimen trials. (21) Genetic studies have unveiled the significant impact of host genetic polymorphisms, particularly in the HLA and cytokine genes, on susceptibility to and outcomes of hepatitis B infection, offering insights into potential personalized vaccine and treatment strategies tailored to individuals' genetic profiles and possibly improving the efficacy of therapeutic interventions. (22) In chronic hepatitis B management, the decision to initiate antiviral therapy is closely linked to assessing liver histology, which traditionally required invasive biopsy. Yet the advent of reliable non-invasive biomarkers, including serum aminotransferase levels, HBV DNA quantification, and novel fibrosis markers, is revolutionizing patient evaluation, albeit with a constant search for enhancing diagnostic accuracy. (23) Hepatitis B vaccines exemplify a tremendous public health success story, yet addressing the global challenge of vaccine refusal and misconceptions, particularly in low vaccination coverage areas, calls for innovative health education and communication strategies that leverage technology and community involvement to enhance awareness, increase acceptance, and ultimately control the spread of the virus. (24) The complexity of hepatitis B co-infection with HIV demands a specialized treatment paradigm since drug-drug interactions and overlapping toxicities can influence regimen choice, necessitating a multidisciplinary approach to optimize both viral suppression and liver disease management, with the potential for integrative therapies combining antiretrovirals with agents specifically targeting HBV replication. (25) Radiologists play a pivotal role in the interdisciplinary care of hepatitis B patients, with advanced imaging modalities such as contrast-enhanced ultrasound not only aiding in the initial detection and characterization of liver lesions but also in the monitoring of therapeutic response and early identification of post-treatment complications, thus ensuring comprehensive patient management. (26) Hepatitis B antigen-negative chronic hepatitis B presents a clinical challenge due to its diverse clinical course characterized by episodic flares of hepatitis and varying degrees of viral replication, necessitating ongoing patient monitoring, flexible treatment regimens, and timely intervention to mitigate the risk of liver disease progression and carcinoma development. '27. The potential hepatoprotective properties of naturally occurring compounds, including those derived from traditional herbs like Phyllanthus amarus, have sparked interest in complementary and alternative medicine approaches for hepatitis B, suggesting that adjunctive therapies could modulate immune responses or provide symptomatic relief, although rigorous clinical validation remains imperative. '28. In children born to hepatitis B-infected mothers, understanding the immunological factors contributing to viral persistence and early exposure impacts remains critical, with ongoing research focused on identifying markers of immune tolerance, optimizing maternal antenatal antiviral intervention, and improving neonatal immunoprophylaxis strategies to effectively prevent vertical transmission. '29. Obtaining an accurate epidemiological picture of hepatitis B is crucial for informing public health policies, and the integration of data analytics and machine learning techniques provides novel tools for predicting trends, identifying high-risk populations, and optimizing resource allocation for screening, vaccination, and treatment programs, leading to more targeted and effective interventions. '30. Psychological aspects of hepatitis B diagnosis, often underappreciated in clinical settings, can significantly impact patient adherence to medical recommendations, meriting the incorporation of structured support systems, mental health assessments, and culturally sensitive counseling into routine management to empower patients and improve overall treatment outcomes. '31. Hepatitis B's interaction with host metabolic processes has gained attention, with evidence suggesting that viral factors may influence hepatic lipid metabolism, contributing to the dual burden of HBV and metabolic syndrome, a nexus that could unravel novel therapeutic pathways targeting metabolic modulation alongside antiviral strategies to enhance clinical efficacy. '32. Community-focused screening and vaccination programs, leveraging mobile health technology and point-of-care testing, present an innovative strategy to address hepatitis B in remote or underserved areas, ensuring timely identification and linkage to care for infected individuals, and strengthening disease surveillance through real-time data analytics. '33. Advances in proteomics and metabolomics are expanding the horizon of hepatitis B research, providing detailed insights into host pathogen interactions, identifying novel biomarkers for disease progression and therapeutic response, and offering potential targets for precision medicine approaches in hepatitis B management. '34. Understanding the impact of hepatitis B on hepatic immune microenvironments reveals insights into liver-specific lymphocyte populations, such as liver-resident T and innate lymphoid cells, and their functional roles in maintaining chronic infection or facilitating disease clearance, pointing to novel immunomodulatory pathways that could be harnessed therapeutically. '35. The correlation between hepatitis B viral load and intrahepatic inflammation underscores the need for regular quantification of serum HBV DNA in guiding therapeutic decisions, with fluctuations in viral replication potentially offering clues regarding patient compliance, emerging resistance, or changes in liver disease status that warrant clinical correlation and intervention. '36. Hepatitis B's complex life cycle involves a delicate balance between viral replication, cccDNA maintenance, and immune evasion strategies, offering a unique platform for studying viral host interactions and providing opportunities to exploit these processes for the development of therapeutic vaccines and curative antiviral regimens designed to disrupt this equilibrium. 37. Implementing hepatitis B health literacy curriculum in educational institutions not only amps up awareness among young individuals but also empowers them to become advocates in destigmatizing the disease, thereby fostering an informed community capable of recognizing early symptoms, understanding vaccination importance, and encouraging proactive engagement with healthcare professionals for screening and management. Chronic hepatitis B requires a dynamic approach to management, with recommendations urging clinicians to consider factors such as patient's age, liver function status, family history of liver diseases, and genotype when formulating individualized treatment plans, ensuring that therapeutic decisions reflect the comprehensive clinical scenario and patient's long-term health prospects. 39. The role of the liver in hormone regulation and nutrient storage means that hepatitis B can have systemic manifestations beyond hepatic injury, including endocrine disturbances and nutritional deficiencies, which necessitate a holistic consideration of patient symptoms and potential need for interdisciplinary management strategies incorporating endocrinologists and nutritional experts. Understanding the structural nuances of the hepatitis B surface antigen has paved the way for improved vaccine development and serological testing specificity, revealing that antigenic variations could influence immune evasion and chronicity, thus informing strategies to optimize vaccine formulations to balance robust seroconversion with minimized allergenic potential. The interplay between hepatitis B infection and hematological disorders uncovers intricate associations, with evidence that HBV infection can induce hematological malignancies or cytopenias through mechanisms such as chronic inflammation or direct viral effects on bone marrow, underlining the importance of thorough hematologic evaluation in HBV-positive individuals to preempt and manage such complications. Emerging research into blood-brain barrier permeability and peripheral nervous system manifestations in hepatitis B proposes an intriguing extension of the disease beyond hepatic pathology, with some studies indicating viral particles or inflammatory mediators may contribute to neurological symptoms, thereby calling for expanded neurological assessments when managing chronic HBV patients with atypical presentations. Hepatitis B poses distinct challenges in transplant medicine, especially in the context of liver transplantation where pre-existing infection risks graft failure or reinfection, compelling the development of innovative prophylactic and therapeutic regimens, including passive immunization with HBV immunoglobulin and the careful selection of post-transplant antiviral therapy to assure favorable graft outcomes. Multifaceted interventions that integrate lifestyle modifications with medical treatment have shown promise in managing hepatitis B, particularly in addressing contributory factors such as alcohol consumption, which exacerbates liver damage, and thus formulating comprehensive care plans that include dietary advice, physical activity, and psychological support can improve adherence and disease management outcomes. In the realm of hepatitis B research, cutting-edge methodologies such as single-cell sequencing are being employed to dissect the heterogeneity of immune cells in the liver of infected individuals, offering unprecedented resolution into immune landscape remodeling during chronic HBV infection and potentially unveiling novel therapeutic targets for immunomodulation or immune clearance strategies. The phenomenon of HBV reactivation, characterized by a resurgence in viral replication in previously inactive or resolved infections, is particularly concerning in patients receiving immunosuppressive treatments, emphasizing the necessity for vigilant monitoring protocols and preemptive antiviral therapy to mitigate risks, especially amid emerging biological therapies that alter immune function. 47. Development of targeted HBV antiviral agents like capsid assembly modulators offers a novel mechanism for disrupting viral replication, focusing efforts on destabilizing the viral core protein assembly process, which is critical for nucleocapsid formation, and represents a promising breakthrough in achieving sustained viral control, potentially as part of combination therapeutic approaches. Hepatitis B is intriguingly linked to alterations in lipid metabolism, with the virus affecting host lipidomes and contributing to the development of hepatic steatosis in some patients, serving as a substrate for further liver damage, and illustrating the necessity of an integrative approach to management that considers both antiviral strategies and interventions targeting dyslipidemia and metabolic syndromes. The challenge of universal coverage with hepatitis B vaccination has led to initiatives enhancing global access to vaccines, including advocating for mandatory infant immunization policies and innovating low-cost vaccine production techniques to boost equitable distribution efforts, particularly in resource-limited settings, emphasizing the critical role of international collaboration in addressing global health disparities in HBV infection rates. The intricate socioeconomic dimensions of hepatitis B impact not only individual health outcomes but also broader public health challenges, necessitating a comprehensive policy framework that addresses health inequities, enhances disease education, and promotes the integration of hepatitis B control measures into primary healthcare systems, ultimately aiming to mitigate the global burden and empower communities. 1. Uterine cancer, often arising from the endometrium, represents the most common gynecological malignancy, characterized by abnormal vaginal bleeding in postmenopausal women, with early diagnosis being facilitated through transvaginal ultrasound and endometrial biopsy, effectively enabling evaluation of the endometrial thickness and histological type. 2. Obesity is a significant risk factor for uterine cancer due to the increased peripheral conversion of androgens to estrogens in adipose tissue, leading to prolonged estrogen exposure without progesterone counterbalance, which enhances endometrial hyperplasia and carcinogenesis. 3. Beyond traditional surgical interventions, uterine cancer therapy is evolving with the incorporation of robotic-assisted laparoscopic hysterectomy, which offers the advantages of minimally invasive surgery including reduced recovery time and less postoperative morbidity, while maintaining oncologic outcomes comparable to open surgery. 4. The molecular landscape of uterine cancer is diverse, with notable genetic alterations such as PTEN mutations that are frequently implicated in endometrial carcinogenesis, serving as potential targets for personalized therapeutic strategies in precision medicine. 5. Early-stage uterine cancer is often treated successfully through total hysterectomy with bilateral salpingo-oophorectomy, but emerging evidence suggests that fertility-sparing treatment using high-dose progestins can be considered in young women with grade 1 endometrioid adenocarcinoma who wish to preserve their reproductive potential. 6. Recent advances in molecular diagnostics have enabled the identification of Lynch syndrome, a hereditary condition associated with mismatch repair gene mutations, in select uterine cancer patients, emphasizing the importance of genetic counseling and testing to inform treatment choices and family risk assessment. 7. Hormone replacement therapy, particularly unopposed estrogen, has been linked to an increased risk of uterine cancer, emphasizing the need for judicious use and consideration of alternative therapies to alleviate menopausal symptoms in women with an intact uterus. 8. One innovative approach to uterine cancer treatment involves the use of immune checkpoint inhibitors, which target the PD-1/PD-L1 pathway, providing a novel mechanism to reinvigorate the body's immune response against tumor cells, particularly in patients with advanced or recurrent disease. 9. Pelvic radiation therapy, frequently used as an adjuvant treatment in high-risk uterine cancer, poses a challenge due to associated toxicities, but intensity-modulated radiation therapy, IMRT, has emerged as a superior technique, enabling precise targeting of cancerous tissues while sparing neighboring healthy organs. The presence of lymphovascular space invasion in uterine cancer is a significant prognostic factor, correlating with increased likelihood of lymph node metastasis and recurrence, thus informing decisions regarding the extent of surgical staging and the need for adjuvant therapies. In examining racial disparities, African American women experience a higher incidence of aggressive uterine cancer subtypes, such as serous carcinoma, highlighting the necessity for increased awareness, screening, and culturally competent care to address these inequities in health outcomes. Advances in imaging modalities, particularly the use of magnetic resonance imaging, MRI, have significantly enhanced the preoperative assessment of uterine cancer, allowing for accurate evaluation of myometrial invasion depth and potential cervical involvement, thereby guiding surgical planning and staging. While the majority of uterine cancers are sporadic, familial clustering is noted in some cases, underscoring the potential influence of polygenic risk factors and the importance of comprehensive family history assessments in identifying at-risk individuals for early intervention and surveillance. Sentinel lymph node mapping is emerging as a refined technique in uterine cancer staging, offering reduced surgical morbidity by selectively identifying lymph nodes with metastatic potential, thus obviating the need for full lymphadenectomy in low-risk patients. Endometrial hyperplasia, particularly the atypical type, is a recognized precursor to uterine cancer, requiring vigilant surveillance and, in some cases, therapeutic intervention to prevent progression to malignancy, underscoring the importance of timely diagnosis and management. Hormonal therapy leveraging progestins remains an essential treatment option for advanced uterine cancer, providing a non-surgical alternative that may induce tumor regression, particularly in patients whose tumors express hormone receptors, although it necessitates careful monitoring for therapeutic efficacy. Pyometra, an accumulation of pus within the uterus, although rare, can occur in the context of uterine cancer, leading to infection and requiring prompt drainage or surgical intervention to prevent systemic complications, emphasizing the need for clinicians to maintain a high index of suspicion. Intraoperative tumor morcellation, once a common practice for removing uterine fibroids, has largely fallen out of favor due to the risk of disseminating undiagnosed malignant cells, particularly in the context of unsuspected uterine sarcoma, prompting guidelines advocating for alternative approaches to minimize this risk. Targeted therapies such as trastuzumab have shown promise in treating HER2-positive uterine serous carcinoma, reflecting the expanding role of molecular profiling in tailoring treatment strategies that specifically target the unique biological characteristics of individual tumors. Research continues to explore the therapeutic potential of metformin in uterine cancer, leveraging its effects on insulin resistance and cellular metabolism, which may inhibit cancer cell proliferation and offer adjunctive benefits when integrated into conventional treatment regimens. While surgical staging remains the gold standard in assessing the extent of uterine cancer, non-invasive techniques, such as liquid biopsies that detect circulating tumor DNA, are being developed to provide dynamic insights into tumor burden and response to treatment without the need for surgical intervention. 22. The role of carbohydrates in the glycemic index in potentially modulating uterine cancer risk highlights the importance of dietary interventions, suggesting that a low-carb, low-glycemic diet may confer protective effects, although further research is necessary to substantiate these findings and inform guidelines. 23. In considering uterine sarcomas, leiomyosarcomas represent a rare and aggressive form with distinct clinical and molecular features, often necessitating a multimodal approach involving surgery, chemotherapy, and radiation, tailored to the sarcoma subtype and tumor stage. 24. Advanced imaging modalities like positron emission tomography, computed tomography, PET-CORT, are being increasingly utilized in uterine cancer for recurrence detection and metastasis evaluation, with FDG uptake providing critical insights into tumor metabolic activity and informing treatment modifications. 25. Hypofractionated radiotherapy protocols are being explored in uterine cancer as a means to reduce overall treatment time and patient burden while maintaining efficacy, representing an important area of research aimed at optimizing the therapeutic index of radiation treatment. 26. In cases of recurrent uterine cancer, cytoreductive surgery followed by hyperthermic intraperitoneal chemotherapy, HIPEC, is being investigated as a potential strategy to improve survival outcomes by reducing residual tumor burden and enhancing chemotherapeutic efficacy in peritoneal cavity malignancies. 27. In uterine cancer populations, weight management interventions are considered a crucial aspect of survivorship care, as they may mitigate cancer-related fatigue, enhance overall quality of life, and reduce the risk of recurrence, spotlighting the role of lifestyle modifications in oncology care. 28. Histological subtypes of uterine cancer are diverse, with clear cell carcinoma representing a distinct entity characterized by a propensity for late-stage presentation and poor prognosis, necessitating nuanced therapeutic approaches that account for its unique clinical and molecular characteristics. 29. As immunotherapy continues to revolutionize cancer treatment, the exploration of personalized vaccines that target specific uterine cancer neoantigens is an exciting area of ongoing research, seeking to enhance immune recognition and elimination of cancer cells. 30. The incidence of uterine cancer among premenopausal women is increasing, underscoring the necessity for heightened awareness and early intervention strategies in this population to ensure timely diagnosis and appropriate management tailored to preserve fertility when desired. 31. In uterine cancer research, the PI3K/AKT/mTOR signaling pathway has emerged as a critical driver of tumorigenesis, offering potential targets for the development of novel inhibitors aimed at dampening tumor growth and enhancing sensitivity to conventional chemotherapeutic agents. 32. Genetic testing for microsatellite instability, MSI, a hallmark of defective DNA mismatch repair, in uterine cancer is pivotal in both prognostic assessment and therapeutic decision-making, as MSI-high tumors may exhibit increased sensitivity to immune checkpoint blockade therapies. 3. In the context of uterine cancer, the gut microbiome is gaining attention for its potential influence on treatment outcomes and risk modulation, highlighting the promising avenue of microbiome-focused interventions to complement conventional therapies. 34. Uterine carcinosarcoma, also known as malignant mixed Müllerian tumor, is a high-grade neoplasm exhibiting both carcinomatous and sarcomatous components, often necessitating aggressive multimodal treatment approaches due to its propensity for early metastasis and recurrence. 35. Advances in surgical technology, such as the use of fluorescent imaging during laparoscopic procedures, are providing enhanced visualization techniques to accurately delineate tumor margins, optimize surgical resection, and minimize unintended damage to adjacent tissues in uterine cancer surgeries. While rare, the phenomenon of pseudo-Meigs syndrome can occur when ascites and hydrothorax present in conjunction with benign or malignant uterine leiomyomas, necessitating differentiation from ovarian cancer to ensure accurate diagnosis and appropriate management. For patients with uterine cancer harboring high tumor mutational burden, TMB, the potential for response to specific immunotherapeutic agents is heightened, as increased TMB may correlate with greater immunogenicity, representing an intriguing biomarker for treatment stratification. Endometrial cancer staging has undergone significant refinement with the introduction of the International Federation of Gynecology and Obstetrics, FIGO, 2009 classification, which emphasizes the importance of comprehensive surgical staging to accurately determine the extent of disease and guide therapy. The exploration of non-hormonal systemic therapies, such as tyrosine kinase inhibitors, in hormone receptor-negative uterine cancer represents an emerging frontier that seeks to offer viable options for patients with limited responses to conventional chemotherapy. As the field of oncogenomics evolves, the integration of DNA methylation profiling in uterine cancer holds promise for refining prognostic models and identifying novel therapeutic targets by elucidating the epigenetic landscape associated with tumor progression. Adjuvant chemotherapy in high-risk uterine cancer regimens typically includes the use of paclitaxel and carboplatin, but ongoing clinical trials are investigating the efficacy of novel agents and combinations to optimize treatment outcomes and minimize adverse effects. Survivorship care planning for uterine cancer patients is critical and should encompass a comprehensive approach addressing both physical and psychological well-being, incorporating regular monitoring for recurrence, management of long-term treatment effects, and support for navigating fertility and hormonal issues. The investigation of uterine cancer stem cells is shedding light on the mechanisms underlying tumor initiation, progression, and resistance to therapy, offering opportunities to develop targeted treatments that eradicate this subpopulation and enhance overall treatment efficacy. The Winter Olympic sport of figure skating has been postulated to contribute to the maintenance of postmenopausal epithelial uterine cancer patients by enhancing aerobic fitness and improving overall mental health, underscoring the therapeutic potential of integrating community-based exercise programs into survivorship care. The emerging concept of liquid lighting in minimally invasive uterine cancer surgery involves the use of novel luminescent agents that are intravenously administered and selectively accumulate in cancerous tissues, providing extraordinary intraoperative illumination for improved visualization and precision in tumor resection. In uterine cancer with an unexpected histologic diagnosis post-surgery, tailored adjuvant therapy decisions require careful consideration of the unique molecular characteristics of the tumor, which can provide critical insights into prognosis and guide subsequent treatment adjustments. The interplay between the endocrine system and uterine cancer pathophysiology is evidenced by ongoing research into the mechanisms through which insulin resistance and hyperinsulinemia may contribute to carcinogenesis, providing a basis for metabolic targeted interventions. 48. Utilizing artificial intelligence algorithms in analyzing uterine cancer pathology. Slides is paving the way for enhanced diagnostic accuracy, enabling the identification of subtle histopathological features that may be overlooked by traditional methods and empowering pathologists with advanced diagnostic support. 49. Incorporating patient-reported outcomes into uterine cancer clinical trials is crucial for capturing the real-world impact of treatments on quality of life, facilitating the development of more patient-centric therapeutic interventions that align with the hopes and preferences of affected individuals. 50. In uterine cancer management, neoadjuvant chemotherapy is being increasingly explored as an option to shrink tumors before surgery, particularly in advanced stage or high-risk cases, with the aim of improving surgical outcomes and expanding treatment possibilities for patients with previously deemed inoperable tumors. 1. Bronchial asthma is a chronic inflammatory disorder of the airways characterized by episodic exacerbations of dyspnea, coughing, wheezing, and chest tightness, driven primarily by eosinophils and mast cells that release inflammatory mediators, leading to a reversible obstruction of airflow and hyperreactivity of the bronchial passages. 2. The pathophysiology of bronchial asthma involves an imbalance of Th1, Th2 cytokine response, where a predominance of Th2 cells promotes an allergic cascade, producing cytokines like IL-4, IL-5, and IL-13, which facilitate IgE synthesis, eosinophil recruitment, and airway remodeling. 3. In diagnosing bronchial asthma, spirometry is a fundamental tool and generally reveals a reversible obstructive pattern, evidenced by a reduced forced expiratory volume in the first second, FEV1, that improves by at least 12% in 200 ml post-bronchodilator administration. 4. The Global Initiative for Asthma Management recommends a stepwise approach to asthma treatment, starting with as-needed low-dose inhaled corticosteroid formoterol for mild cases and escalating to higher doses and additional controller therapies like long-acting beta-2 agonists, LABAs, or leukotriene receptor antagonists for more severe asthma. 5. Exhaled nitric oxide, ENO, levels can serve as a non-invasive biomarker for airway inflammation in asthma, with elevated levels indicating eosinophilic inflammation and a likely positive response to inhaled corticosteroids, thus guiding asthma management tailored to inflammation levels. 6. Common environmental triggers of asthma include inhaling allergens such as pollen, dust mites, pet dander, and mold, alongside air pollutants and tobacco smoke, which can provoke an inflammatory cascade in sensitized individuals, exacerbating asthma symptoms and leading to acute exacerbations. 7. Nocturnal asthma, a variant where symptoms worsen at night, is influenced by circadian variations in bronchial tone and responsiveness, peaking in the early morning due to increased vagal tone, heightened airway inflammation, and potentially reduced levels of circulating glucocorticoids. 8. A significant innovation in asthma management is the use of monoclonal antibodies like omalizumab, an anti-IgE therapy specifically designed for individuals with moderate to severe allergic asthma not adequately controlled by conventional therapies, by binding free IgE, reducing its activity and downstream allergic inflammation. 9. Distinguishing asthma from chronic obstructive pulmonary disease, COPD, requires keen clinical acumen, as patients with asthma typically present with a history of allergies and variable symptoms, while COPD generally arises in older individuals with a history of smoking, showing a progressive and non-reversible pattern of airflow limitation. 10. Asthma exacerbations are acute or subacute episodes of worsening symptoms often precipitated by infections, allergens, irritants, or exercise, owing to increased airway inflammation and narrowing that demand immediate intervention with systemic corticosteroids and bronchodilators to restore airflow and prevent progression. 11. Bronchial thermoplasty represents an innovative treatment for severe refractory asthma, employing controlled thermal energy delivered via bronchoscopy to selectively reduce airway smooth muscle mass, diminishing the excessive contractile response that characterizes asthma and thereby reducing exacerbations and improving quality of life. A personalized approach in asthma management encompasses phenotyping patients into endotypes such as eosinophilic, neutrophilic, mixed granulocytic, or posigranulocytic inflammation, which allows for targeted therapies that specifically address the dominant inflammatory pathway most active in an individual's asthma. Exercise-induced bronchoconstriction, IBD, is asthma triggered by physical activity, due to rapid air movement causing airway drying and cooling, followed by hyperemia and mast cell mediator release. Preventive pre-exercise inhalation of short-acting beta-2 agonists can help mitigate frequency and severity of such attacks. Understanding asthma pathogenesis involves recognizing the role of genetics and environmental interactions, with genetic predispositions such as polymorphisms in genes encoding for cytokines, beta-2 adrenergic receptors, and proteins involved in the inflammatory process that increase the risk of developing asthma when exposed to environmental triggers. Pediatric asthma presents unique challenges due to the developing respiratory system and distinct patterns of inflammation. Small airway size, more pronounced reactions to viral infections, and differential responses to allergen exposure necessitate tailored management strategies aligned with the child's specific triggers and symptom patterns. One innovative diagnostic approach for asthma involves fractional exhaled nitric oxide (FeNO) testing, where elevated levels indicate eosinophilic inflammation that may predict the response to corticosteroid therapy and serve as a marker for adherence to controller medications, providing insight into inflammation control. Occupational asthma is caused by an exposure to specific allergens or irritants at work, such as isocyanates, flour dust, or animal dander, requiring both confirmation of the diagnosis through occupational history and physiological testing, and implementation of exposure controls or workplace changes to alleviate symptoms. In recent years, personalized medicine in asthma has advanced with the advent of biologics targeting specific cytokines such as IL-5, with drugs like mepolizumab and benralizumab that focus on reducing eosinophilia, thereby preventing exacerbations and reducing the need for oral corticosteroids in patients with severe eosinophilic asthma. Allergen immunotherapy is a proactive treatment strategy for allergic asthma sufferers, involving gradual exposure to increasing amounts of specific allergens, which aims to desensitize the immune system, reduce IgE-mediated responses, and provide long-term mitigation of allergic symptoms linked to asthma. The asthma-COPD overlap syndrome, ACOS, poses diagnostic and therapeutic challenges, requiring a nuanced approach that combines treatments addressing both reversible bronchoconstriction and persistent airflow obstruction while considering the presence of airway inflammation characteristic of each condition. Peak expiratory flow rate (PEFR) monitoring provides a practical method to assess airway obstruction in asthma patients. Personal bests are used to set action plans to guide patients on self-management, helping detect early signs of exacerbation and thereby preventing deterioration of lung function. Asthma control is critically evaluated through patient-reported outcomes and validated questionnaires such as the Asthma Control Test, ACT, allowing healthcare providers to quantify symptom presence and severity, and adjust therapeutic regimens accordingly to achieve optimal symptom-free days and nights. Complementary asthma treatments like yoga and breathing exercises can improve respiratory function and reduce stress-related symptom exacerbations, working synergistically with conventional treatment to promote overall well-being, improved lung capacity, and better control of symptoms. '24. The association of asthma with obesity is supported by evidence showing that adipose tissue contributes to systemic inflammation via secretion of adipokines, potentially exacerbating asthma symptoms and reducing lung function, making weight management a critical component of comprehensive asthma management strategies. '25. Vocal cord dysfunction, VCD, is an important differential diagnosis in patients with severe asthma, wherein inappropriate vocal cord closure during inspiration mimics asthma symptoms, highlighting the need for precise laryngoscopy to accurately distinguish between VCD and asthma for effective management. '26. Severe asthma, often refractory to standard treatments, may be guided by genomic studies identifying biomarkers and genetic variations associated with treatment responses, providing a basis for precision medicine approaches that optimize therapy selection and outcome predictions. '27. Asthma management in pregnancy requires careful balancing to ensure maternal health without compromising fetal development, with inhaled corticosteroids remaining the preferred controller medication, while ensuring any pharmacotherapeutic intervention is safe for both mother and child. '28. The hygiene hypothesis suggests that asthma has become more prevalent due to reduced early childhood exposure to infections, leading to an unbalanced immune response favoring allergic sensitization, supporting the importance of early exposure to diverse microbial environments in mitigating the risk of asthma. '29. Prolonged exposure to low-grade air pollution, particularly particulate matter and nitrogen dioxide, not only exacerbates asthma symptoms but is linked with increased onset risk, underscoring the importance of environmental policies and individual practices aimed at minimizing exposure to air pollutants. '30. Digital health technologies and smart inhalers are emerging as valuable tools in asthma management, offering real-time monitoring of medication usage and adherence, providing data-driven insights that inform personalized treatment adjustments and foster improved patient engagement in their healthcare regimen. '31. Asthma in the elderly poses unique challenges, often presenting with atypical symptoms and underdiagnosed due to attribution of symptoms to aging, necessitating vigilant assessment practices that discern asthma from comorbidities, ensuring accurate diagnosis and tailored management. '32. Viral respiratory infections, particularly those caused by rhinoviruses, are significant triggers of asthma exacerbations, inciting inflammation and hyper-responsiveness through pathogen recognition receptors on airway cells, thereby making preventative strategies against respiratory infections essential in asthma management. '33. Pediatric asthma education programs focusing on self-management skills tailored to developmental stages, emphasize understanding trigger avoidance, inhaler technique, and recognizing asthma action plans, which significantly enhance health outcomes and reduce emergency department visits in children. '34. In recent developments, heat maps generated from wearable biosensors monitoring physiological parameters like heart rate and respiratory patterns can provide predictive analytics of asthma exacerbations, offering cutting-edge opportunities for early intervention in asthma management. '35. Lifestyle modifications, including dietary adjustments that prioritize omega-3 fatty acids, antioxidants, and decreased processed foods, have shown promise in reducing systemic inflammation and improving asthma control, supporting the role of nutrition in comprehensive asthma management. '36. The spiraling costs of asthma care have prompted exploration into cost-effective strategies like telemedicine consultations, which improve access to specialist care and are associated with positive outcomes in asthma management, reinforcing the viability of technology-assisted healthcare delivery. (37) Inflammation in asthma is traditionally focused on the eosinophilic variety, yet neutrophilic and mixed inflammatory profiles are increasingly recognized, necessitating distinct approaches such as non-steroidal anti-inflammatory agents or macrolides that efficiently target the specific inflammatory cell populations. (38) The role of the microbiome in asthma is an expanding field of research. Disruptions in microbial diversity in the airway and gut have been linked to increased asthma risk, thus influencing potential therapeutic strategies aimed at modulating the microbiome to maintain immune system balance. (39) Precision-guided inhaler drug delivery systems are being enhanced by leveraging particle engineering technology to optimize drug particle size and distribution, aiming at maximizing deposition in the lower airways and consequently improving efficacy for controlling asthma symptoms and exacerbations. (40) Advances in epigenetic research have opened new frontiers in asthma treatment, revealing how modifications in gene expression, driven by environmental factors, contribute to the asthma phenotype and could become targets for epigenetic therapeutics aimed at altering the disease trajectory. (41) Asthma action plans, individually tailored and regularly reviewed, are critical elements in disease management that empower patients to respond effectively to changing symptoms, preventing exacerbations through a structured approach that defines specific actions based on symptom severity and peak flow measurements. (42) The role of health literacy in asthma outcomes is profound, with studies indicating that improved literacy and understanding of asthma pathophysiology, triggers, and treatments correlate with better disease control, reduced healthcare utilization, and the empowerment of patients to participate actively in their care. (43) Airway remodeling, a chronic outcome of untreated or poorly controlled asthma, results from persistent inflammation leading to structural changes such as subepithelial fibrosis and smooth muscle hypertrophy, emphasizing the importance of timely and consistent treatment to prevent irreversible airway obstruction. (44) Innovations in AI-driven asthma management explore algorithms that integrate patient-specific data, predictive analytics, and clinical guidelines to support healthcare providers in making informed decisions, thereby optimizing individualized care protocols and potentially improving long-term asthma control. (45) The development of fixed-dose combination inhalers that contain both a long-acting beta-2 agonist and an inhaled corticosteroid improves patient adherence, simplifies treatment regimens, and delivers consistent therapeutic benefit by targeting both inflammation and bronchoconstriction in asthma management. (46) Psychological stress has a profound impact on asthma exacerbations, mediated through neuroendocrine pathways that affect immune system function, highlighting the need for integrated care approaches that address both psychological and physiological aspects of asthma to enhance disease management. (47) Clinical trials investigating heat shock proteins in asthma reveal potential therapeutic targets, as these proteins modulate inflammation and protect against cellular damage, offering a novel angle in asthma treatment strategies aimed at reducing immune activation and asthma-associated tissue damage. (48) Environmental control in asthma, especially in homes with allergic asthma patients, demands meticulous attention to allergen sources. Important interventions include the use of high-efficiency particulate air, HEPA, filters, frequent cleaning, and encasing mattresses to mitigate the allergen burden effectively. 49. Inflammation resolution in asthma is a critical focus, where emerging therapies aim to foster pro-resolution lipid mediators like lipoxins and resolvins that actively terminate inflammatory responses, restoring airway homeostasis without compromising host defense mechanisms. The application of therapeutic phage therapy in asthma is under exploration, targeting bacterial infections associated with asthma exacerbations, where phages specifically lyse pathogenic bacteria, thus minimizing bacterial-induced inflammation and presenting a precision treatment modality with potential for personalization. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. 17. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. 18. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced post-operative morbidity and quicker recovery. 19. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression in response to treatment, allowing for more personalized therapy adjustments. 20. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. 21. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. 22. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. 23. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines and the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. 24. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. 25. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. 26. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. 27. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. 28. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. 29. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. Notably, the TREPS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. 45. The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. '46. Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. '47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques and perioperative care. '48. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. '49. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. '50. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. 1. Brain trauma, one of the most complex injuries in neuroscience, involves mechanical damage to brain tissue leading to primary injury and subsequent biochemical and molecular alterations termed secondary injury, which can exacerbate cellular and microvascular damage, potentially resulting in significant neuropsychological deficits and long-term disability if not promptly and effectively managed. Two. Diffuse axonal injury, DI, common in traumatic brain injury, TBI, involves shearing forces that disrupt axonal connections, leading to profound neuropsychological impairment because the injury primarily occurs at the gray-white matter interface, which impairs critical communication networks within the brain. 3. In brain trauma cases, the Glasgow Coma Scale, GCS, remains a vital clinical tool for assessing the level of consciousness. However, its limitations include insensitivity to subtle changes in neurological status and a reduced ability to predict long-term outcomes when used in isolation, emphasizing the need for adjunctive assessments. Four. The cerebral edema that frequently follows brain trauma is the result of a complex interplay between cytotoxic, vasogenic, and interstitial processes, which can increase intracranial pressure and reduce cerebral perfusion, leading to a vicious cycle of ischemic injury and further neuronal damage. 5. Post-traumatic epilepsy is a well-recognized complication of brain trauma, with its risk being influenced by factors such as the severity of the injury, the presence of contusions, and early post-traumatic seizures, necessitating careful long-term neurological monitoring and management to optimize outcomes. Six. The concept of neuroplasticity, in the context of brain trauma, refers to the brain's remarkable ability to reorganize neural pathways, which is crucial during rehabilitation as it facilitates recovery of function by compensating for lost neuronal connections through innovative therapies like cognitive rehabilitation and task-specific training. 7. Biomarkers in brain trauma hold promising potential for revolutionizing diagnostic precision and prognostic assessments, as they can provide insights into the underlying pathophysiological processes, detect secondary injury paths, and guide targeted therapeutic strategies aimed at reducing neurological damage. '8. Endocrine dysfunction following brain trauma, such as hypopituitarism, results from injury to the hypothalamic-pituitary axis, leading to alterations in hormone levels that can affect metabolism, stress response, growth, and reproduction, necessitating comprehensive endocrine evaluation and management for optimal recovery and quality of life. 9. The use of hypothermia as a therapeutic intervention in brain trauma aims to mitigate secondary injury by reducing metabolic demands and suppressing deleterious biochemical cascades, although its efficacy is still under active investigation, with current evidence suggesting it may be beneficial in specific contexts and patient populations. Elevated levels of neuroinflammation, characterized by the activation of microglia and astrocytes, play a dual role in brain trauma, contributing to both the healing process and the propagation of secondary injury, which underscores the importance of targeting inflammatory pathways to modulate this response and improve outcomes. Intraoperative monitoring of intracranial pressure, ICP, in patients with severe brain trauma offers critical real-time data on cerebral hemodynamics, allowing surgical teams to make informed decisions about interventions that can prevent herniation and preserve neurological function by maintaining cerebral perfusion. Traumatic brain injury can lead to the phenomenon of brain-gut interactions where the injury may precipitate gastrointestinal disturbances such as impaired motility or increased mucosal permeability, potentially exacerbating central nervous system inflammation through a bidirectional interaction involving the gut microbiome. The role of imaging techniques like diffusion tensor imaging, DTI, in evaluating brain trauma is increasingly recognized for its ability to detect microstructural changes in white matter tracts, providing insight into the degree of axonal damage and potentially guiding prognosis and tailored rehabilitation strategies. The blood-brain barrier's integrity is often compromised following brain trauma, which allows inflammatory mediators, immune cells, and neurotoxic substances to penetrate the central nervous system, exacerbating injury and necessitating research into strategies that can restore and protect barrier function. Secondary hemorrhagic transforms within cranial contusions add complexity to the management of brain trauma, as these developments can increase intracranial pressure and risk of further ischemic injury, often requiring careful monitoring and possibly surgical intervention to mitigate potential complications. The impact of age on brain trauma outcomes is significant, with younger patients exhibiting greater neuroplastic potential and recovery prospects, while older individuals face compounded risks due to age-related brain alterations and comorbidities, increasing the challenge of achieving favorable outcomes. Comorbid conditions such as hypertension or diabetes can magnify the consequences of brain trauma by predisposing individuals to cerebrovascular dysregulation and impaired metabolic responses, thus highlighting the importance of comprehensive risk management and control of these factors in affected patients. Nutrition plays a crucial role in brain trauma recovery, with early and adequate nutritional support being essential for maintaining metabolic balance, supporting immune function, and promoting neurorecovery, underlining the importance of integrating nutritional therapy into the holistic care approach for these patients. Traumatic brain injury often results in an acute hypercoagulable state, where the risk of thromboembolic complications increases due to alterations in coagulation pathways, necessitating the judicious use of anticoagulation therapy tailored to the individual patient's risk profile to prevent secondary complications. Innovations in the management of brain trauma include the development of neuroprotective agents aimed at reducing oxidative stress and excitotoxicity, with research directed at compounds that can stabilize mitochondrial function and prevent the cascade of neuronal apoptosis being particularly promising. 21. The concept of a concussion spectrum of disorders captures the diversity and complexity of post-concussive symptoms arising from mild brain trauma, where patients may experience a range of cognitive, physical, and emotional symptoms that require individualized management strategies focused on gradual reintegration and rehabilitation. '22. Sleep disturbances, common following brain trauma, significantly impact recovery as they exacerbate fatigue, cognitive decline, and mood disorders. Thus, addressing sleep hygiene and, where necessary, pharmacological interventions are essential components of comprehensive brain injury management. '23. Rehabilitation after brain trauma focuses on the principle of neuroplasticity to encourage the re-establishment of neural connections, encompassing therapies like physical, occupational, and speech therapy tailored to the individual's specific needs, aimed at maximizing functional recovery and enhancing quality of life. '24. The catecholamine surge observed following acute brain trauma signifies a physiological stress response, potentially leading to systemic complications like hyperglycemia and cardiac arrhythmias, which healthcare providers must proactively manage to prevent exacerbation of the primary neurological injury. '25. Long-term cognitive outcomes after brain trauma are influenced by the initial severity of injury, extent of axonal damage, and the presence of post-traumatic complications, with emerging evidence suggesting that genetics and pre-existing mental health status also play significant roles in recovery trajectories. '26. Innovative assessment tools such as the Automated Neuropsychological Assessment Metrics, ANAM, are being developed to provide objective, computer-based evaluations of cognitive function in brain trauma patients, facilitating the early detection of cognitive deficits and informing rehabilitation strategies. '27. Technological advancements such as wearable sensors are being incorporated into brain trauma rehabilitation to enhance real-world monitoring of motor and cognitive activities, providing valuable feedback that guides therapeutic interventions and aids in tracking recovery progress in everyday environments. '28. The evolution of telemedicine is transforming the landscape of brain trauma care by increasing accessibility to specialists, enabling remote monitoring and consultations that ensure continuity of care, especially for patients in underserved or rural areas where access to specialized brain injury facilities is limited. '29. The complex interplay of genetic predisposition and environmental factors in brain trauma vulnerability and recovery suggests that personalized approaches incorporating genetic profiling and exposure history may enhance the precision of both preventative strategies and therapeutic interventions. '30. Research into blast-induced brain trauma as a distinct subset of traumatic brain injury highlights unique pathophysiological features such as primary blast wave impact and secondary barotrauma, necessitating specialized approaches for diagnosis, management, and long-term care tailored to the specific injury mechanism. '31. The role of neuroimaging in chronic traumatic encephalopathy, CTE, resulting from repeated brain trauma is evolving, with advanced modalities like positron emission tomography, PET, scans offering potential insights into tau deposition patterns that may herald new diagnostic and therapeutic frameworks. '32. Cognitive reserve, the brain's resilience to pathological damage, is a key factor in brain trauma outcomes, with individuals with higher cognitive reserve often showing better functional recovery, emphasizing the importance of educational and mentally stimulating activities as a form of protective intervention throughout life. '33. The risk of neurodegenerative diseases such as Alzheimer's or Parkinson's following brain trauma indicates that long-term surveillance and risk modification strategies are imperative in at-risk populations to potentially delay the onset or reduce the severity of these chronic conditions. 34. The development of brain organoids from stem cells provides a novel in vitro model for studying brain trauma, offering researchers an unprecedented opportunity to investigate the cellular and molecular mechanisms of injury and repair in a controlled laboratory environment that mimics human brain physiology. 35. Innovative rehabilitative techniques such as virtual reality, VR, are being harnessed in brain trauma therapy, offering immersive experiences that challenge cognitive and motor skills, engaging neural pathways in ways traditional therapies cannot, thus potentially accelerating the rehabilitation process. 36. Traumatic brain injury can disrupt the body's circadian rhythms, leading to a cascade of biological and behavioral changes such as altered sleep-wake cycles and hormone secretion, requiring interventions that aim to re-establish normal rhythmicity for overall well-being and recovery optimization. 37. Neuroendocrine regulation following brain trauma is critical, as dysregulation can result in significant clinical manifestations such as adrenal insufficiency or thyroid dysfunction, which necessitates vigilant hormonal monitoring and replacement therapy when indicated to support the patient's overall recovery. 38. Exploring the gut-brain axis in brain trauma highlights a pathway where changes in gut microbiota composition can influence central nervous system outcomes, with probiotics and dietary interventions potentially providing novel avenues to modulate secondary injury processes and support recovery. 39. The development of smart helmets, embedded with sensors, aims to revolutionize the prevention and immediate impact assessment of head injuries, providing real-time data on the magnitude and biomechanics of impacts that can inform immediate care and potential long-term risk evaluation. 40. The integration of artificial intelligence, AI, in brain trauma care leverages machine learning algorithms to predict outcomes based on a multitude of variables such as imaging findings, clinical data, and genetic information, enabling personalized treatment plans that optimize recovery and minimize complications. 41. Vascular changes after brain trauma, including the development of microthrombi and altered blood flow dynamics, play a crucial role in the progression of secondary brain injury, with research focusing on interventions that target endothelial function and blood-brain barrier repair to mitigate these effects. 42. Advances in understanding the role of exosomes, extracellular vesicles that facilitate cell communication, suggest that they could be harnessed to deliver therapeutic molecules to injured brain tissue, offering a novel strategy for repairing neuronal networks and reducing the impact of traumatic injuries. 43. Post-traumatic amnesia, a common symptom following brain trauma, reflects a transient disruption in anterograde and retrograde memory processing, and its duration can provide critical prognostic information regarding the severity of the injury and expected recovery timeline. 44. Children and adolescents with brain trauma require specially adapted management protocols, as their developing brains and distinct physiological responses necessitate tailored approaches in both acute care and rehabilitation to promote favorable neurodevelopmental outcomes. 45. Innovations in pharmacogenomics offer the potential to tailor drug treatments after brain trauma according to individual genetic profiles, optimizing efficacy and minimizing adverse effects, and opening new frontiers in personalized medicine for these complex injuries. 46. The role of early mobilization in brain trauma recovery is gaining attention as evidence supports that gradual activity resumption, under careful monitoring, can promote neuroplasticity, prevent complications from prolonged immobility, and support the physical and cognitive recovery of the patient. 47. Cognitive behavioral therapy, CBT, is proving to be a valuable adjunctive treatment for managing the psychological sequelae of brain trauma, addressing issues such as anxiety, depression, and cognitive distortions, which are common barriers to full functional recovery. 48. Emerging research into the role of mitochondrial dysfunction in brain trauma suggests that targeting these organelles to enhance bioenergetics and reduce oxidative stress could offer new therapeutic pathways to ameliorate secondary neuronal damage. The development of advanced neuromonitoring techniques, such as near-infrared spectroscopy, NIRS, offers non-invasive means to assess cerebral oxygenation in real time, providing crucial information that could guide interventions during the critical phases of brain trauma management. Brain trauma significantly affects emotional regulation, leading to challenges such as irritability or emotional blunting, which require integrated management strategies involving psychotherapy, pharmacotherapy, and family education to ensure holistic recovery and reintegration into daily life. 1. Liver cirrhosis is a chronic liver disease characterized by progressive fibrosis and regenerative nodule formation, leading to liver dysfunction, often resulting from chronic alcohol consumption, hepatitis B or C infections, and other chronic liver injuries, contributing to complications like portal hypertension, ascites, hepatic encephalopathy, and increased risk of hepatocellular carcinoma. 2. The diagnosis of liver cirrhosis is often based on clinical features, laboratory tests showing liver dysfunction, imaging studies like ultrasound or CT scans revealing nodular liver surface and altered architecture, and sometimes a liver biopsy confirming histological findings of fibrosis and nodular regeneration, particularly when the etiology is uncertain. 3. Ascites, the accumulation of fluid in the abdominal cavity, is a common complication of liver cirrhosis and results from portal hypertension and hypoalbuminemia, often diagnosed through physical examination, ultrasound confirming fluid presence, and analysis of acidic fluid regarding cell count and albumin concentration to rule out spontaneous bacterial peritonitis and malignant causes. 4. In liver cirrhosis, portal hypertension arises due to increased resistance to portal blood flow through the fibrotic liver, manifesting clinically as splenomegaly, variceal hemorrhage, ascites, and caput medusae, diagnosed through clinical examination, endoscopic findings of varices, and imaging modalities showing dilated portal system vessels. 5. Hepatic encephalopathy is a neuropsychiatric syndrome associated with liver cirrhosis, characterized by a spectrum from subtle cognitive dysfunction to coma, predominantly caused by elevated systemic ammonia levels due to impaired hepatic detoxification, and is often reversible with medical treatment and dietary protein modification. 6. Liver cirrhosis significantly alters pharmacokinetics and pharmacodynamics, resulting in enhanced drug adverse effects or reduced efficacy, necessitating careful drug choice and dosing due to compromised hepatic metabolism and altered plasma protein binding capabilities, requiring particular caution with drugs such as NSAIDs, sedatives, and anticoagulants. 7. Jaundice in liver cirrhosis results from the liver's inability to adequately conjugate and excrete bilirubin due to liver cell dysfunction, leading to elevated levels of unconjugated bilirubin, presenting with yellowish skin and scleral discoloration, dark-colored urine, and pale stools, serving as a marker of advanced liver disease. 8. Variceal hemorrhage is a life-threatening complication of liver cirrhosis caused by rupture of esophageal or gastric varices, a consequence of portal hypertension, presenting with hematemesis or melena, requiring urgent endoscopic assessment and possible intervention alongside pharmacological measures such as vasopressin analogs and prophylactic measures in high-risk patients. 9. Liver cirrhosis increases the risk of hepatorenal syndrome, a functional renal failure associated with portal hypertension and circulatory dysfunction, characterized by marked vasoconstriction of renal vessels leading to reduced glomerular filtration rate, and treated with volume expansion, vasoconstrictors, and ultimately bridging to liver transplantation. 10. Ultrasound elastography is a non-invasive imaging technique used to assess liver stiffness and fibrosis severity in liver cirrhosis, providing a quantitative measure correlated with histopathological fibrosis stage, assisting in monitoring disease progression and guiding clinical decision-making regarding cirrhosis management without the need for repeat liver biopsies. (11) Spider angiomas, small, dilated blood vessels with a central red dot, frequently occur in liver cirrhosis due to hyperestrogenism from impaired estrogen metabolism, serving as a clinical hallmark observed on the upper body, often found alongside palmar erythema, both of which may signify advanced liver disease. (12) Serum to ascites albumin gradient, SAG, is a diagnostic tool differentiating causes of ascites in patients with liver cirrhosis. A gradient greater than or equal to 1.1 grams per deciliter indicates portal hypertension-related ascites, helping to exclude non-cirrhotic causes such as peritoneal carcinomatosis or tuberculosis. (13) Nutritional deficits are prevalent in liver cirrhosis due to malabsorption, altered metabolism, and poor dietary intake, necessitating nutritional assessment and intervention focusing on ensuring adequate calorie intake, avoiding protein-energy malnutrition, and supplementing vitamins and minerals like zinc and vitamin D to improve clinical outcomes. (14) Thrombocytopenia in liver cirrhosis can stem from splenic sequestration of platelets secondary to portal hypertension or decreased thrombopoietin production by the liver, contributing to increased bleeding risk, and necessitating caution with invasive procedures and potential platelet transfusion prior to surgery. 15. The Child-Pugh score is an assessment tool used to evaluate the prognosis of chronic liver disease, incorporating clinical and laboratory parameters including bilirubin, albumin, prothrombin time, ascites, and hepatic encephalopathy, categorizing cirrhosis severity into classes A, B, or C, which helps guide therapeutic strategies and predict perioperative risk. (16) Alcoholic cirrhosis results from prolonged heavy alcohol intake leading to liver inflammation and scarring, and is often accompanied by steatosis and alcoholic hepatitis, requiring absolute abstinence from alcohol as the primary treatment, which can stabilize or ameliorate liver damage and improve overall prognosis. (17) Liver transplantation is a definitive treatment for end-stage liver cirrhosis, indicated when medical management fails or life-threatening complications ensue, involving replacing the diseased liver with a healthy donor liver, a procedure with careful recipient selection based on criteria such as MELD score predicting post-transplant survival. (18) Metabolic and physiological alterations in liver cirrhosis cause muscle wasting, known as sarcopenia, due to factors like systemic inflammation, hormonal imbalances, and altered amino acid catabolism, necessitating focused nutritional and physical rehabilitation strategies to improve patient mobility, quality of life, and survival outcomes. (19) Hepatopulmonary syndrome is a vascular complication of liver cirrhosis, characterized by hypoxemia due to intrapulmonary vascular dilation and shunting, presenting with dyspnea and platypnea orthodeoxia, requiring diagnosis through contrast-enhanced echocardiography and supplemental oxygen, with definitive treatment through liver transplantation. (20) The MELD, Model for End-Stage Liver Disease, score is an objective prognostic tool used to prioritize liver transplantation candidates based on a formula incorporating bilirubin, INR, and creatinine levels to predict 3-month mortality risk in cirrhotic patients, influencing the allocation of donor livers in liver transplant programs. 21. Non-alcoholic steatohepatitis, NASH, related cirrhosis is increasingly recognized due to the global rise of obesity and metabolic syndrome, presenting initially with fatty liver and progressing to inflammation and fibrosis, necessitating lifestyle modifications, with emerging pharmacological therapies targeting metabolic pathways in ongoing research phases. Portal hypertensive gastropathy is a condition associated with liver cirrhosis, resulting in mucosal changes in the stomach and stomach bleeding due to portal hypertension, identified through endoscopy as mosaic-like patterns and treated with beta blockers to reduce portal pressure and prevent recurrent bleeding. 23. Biliary cirrhosis results from chronic injury and destruction of bile ducts, seen in conditions like primary biliary cholangitis, with subsequent fibrosis and cirrhosis development, presenting with cholestatic jaundice, pruritus, and elevated alkaline phosphatase levels, and treated with ursodeoxycholic acid to slow disease progression. 24. Autoimmune hepatitis can progress to liver cirrhosis if untreated, characterized by necroinflammatory liver damage, presence of autoantibodies, and elevated immunoglobulin G, necessitating immunosuppressive therapy as treatment, typically with corticosteroids and azathioprine to achieve remission and prevent cirrhotic progression. 25. Hepatorenal syndrome type 1 is a rapidly progressive form of renal failure seen in patients with advanced liver cirrhosis, associated with marked renal hypoperfusion and poor prognosis, necessitating urgent supportive measures such as albumin infusion and vasoconstrictors while awaiting liver transplantation as the definitive treatment. 26. Hyperestrogenemia in liver cirrhosis, due to impaired hepatic metabolism leading to elevated estrogen levels, causes clinical signs like gynecomastia, testicular atrophy, and red palms, and may contribute to vascular changes in coagulopathy, necessitating management of underlying liver dysfunction to alleviate these hormonal imbalances. 27. Coagulopathy in liver cirrhosis results from impaired liver synthesis of clotting factors and thrombocytopenia, leading to increased bleeding risks, requiring careful monitoring of coagulation parameters and cautious use of anticoagulants, as well as possible administration of clotting factor concentrates or platelet transfusions in bleeding episodes. 28. Portal vein thrombosis in liver cirrhosis can worsen portal hypertension and is often asymptomatic or presents with abdominal pain and gastrointestinal bleeding, requiring anticoagulation therapy balancing bleeding risks, and possibly interventional procedures like thrombectomy or shunt placement in refractory cases. 29. In liver cirrhosis, small intestinal bacterial overgrowth can occur due to altered gut motility and bile salt deficiency, contributing to further liver damage through bacterial translocation and endotoxemia, managed with a combination of antibiotics, probiotics, and dietary changes to restore balanced gut flora and reduce liver insults. 30. In advanced liver cirrhosis, patients may develop hepatopulmonary syndrome characterized by pulmonary vasodilation leading to hypoxemia and dyspnea, with a diagnosis supported by arterial blood gas analysis and contrast-enhanced echocardiography, managed with oxygen therapy and considering liver transplantation as a definitive cure. 31. Spontaneous bacterial peritonitis, SBP, is a severe and often recurrent infection of acidic fluid in patients with liver cirrhosis, frequently caused by gram-negative bacteria, diagnosed through acidic fluid analysis showing polymorphonuclear leukocytes count greater than 250 cells per cubic millimeter and treated urgently with antibiotics and albumin infusions. 32. Hyperdynamic circulation is a feature of advanced liver cirrhosis, characterized by increased cardiac output, decreased systemic vascular resistance, and compensatory mechanisms involving renin-angiotensin and sympathetic nervous systems, contributing to complications like variceal bleeding and requiring beta blockers for hemodynamic stabilization. 3. Patients with liver cirrhosis may develop a compensatory gastric ulcer due to altered gastric mucosal protection and increased portal pressure affecting gastric blood flow, necessitating regular endoscopic evaluation and preventive measures like proton pump inhibitors or treating Helicobacter pylori infection if present. 34. Hepatic hydrothorax in liver cirrhosis is the accumulation of pleural fluid typically on the right side due to transdiaphragmatic migration of acidic fluid in the presence of diaphragmatic defects, leading to respiratory distress and managed through therapeutic thoracentesis, dietary sodium restriction, and diuretics, with liver transplantation as curative. 35. Changes in dermal collagen composition and metabolism may occur in liver cirrhosis due to alterations in circulating cytokines and growth factors, leading to complications like Dupuytren's contracture, which is recognized by palmar fascia thickening and flexion contractures of fingers, managed conservatively or surgically if functional impairment arises. 36. Liver cirrhosis patients have an increased risk of osteopenia and osteoporosis due to malabsorption of fat-soluble vitamins, specifically vitamin D, and alterations in bone metabolism, necessitating regular bone density screening and calcium and vitamin D supplementation to prevent fractures and maintain bone health. 37. Cutaneous manifestations such as leukonychia, due to hypoalbuminemia, and Terry's nails, characterized by proximal nail whitening, are observed in liver cirrhosis, serving as non-invasive clinical indicators of chronic liver disease severity and necessitating management of underlying liver dysfunction for improvement. 38. Increased levels of cytokines and oxidative stress markers in liver cirrhosis contribute to systemic inflammation, and these are linked to disease progression and suppression of the immune system, which underlines the therapeutic focus on antioxidants and immunomodulatory strategies alongside traditional cirrhosis management. 39. Cholestasis in liver cirrhosis results from impaired bile flow due to bile duct obstruction or failure of bile excretion from hepatocytes, clinically presenting with jaundice, pruritus, and pale stools, and requires addressing the cirrhotic cause, with interventions like ursodeoxycholic acid or stent placement in biliary obstructions. 40. Hepatic artery buffer response, important for maintaining liver perfusion in cirrhosis, is a regulatory mechanism where hepatic artery flow increases to compensate for the reduction in portal flow, but becomes dysregulated in advanced cirrhosis, contributing to further hepatic hypoperfusion and necessitating medical management to optimize circulation. 41. Sepsis-induced acute on chronic liver failure is a condition where liver cirrhosis is exacerbated by systemic inflammation and infection, presenting with hepatic decompensation and multi-organ failure, underscoring the need for rapid identification and aggressive treatment of infections alongside supportive care measures. 42. Splenomegaly in patients with liver cirrhosis develops due to portal hypertension, leading to increased splenic venous pressure and resultant hyperplasia, often resulting in hypersplenism and cytopenias, and may require interventions like splenic embolization or partial splenectomy in severe symptomatic cases. 43. Hepatic stellate cells play a crucial role in cirrhosis pathophysiology, as they transform from quiescent vitamin A fat-storing cells into activated myofibroblasts, producing excessive extracellular matrix proteins leading to fibrosis, which highlights them as therapeutic targets for antifibrotic agents to halt or reverse liver cirrhosis progression. 44. Endoscopic band ligation is a treatment modality for esophageal varices in liver cirrhosis, performed to prevent variceal hemorrhage by placing rubber bands to induce thrombosis and fibrosis of variceal veins, effectively reducing variceal bleeding risk and often complemented by beta blocker therapy for long-term management. 45. Advanced liver cirrhosis impairs hormonal metabolism, leading to endocrine dysfunctions such as hypogonadism, insulin resistance, and feminization in men, necessitating multidisciplinary management including lifestyle modifications and hormonal therapies to mitigate reproductive and metabolic repercussions on patient health. '46. Lipopolysaccharide, LPS, endotoxin from gut-derived bacteria can exacerbate cirrhosis by enhancing systemic inflammation and hepatocyte injury, implicating the gut-liver axis as a target for therapeutic interventions such as probiotic therapy, antibiotics, and nutritional management to restore intestinal barrier function and reduce systemic endotoxemia. '47. Hepatic coagulopathy management in cirrhosis may involve recombinant factor VIIA in cases of significant bleeding, synthesizing coagulative deficiencies in the face of resistant bleeding, highlighting the complexity of balancing hemostasis with thrombosis risk, requiring individualized treatment strategies based on patient bleeding profiles. '48. Liver cirrhosis patients' dysregulated hormonal synthesis leads to mineralocorticoid excess with clinical features like edema, contributing to ascites and complicating diuretic therapy. Although reflecting reduced aldosterone metabolism, careful adjustment of diuretics and monitoring of electrolyte balance remains crucial in management. '49. Anemia in liver cirrhosis arises from multifactorial causes including hypersplenism, gastrointestinal bleeding, and anemia of chronic disease, necessitating diagnostic evaluation to direct management options such as transfusions, iron supplementation, or addressing underlying causes like gastric ulcers or variceal bleeding. '50. Rifaximin is an orally administered, gut-specific antibiotic used in the treatment of recurrent episodes of hepatic encephalopathy and liver cirrhosis. Acting by altering gut flora to reduce ammonia production, it complements lactulose therapy and has a favorable side effect profile due to minimal systemic absorption. '1. A cerebral aneurysm is a localized dilation in a blood vessel within the brain, often forming at artery junctions due to intrinsic weaknesses in the vessel wall that can be exacerbated by conditions like hypertension and atherosclerosis, raising the risk of rupture, which can lead to a potentially life-threatening hemorrhagic stroke. 2. The rupture of a cerebral aneurysm results in a subarachnoid hemorrhage, characterized by a sudden, severe headache often described as a thunderclap, or worst headache of life, due to the rapid increase in intracranial pressure, with symptoms potentially including neck stiffness, photophobia, nausea, vomiting, and impaired consciousness. 3. Many cerebral aneurysms remain asymptomatic until rupture, but unruptured aneurysms may occasionally cause symptoms by pressing on surrounding brain tissue or nerves, potentially leading to focal neurological deficits such as vision changes, pain above or behind an eye, or numbness on one side of the face. 4. The pathophysiology of cerebral aneurysms involves a complex interplay of genetic factors, hemodynamic stress, inflammation, and extracellular matrix remodeling that weakens the blood vessel wall, primarily affecting the internal elastic lamina and media layers, making the vessel more prone to dilation and rupture. 5. The gold standard for diagnosing cerebral aneurysms non-invasively is magnetic resonance angiography, MRA, or computed tomography angiography, CTA, which provides detailed images of blood vessels in the brain, allowing clinicians to identify even small aneurysms and assess their size, shape, and location. '6. Risk factors for the development and rupture of cerebral aneurysms include smoking, hypertension, family history, age over 40, female gender, alcohol abuse, and certain genetic disorders such as polycystic kidney disease or Ehlers-Danlos syndrome, which can contribute to connective tissue weaknesses. 7. Management of unruptured cerebral aneurysms involves a careful balance between regular monitoring and surgical intervention, with decisions influenced by the size, location, morphology of the aneurysm, and patient-related factors such as age, health status, and risk tolerance, to minimize potential rupture complications. Eight, endovascular coiling is a minimally invasive procedure commonly used to treat cerebral aneurysms by inserting a catheter through the blood vessels to the site of the aneurysm, where detachable coils are placed to induce clotting, effectively sealing off the aneurysm and reducing the likelihood of rupture. 9. Surgical clipping of a cerebral aneurysm involves an open craniotomy to access the aneurysm directly, allowing a neurosurgeon to place a metal clip at the neck of the aneurysm, thereby isolating it from the parent vessel, which is a more invasive but often definitive treatment compared to endovascular techniques. 10. The choice between coiling and clipping may depend on various factors, such as the aneurysm's size, shape, and location, as well as the patient's overall health and the availability of experienced surgical and endovascular teams, with both methods having their unique risks and benefits in terms of efficacy and recovery. 11. Cerebral vasospasm is a potential complication following the rupture of a cerebral aneurysm, where the sudden release of blood into the subarachnoid space leads to narrowing of cerebral arteries, which can significantly reduce blood flow and cause further brain injury, often peaking 3 to 14 days after the initial hemorrhage. 12. Nimodipine, a calcium channel blocker, is routinely administered orally in the acute management of subarachnoid hemorrhage from a ruptured cerebral aneurysm to prevent or mitigate the effects of cerebral vasospasm and associated ischemic deficits, despite its hypotensive effect requiring cautious monitoring of blood pressure. 13. The Hunt and Hess scale in the World Federation of Neurosurgical Societies (WFNS) scale are clinical grading systems used to assess the severity of aneurysmal subarachnoid hemorrhage, helping to predict outcomes by evaluating factors like the patient's level of consciousness, presence of focal neurological deficits, and overall clinical condition. 14. The Fisher scale, based on the amount and distribution of blood seen on initial CT scans, is used to grade subarachnoid hemorrhage from a ruptured cerebral aneurysm, offering prognostic information regarding the likelihood of vasospasm, with higher grades indicating an increased risk and need for vigilant monitoring and intervention. 15. Seizures may occur after the rupture of a cerebral aneurysm due to the acute brain injury and cortical irritation caused by subarachnoid hemorrhage or increased intracranial pressure, necessitating prophylactic or therapeutic anticonvulsant medication in some patients to manage and prevent further neurological complications. 16. Genetic testing for individuals with familial history of cerebral aneurysms may help identify underlying hereditary factors, especially in cases of connective tissue disorders like Marfan syndrome, providing insights into potential predispositions and enabling proactive monitoring or early intervention to manage increased rupture risks. 17. Acute management of a ruptured cerebral aneurysm focuses on stabilizing the patient's condition through airway management, blood pressure control, intracranial pressure monitoring, and potentially early surgical intervention to prevent rebleeding and manage complications that could worsen patient outcomes. 18. Secondary complications like hydrocephalus, an accumulation of cerebrospinal fluid due to impaired reabsorption following subarachnoid hemorrhage, may require the placement of a temporary external ventricular drain or a permanent ventriculoperitoneal shunt to alleviate pressure in the ventricles, preventing further damage to brain tissue. 19. Lifestyle modifications, including smoking cessation, alcohol moderation, regular blood pressure monitoring, and a heart-healthy diet, are recommended for individuals at risk of cerebral aneurysms to reduce modifiable risk factors associated with aneurysm development and rupture, contributing to improved long-term outcomes. 20. High-resolution vessel wall imaging using MRI can provide insights into the morphology and histopathology of cerebral aneurysms, allowing the visualization of intraluminal thrombus, aneurysm wall inflammation, or instability, thus helping in the stratification of rupture risk and guiding clinical management decisions. Computational fluid dynamics is an emerging tool that allows the assessment of hemodynamic forces at play within and around cerebral aneurysms, providing valuable data on flow patterns that may influence aneurysm growth and rupture risk, and can aid in the customization of treatment approaches or the development of new interventions. The role of inflammation in cerebral aneurysm pathogenesis is under active research, with evidence suggesting that an inflammatory response within the aneurysm wall contributes to wall degeneration and rupture, highlighting potential therapeutic targets for anti-inflammatory agents that could stabilize aneurysms or slow their progression. In the acute phase of cerebral aneurysm rupture, managing intracranial pressure is paramount, often requiring sedation, hyperosmolar therapy, and careful ventilation strategies to ensure adequate cerebral perfusion, while avoiding interventions that could exacerbate swelling or lead to secondary brain injury. Advances in endovascular technology, such as flow-diverting stents, provide alternatives for treating wide-necked or complex cerebral aneurysms, working by redirecting blood flow away from the aneurysm sac, promoting healing and vessel remodeling, and broadening the options for minimally invasive treatment. The size and shape of a cerebral aneurysm are critical determinants in assessing rupture risk, with large, greater than 7 mm, and irregularly shaped aneurysms are those exhibiting daughter sacs, carrying a higher propensity for rupture compared to small, smooth-walled aneurysms, which may warrant closer monitoring or more immediate intervention. COPD, or chronic obstructive pulmonary disease, is a group of progressive lung disorders including emphysema and chronic bronchitis, primarily associated with prolonged smoking, characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities usually caused by significant exposure to noxious particles or gases, prompting clinicians to advise early smoking cessation and lifestyle modifications as preventive measures. Spirometry is the gold standard diagnostic test for COPD, requiring measurement of forced expiratory volume in 1 second, FEV1, and forced vital capacity, FVC, with an FEV1-FVC ratio of less than 0.70 post-bronchodilator, confirming persistent airflow limitation indicative of COPD, thus differentiating it from asthma and other respiratory conditions. Emphysema, a form of COPD, involves destruction of the alveoli, reducing the surface area available for gas exchange, which leads to symptoms such as shortness of breath, exertional dyspnea, and barrel-shaped chest on physical examination, highlighting the importance of lung volume reduction strategies like smoking cessation and pulmonary rehabilitation. Chronic bronchitis, another variant of COPD, is characterized by productive cough lasting at least 3 months in 2 consecutive years, with hypertrophy and hyperplasia of mucus-secreting glands in the airways leading to excessive mucus production, obstructed airflow, and a higher susceptibility to respiratory infections, thereby necessitating vaccination adherence and prompt treatment of infections. The pathophysiology of COPD involves chronic inflammation of the airways, parenchyma, and pulmonary vasculature, resulting in structural changes, narrowing of small airways, and destruction of lung tissue, driven largely by cigarette smoke and other environmental pollutants, reinforcing the importance of environmental control measures, particularly in occupational settings. Pharmacologic management of COPD primarily involves bronchodilators such as beta-2 agonists and anticholinergics, which work by relaxing airway-smooth muscles and improving expiratory flow, often used in combination with inhaled corticosteroids in patients with frequent exacerbations to reduce inflammation and the frequency of acute episodes, aiming for better symptom control and quality of life. Seven. Inhaled long-acting muscarinic antagonists, LAMAs, are effective components of COPD therapy, offering prolonged bronchodilation and symptom relief by blocking muscarinic receptors in the airway-smooth muscle, which reduces the frequency of exacerbations and improves airflow, thereby becoming a cornerstone in the treatment of moderate to severe COPD. 8. Systemic corticosteroids are commonly used during acute exacerbations of COPD to reduce airway inflammation and hasten recovery, though their use should be limited to short courses due to potential adverse effects like osteoporosis and hyperglycemia, emphasizing the importance of monitoring and managing these risks in long-term COPD care. 9. The use of supplemental oxygen therapy is crucial in managing COPD patients with chronic hypoxemia, as it improves survival, exercise tolerance, and the quality of life in patients meeting criteria like resting PaO2 of 55 mm of mercury or below, or SaO2 of 88% or below, underscoring the need for regular arterial blood gas assessments. 10. Pulmonary rehabilitation is an integral part of COPD management, combining exercise training, education, and behavioral changes to improve the physical and psychological condition of people with COPD, enhancing their overall quality of life and reducing the frequency and severity of exacerbations through personalized care plans. Alpha-1 antitrypsin deficiency is a genetic risk factor for COPD, especially in younger patients or non-smokers presenting with early-onset emphysema, marking the significance of familial screening and the potential benefit of augmentation therapy with plasma-purified human alpha-1 antitrypsin to slow disease progression. Nutritional support is vital in COPD management, as malnutrition and weight loss are common concerns due to increased metabolic demands and reduced appetite from dyspnea. So maintaining a balanced diet with adequate caloric and protein intake is emphasized to optimize pulmonary function and overall health. 13. Smoking cessation is the most effective intervention for halting the progression of COPD and can lead to significant improvements in lung function over time, making support programs, counseling, and pharmacotherapy such as nicotine replacement therapy and varenicline critical components of long-term disease management. 14. COPD exacerbations are acute episodes of worsening respiratory symptoms with increased frequency, severity, or production of sputum, often triggered by viral or bacterial infections, necessitating prompt treatment with bronchodilators, systemic corticosteroids, and antibiotics if indicated, to reduce hospital admissions and improve patient outcomes. 15. The BODE index, which evaluates body mass index, airflow obstruction, dyspnea, and exercise capacity, is a multidimensional scoring system useful for predicting the prognosis of COPD patients by integrating clinical parameters to guide therapeutic decisions and discussions about disease progression and care plans. Chronic inflammation in COPD contributes to systemic effects such as skeletal muscle dysfunction, cardiovascular disease, and osteoporosis, requiring a multidisciplinary approach for management, including regular monitoring, appropriate pharmacotherapy, lifestyle interventions, and optimization of comorbid conditions. 17. Regular vaccination against influenza and pneumococcal pathogens is recommended for COPD patients to reduce the risk of respiratory infections that can lead to exacerbations, hospitalization, and mortality, reinforcing the need for healthcare providers to prioritize immunizations as part of comprehensive COPD care. 18. Psychological distress is prevalent among COPD patients, with depression and anxiety significantly affecting their quality of life and disease outcomes, highlighting the necessity of routine mental health evaluations and the provision of appropriate support, counseling, or pharmacotherapy when needed to address these issues effectively. 19. Inhaler technique is critical in COPD management, as improper use can lead to suboptimal drug delivery and poor disease control, emphasizing the need for regular assessment and patient education on correct inhaler techniques to ensure maximum therapeutic benefit from prescribed medications. 20. Nebulized drug delivery systems offer an alternative for COPD patients struggling with inhaler coordination, providing medication through a fine mist that is easier to inhale, particularly for individuals with severe disease or during exacerbations, ensuring adequate drug deposition and symptom relief. 21. Dyspnea, or shortness of breath, is a hallmark symptom of COPD, often perceived as a constant or episodic air hunger by patients, which warrants timely assessment to differentiate from other potential causes, ensuring targeted interventions like pulmonary rehabilitation and optimized pharmacotherapy are implemented to enhance patient comfort and function. 22. Lung function decline in COPD occurs gradually, with annual reductions in FEV1 typically exceeding those seen with normal aging, thus highlighting the significance of early detection, consistent monitoring, and aggressive management strategies to slow disease progression and preserve lung capacity. 23. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a classification system for COPD severity based on the degree of airflow limitation, frequency of exacerbations, and patient-reported symptom burden, guiding the tailored pharmacological and non-pharmacological treatment approaches for individual patients. 24. Airway clearance techniques such as chest physiotherapy and the use of devices like the flutter valve or acapella are beneficial for COPD patients with chronic sputum production, facilitating mucus clearance and improving ventilation, hence preventing secondary infections and improving respiratory function. 25. Endoscopic lung volume reduction procedures, such as endobronchial valve placement, offer an innovative treatment option for patients with severe emphysema, aiming to collapse hyperinflated lung compartments and improve respiratory mechanics, thus enhancing exercise tolerance, pulmonary function, and quality of life. 26. Genetic factors alongside environmental exposures contribute to COPD development, with research indicating specific genetic variants influencing susceptibility to the disease, which underscores the potential for identifying at-risk individuals and developing novel prophylactic or therapeutic strategies through personalized medicine. 27. Breathlessness can exacerbate physical inactivity in COPD patients, resulting in a deconditioning cycle that worsens symptoms and disease outcomes, thus highlighting the importance of individualized exercise programs within pulmonary rehabilitation to break this cycle and promote better health and functionality. 28. Comorbidities such as cardiovascular disease, diabetes, and lung cancer are frequently associated with COPD, complicating disease management and prognosis, emphasizing the necessity for a comprehensive approach that includes routine screening, management of concurrent conditions, and coordinated patient care. 29. Exacerbations in COPD, characterized by a sudden worsening of symptoms, are multifactorial, with a large proportion attributed to respiratory infections and environmental pollutants, necessitating rapid management and preventive strategies, including medications and lifestyle interventions to reduce their occurrence. 30. COPD's economic burden is significant, impacting healthcare systems due to hospitalization, medication costs, and lost productivity, thereby stressing the importance of preventive measures, effective management strategies, and patient education to alleviate the financial burden associated with chronic disease. Pulmonary function tests beyond spirometry, like diffusion capacity for carbon monoxide, DLCO, provide insights into gas exchange efficiency in COPD, which can help differentiate emphysema from other lung pathologies and tailor management strategies to the specific physiological impairments present in each patient. 32. Air pollution is a significant environmental risk factor for COPD exacerbations, with exposure to pollutants like particulate matter and ozone exacerbating symptoms, underscoring the need for strategies to minimize patient exposure and mitigate the health impacts of poor air quality on vulnerable populations. 3. A significant overlap exists between COPD and asthma, with some patients exhibiting characteristics of both, known as asthma-COPD overlap, ACO, necessitating a nuanced diagnostic and therapeutic approach that incorporates treatment regimens from both COPD and asthma guidelines for optimal management. 34. Opioid use in COPD for intractable dyspnea management should be carefully monitored due to the risk of respiratory depression, and is generally reserved for severe cases where other interventions have failed, requiring careful dose titration, monitoring, and evaluation to minimize potential adverse effects. 35. Combining long-acting beta-2 agonists, LABAs, and inhaled corticosteroids can be more effective for patients with frequent exacerbations and higher eosinophilic inflammation in managing COPD, working synergistically to improve lung function, quality of life, and reduce exacerbation frequency and severity. 36. Social support networks play an essential role in managing COPD, as they can provide emotional support, encourage adherence to treatment plans, and facilitate lifestyle changes, emphasizing the importance of engaging family members and care partners in the management process to optimize outcomes. 37. Sputum color and consistency in COPD can provide clues about potential infections, with changes often indicating bacterial colonization, thus guiding antibiotic selection when necessary, highlighting the necessity for healthcare providers to closely monitor these changes and adjust treatment accordingly. 38. Respiratory muscle training can improve respiratory muscle strength in COPD patients, enhancing exercise capacity and reducing the sensation of dyspnea, being an important component of pulmonary rehabilitation programs and contributing to better overall function and quality of life in these patients. 39. COPD can disrupt the sleep patterns of sufferers, often leading to poor sleep quality due to nocturnal breathlessness or frequent coughing, making the assessment and management of sleep disturbances an essential part of comprehensive COPD care to improve patient well-being and daytime functioning. 40. Individualized action plans for COPD patients detail steps to take in response to changes in symptoms or exacerbation warning signs, empowering patients to manage their condition proactively and reducing unnecessary emergency department visits, emphasizing the importance of patient education and engagement in COPD management. 41. Newer targeted therapies are being explored for COPD, focusing on the underlying inflammatory pathways and protease-antiprotease imbalances, which could offer future options to alter the disease process, although current management primarily revolves around symptom relief and exacerbation prevention. 42. Effective communication between COPD patients and their healthcare team is paramount, as it ensures a shared understanding of the disease, treatment goals, and management strategies, fostering adherence to complex therapeutic regimens, mitigating potential barriers, and enhancing patient autonomy and satisfaction. 43. Thromboembolic events are a known complication of COPD, likely due to systemic inflammation and hypoxia-related coagulation abnormalities, necessitating vigilance for signs of deep vein thrombosis or pulmonary embolism and the consideration of prophylactic anticoagulation in high-risk individuals to prevent adverse outcomes. '44. Gas trapping in COPD is a natural consequence of poor airflow and airway collapse during expiration, leading to hyperinflation which can impair respiratory mechanics and cardiac function, underscoring the need for treatments aimed at improving airflow and gas exchange to reduce hyperinflation and symptom burden. '45. Home monitoring devices, including pulse oximeters and spirometers, can empower COPD patients to track their health at home and facilitate early intervention for exacerbations, enhancing self-management skills and allowing for tailored adjustments to their treatment plans by healthcare professionals based on objective data. '46. COPD has a significant burden on mental health, heightening risks for anxiety and depression, which can exacerbate physical symptoms and hinder treatment adherence, necessitating regular psychological assessment and the integration of mental health support within the multidisciplinary care framework for optimal outcomes. '47. Exacerbations can be predicted in COPD by monitoring changes in symptoms, exposure to infection, or environmental pollutants, with machine learning models and wearable technology being developed to provide real-time risk assessment, enabling timely interventions and potentially reducing the frequency of these acute events. '48. Knowing the symptoms and etiology of COPD involves understanding the finely tuned balance of protease and antiprotease activity in the lungs which, when dysregulated due to smoking or genetic predisposition, leads to tissue destruction and the classical features of emphysema, stressing the complexity of pathophysiological pathways that require targeted interventions. '49. Comorbid respiratory infections can perpetuate COPD exacerbations, making the identification and management of pathogens, whether bacterial or viral, integral to reducing symptom burden and preventing further respiratory decline, necessitating vigilant diagnostic approaches and appropriate antimicrobial therapies. '50. The psychosocial aspects of living with COPD, such as the loss of independence and social isolation due to physical limitations, can greatly impact overall well-being, underscoring the importance of integrating social support services, therapy, and encouragement of self-efficacy within comprehensive COPD management programs. '1. Hepatitis B is a viral infection caused by the hepatitis B virus that primarily affects the liver, leading to both acute and chronic disease states, with symptoms such as jaundice, fatigue, and abdominal pain often seen in acute cases, while chronic infection can progress to cirrhosis or liver cancer over several years if left untreated, highlighting the importance of early diagnosis and intervention. '2. The hepatitis B virus is a small, enveloped DNA virus belonging to the Hepidnaviridae family, and it replicates through an RNA intermediate using reverse transcription, which is a unique feature among DNA viruses and contributes to its ability to establish a persistent infection in the host liver cells. 3. Diagnosis of hepatitis B infection involves serological testing for surface antigens, HBsAg, surface antibodies, anti-HBs, and core antibodies, anti-HBc, which together help to determine the infection status, such as acute, chronic, or resolved infection, and vaccination response. '4. Hepatitis B surface antigen, HBsAg, is often the first marker to appear in the blood following infection and serves as an indicator of active viral replication, while the persistence of HBsAg beyond 6 months usually indicates progression to chronic hepatitis B infection. 5. The presence of hepatitis B antigen. HBAg in the blood is associated with higher levels of viral replication and infectivity, and its conversion to anti-HBe antibodies, HBe seroconversion, often signifies a reduction in viral activity and an improved prognosis in chronic hepatitis B patients. In chronic hepatitis B, liver histopathology may reveal varying degrees of inflammation, fibrosis, or cirrhosis, and liver biopsy remains a useful diagnostic tool to assess the extent of liver damage and guide therapeutic decisions, although non-invasive tests are increasingly used to evaluate liver fibrosis. The primary treatment goals in managing chronic hepatitis B are to prevent disease progression such as cirrhosis or hepatocellular carcinoma, reduce viral load to undetectable levels, and enhance the patient's quality of life. These are achieved through antiviral therapy with drugs like tenofovir or entecavir. Antiviral medications like tenofovir disoproxil fumarate or entecavir are recommended as first-line therapy for chronic hepatitis B due to their high barrier to developing viral resistance, potent suppression of viral replication, and satisfactory safety profile, though patient monitoring for potential renal or bone side effects is necessary. Pegylated interferon alpha therapy can be an alternative treatment option for some patients with chronic hepatitis B, particularly in those with genotype A infection or younger patients, as it may lead to higher rates of HBsAg clearance, representing functional cure, though the treatment is limited by its considerable side effects. The prevention of hepatitis B transmission relies heavily on vaccination, with the hepatitis B vaccine, consisting of purified HBsAg, being highly effective at inducing protective immunity and recommended for all infants at birth, healthcare workers, and other high-risk groups to curb the spread of the virus. Mother-to-child transmission of hepatitis B can be significantly reduced by administering the hepatitis B vaccine and hepatitis B immune globulin, HBIG, to newborns within 12 hours of birth, especially if the mother is HBsAg positive, thereby preventing the development of chronic hepatitis B in the infant. Chronic hepatitis B infection is a major global health issue, with over 296 million people estimated to be infected worldwide, leading to significant morbidity and mortality as it causes liver-related complications such as cirrhosis and hepatocellular carcinoma, highlighting the importance of public health measures for prevention and control. Hepatitis B virus can be transmitted in several ways, including through unprotected sexual contact, exposure to infected blood, perinatal transmission from an infected mother to her child, and through unsafe injections or blood transfusions, necessitating comprehensive prevention strategies to reduce transmission rates. The incubation period for hepatitis B ranges from 30 to 180 days, during which time the virus proliferates in liver cells, leading to symptoms of acute hepatitis as the immune system mounts a response. Symptoms include malaise, anorexia, nausea, and jaundice, which often indicate liver inflammation. In early acute hepatitis B infection, liver enzymes such as alanine aminotransferase (ALT) and aspartate aminotransferase (AST) are elevated, reflecting liver cell injury. While the return of these enzymes to normal levels often indicates recovery, although chronic infection may develop in a minority of cases. The interplay between the hepatitis B virus and the host immune system plays a crucial role in determining the outcome of infection. The virus employs various mechanisms to evade immune detection, and the strength of the host's immune response influences whether the infection resolves spontaneously or becomes chronic. 17. Regular monitoring of individuals with chronic hepatitis B involves periodic assessments of liver enzymes, hepatitis B viral DNA levels through PCR testing, and imaging studies to screen for liver cancer, which helps guide treatment decisions and detect complications such as cirrhosis or hepatocellular carcinoma at an early stage. Hepatitis B infection management has evolved with guidelines recommending risk stratification based on factors like age, family history of liver disease or cancer, and the presence of cirrhosis, which help tailor treatment approaches to individual patients for optimizing outcomes and preventing liver complications. Hepatitis B immunity can be conferred by past infection or vaccination, with the presence of anti-HBs antibodies indicating protective immunity, while individuals lacking these antibodies after successful vaccination may benefit from booster doses if they remain at high risk of exposure to the virus. Hepatitis B-related liver cancer is one of the leading causes of cancer-related deaths worldwide, and the development of hepatocellular carcinoma, HCC, is more common in patients with ongoing viral replication, co-infections with hepatitis C or D, or lifestyle factors like heavy alcohol consumption, emphasizing the need for routine HCC screening in high-risk populations. Hepatitis B DNA polymerase enzyme is a key target for antiviral drugs as it is essential for viral replication. Nucleose T-ide analogs inhibit this enzyme effectively, leading to suppression of viral replication and reduction of liver inflammation and fibrosis in treated individuals, although therapy may be lifelong in some cases. Chronic hepatitis B can progress through different phases, including immune tolerance, immune clearance, inactive carrier state, and reactivation, with each phase characterized by distinct viral replication levels and liver inflammation profiles, which inform monitoring and treatment strategies for managing the infection. Co-infection with hepatitis D virus, HDV, can occur in patients with hepatitis B, leading to more severe liver disease, as HDV requires hepatitis B surface antigen for replication. This combination requires specialized management as it poses a higher risk for rapid progression to cirrhosis and liver cancer. Pregnancy in women with chronic hepatitis B requires careful management, with antiviral therapy recommended in the third trimester for mothers with high viral loads to decrease the risk of mother-to-child transmission, alongside routine neonatal vaccination and administration of HBIG to at-risk newborns. Many individuals with occult hepatitis B infection have undetectable HB-Zag despite being carriers of the virus, posing a diagnostic challenge. These individuals often demonstrate the presence of HBV DNA in liver or serum samples and are at increased risk for the development of liver disease, particularly if co-infected with HCV or HIV. Hepatitis B can cause a wide range of extrahepatic manifestations such as polyarthritis nodosa, glomerulonephritis, and vasculitis, which result from immune complex deposition and hypersensitivity reactions, necessitating vigilant identification and multisystem management in affected individuals. The hepatitis B vaccine is an inactivated vaccine composed of non-infectious HB-Zag particles produced through recombinant DNA technology, and its administration induces an immune response that protects over 95% of vaccinated individuals for at least 20 years, although routine booster doses are not generally recommended for immunocompetent persons. Vaccination against hepatitis B has resulted in a dramatic decrease in the incidence of new infections, particularly among children and young adults due to robust immunization programs initiated globally, which has contributed significantly to the decrease in hepatitis B-related morbidity and mortality over the past few decades. Liver function tests. LFTs are crucial in the assessment of hepatitis B infection, as they provide information on the extent of liver damage, with elevated levels of ALT and AST indicating hepatocellular injury, while monitoring changes in these enzymes is critical in evaluating treatment efficacy and liver disease progression. 30. Antiviral therapy for hepatitis B has evolved significantly, with the introduction of potent nucleose (T)ide analogs that offer patients prolonged viral suppression, thereby reducing the risk of liver disease progression and complications. And while viral eradication remains challenging, functional cure defined by the loss of HBsAg is an achievable treatment endpoint for some patients. 31. In individuals with resolved hepatitis B infection, characterized by the presence of anti-HBC and anti-HBs antibodies without detectable HBsAg, reactivation of hepatitis B can occur under certain circumstances, such as immunosuppressive therapy, necessitating prophylactic antiviral treatment to prevent flare-ups of hepatitis. 32. The innate immune response plays a critical role in the initial defense against hepatitis B infection by recognizing viral components through pattern recognition receptors, including toll-like receptors, leading to the activation of interferon-stimulated genes which modulate the replication of the virus. 3. Lamivudine was one of the first antiviral drugs approved for hepatitis B, and although it was effective in reducing viral load and improving liver function initially, its long-term use is limited by the rapid emergence of drug-resistant HBV strains, emphasizing the need for newer agents with a higher genetic barrier to resistance. 34. Sequencing of the hepatitis B virus genome has led to the identification of several genotypes, labeled A to J, which have variable geographical distribution and slightly differing replication efficiency, clinical outcomes, and response to therapy, thereby influencing regional treatment guidelines and vaccination programs. 35. In cases of acute hepatitis B, the virus is often cleared spontaneously in immunocompetent adults, with less than 5% of these cases progressing to chronic infection, in contrast to neonates and young children who have a higher risk of developing chronic hepatitis B due to their immature immune system. 36. Hepatitis B is considered an occupational hazard for healthcare workers due to potential exposure to infectious blood and body fluids, and strict adherence to standard precautions, along with vaccination, is essential in preventing transmission among healthcare professionals. 37. The detection of hepatitis B DNA levels through quantitative PCR testing is a key component in monitoring chronic hepatitis B management, as it provides information on viral replication activity, helps assess treatment response, and guides adjustments in therapeutic strategies to achieve optimal virologic suppression. 38. In patients with compensated cirrhosis secondary to hepatitis B, antiviral therapy can improve liver function and reduce the risk of decompensation, although close monitoring is necessary given the potential for serious complications, including hepatic decompensation and liver cancer, even during successful treatment. 39. The hepatitis B precore and basal core promoter mutations affect viral replication and expression of the hepatitis B e antigen, commonly seen in patients with HBsAg-negative chronic hepatitis B. These mutations often result in more severe liver disease and require vigilant management to prevent adverse outcomes. 40. The introduction of direct-acting antivirals for hepatitis C treatment has led to many co-infected with hepatitis B experiencing viral reactivation upon HCV clearance, necessitating careful monitoring and consideration of prophylactic antiviral therapy against hepatitis B in these patients. 41. Hepatitis B can have profound psychosocial effects on affected individuals, as the stigma associated with chronic infection and potential transmission to others can lead to anxiety, depression, and social isolation, warranting comprehensive support and counseling to address these challenges alongside medical treatment. (42) Chronic hepatitis B infection can significantly impact pregnancy outcomes, including increased risks of gestational diabetes, preterm birth, and low birth weight, and therefore requires collaboration between hepatologists and obstetricians to optimize maternal and neonatal health through careful monitoring and interventions. (43) Hepatitis B-related acute liver failure, though rare, is a life-threatening condition that requires immediate medical attention and potentially liver transplantation, with rapid deterioration seen in patients who develop severe coagulopathy, encephalopathy, and multi-organ failure. (44) Monitoring hepatitis B surface antigen quantification can provide prognostic information in chronic hepatitis B management, as a decline in HBs Ag levels is often associated with favorable clinical outcomes, including spontaneous disease resolution or successful response to antiviral therapy. (45) Adolescents and adults with hepatitis B often require vaccinations against hepatitis A if they are not already immune, as co-infection with both viruses can lead to more severe liver disease. Thus, hepatitis A vaccination is routinely recommended to reduce the risk of concomitant liver insults. (46) Patients with chronic kidney disease often have a higher prevalence of hepatitis B infection due to increased exposure from dialysis procedures, necessitating routine screening, vaccination of susceptible individuals, and careful evaluation of antiviral treatment regimens to minimize nephrotoxicity. (47) The adoption of universal blood screening for hepatitis B in blood donation centers has greatly reduced the risk of transfusion-related transmission, as blood donors are routinely tested for HBs Ag, ensuring that blood supplies are safer and protecting recipients from acquiring the virus through transfusions. (48) Chronic hepatitis B infection potentially elevates the risk of metabolic syndrome and cardiovascular disease secondary to chronic inflammation and liver disease, requiring integrated management strategies that address metabolic risk factors alongside liver-specific treatments. (49) Individuals co-infected with hepatitis B virus and HIV may require specialized antiretroviral therapy regimens that effectively target both viruses, as some medications used in HIV management, such as tenofovir, are also active against HBV, necessitating coordination between hepatologists and infectious disease specialists. (50) Understanding the transmission dynamics of hepatitis B in communities with a high prevalence of infection is critical for effective public health strategies, as tailoring prevention efforts, such as vaccination campaigns and education on safe practices, can substantially impact the overall burden of disease. (1) Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, which primarily spreads through exposure to blood contaminated with the virus, often through sharing needles or medical equipment, making early detection crucial in preventing liver damage and complications. (2) The pathophysiology of hepatitis C involves the HCV triggering chronic inflammation in the liver, causing liver cells to die and be replaced with fibrous scar tissue, which can eventually lead to cirrhosis, impairing liver function and increasing the risk for liver cancer. (3) Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering cure rates above 90% with typically few side effects, although the choice of a specific DAA regimen depends on the viral genotype and presence of liver disease complications. (4) Hepatitis C can remain asymptomatic for years, making routine screening for people at risk vital because early diagnosis allows for timely initiation of antiviral therapy to prevent progression to severe liver disease. Five. There are 6 genotypes of hepatitis C virus, each affecting treatment choices and duration, with genotype 1 being the most common in the United States and often requiring a different therapeutic approach compared to other genotypes. Six. The diagnosis of hepatitis C involves initial screening with an HCV antibody test, followed by a confirmatory HCV RNA test if antibodies are detected, to determine whether there is an active infection needing treatment. 7. Chronic hepatitis C infection is a leading cause of liver transplants globally due to its potential to cause cirrhosis or liver cancer, emphasizing the importance of antiviral treatment in preventing these severe outcomes. 8. Despite there being no vaccine for hepatitis C, preventive measures such as avoiding needle sharing and ensuring safe blood transfusion practices are crucial to reduce the transmission of this virus. 9. The liver damage from hepatitis C can cause complications like portal hypertension, characterized by increased blood pressure in the portal vein, leading to varices or ascites, highlighting the importance of regular monitoring in chronic cases. 10. Advanced hepatitis C with cirrhosis is a known risk factor for hepatocellular carcinoma, making regular liver ultrasounds and alpha-fetoprotein tests essential in the surveillance for liver cancer in these patients. Some patients with hepatitis C might experience extrahepatic manifestations such as mixed cryoglobulinemia, a condition causing systemic vasculitis, often requiring additional treatments like immunosuppressive therapy. Certain lifestyle modifications, like avoiding alcohol which can exacerbate liver damage, are crucial in managing hepatitis C, as alcohol consumption accelerates the progression to cirrhosis. 13. A liver biopsy, though less commonly used now, can be helpful in assessing the extent of liver damage in hepatitis C, including the degree of inflammation and fibrosis, which can guide treatment decisions. 14. While hepatitis C attacks liver cells preferentially, it can also affect organs outside the liver, potentially leading to complications such as renal disease or lymphomas, underscoring the need for comprehensive care. 15. The sustained virologic response, SVR, is the goal of hepatitis C treatment, indicating that the virus remains undetectable in the blood 12 weeks after completing therapy, which is equated to a cure. 16. In the era of DAAs, treatment regimens for hepatitis C have become shorter, typically ranging from 8 to 12 weeks, marking a significant advancement over prior treatments that could last up to a year with inferior outcomes. Hepatitis C virus can undergo genetic mutations, aiding its evasion from the immune system and the development of resistance to antiviral treatments, which necessitates the use of combination drug therapies. 18. Blood donor screening and the introduction of direct-acting antivirals have significantly reduced new hepatitis C infections, yet public health efforts continue to bridge gaps in diagnosis and treatment accessibility. 19. Hepatitis C is more infectious than HIV but less than hepatitis B in terms of blood-borne pathogens, stressing the importance of public health interventions to remain vigilant in controlling its spread. 20. During acute hepatitis C infection, only a minority of people will exhibit symptoms such as jaundice, fatigue, or abdominal pain, which often resolve spontaneously but still require medical evaluation due to the risk of progression to a chronic state. 21. Reinfection with hepatitis C is possible even after successful treatment, particularly in individuals who continue engaging in behaviors that expose them to the virus, emphasizing the importance of preventive education. 22. During pregnancy, there is a low risk of mother-to-child transmission of hepatitis C, but women with chronic infection should be monitored and counseled accordingly to minimize risk and plan for management. 23. In patients co-infected with HIV and hepatitis C, treating both conditions is crucial as they can exacerbate each other's progression, with newer direct-acting antivirals greatly improving cure rates for HCV in such cases. 24. Certain rare genetic conditions might affect the progression and treatment outcomes in hepatitis C infection, with ongoing research aiming to better understand these genetic factors and their role in personalized medicine. 25. The introduction of second-generation direct-acting antivirals marked a milestone in the management of hepatitis C, as these drugs target multiple stages of the viral life cycle, offering improved efficacy and tolerability compared to older treatments. 26. The hepatitis C virus can survive outside the body for several weeks, which highlights the importance of environmental cleaning and sterilization procedures, particularly in settings like healthcare facilities. 27. Besides liver damage, patients with chronic hepatitis C may develop insulin resistance and type 2 diabetes, necessitating diligent monitoring and management of these metabolic disorders as part of comprehensive care. 28. The global burden of hepatitis C is substantial, with millions affected across diverse geographies, necessitating international collaboration and tailored strategies to effectively manage and eliminate the disease. 29. Recent advancements in blood testing technology allow for early detection of hepatitis C, including the use of rapid diagnostic tests, which enhance screening efforts particularly in resource-limited settings. 30. Injection drug use remains the most significant risk factor for hepatitis C transmission in high-income countries, driving initiatives aimed at harm reduction, such as needle exchange programs to mitigate disease spread. 31. Chronic hepatitis C infection can affect mental health, contributing to cognitive impairment or depression, which calls for an integrative treatment approach that includes psychosocial support services. 32. Healthcare workers are at occupational risk for hepatitis C due to potential needle stick injuries, making adherence to standard precautions and the use of safety-engineered devices vital to prevent transmission. 3. Antiviral resistance in hepatitis C treatment is rare but can occur in poorly adherent patients or those with prior treatment experience, making rigorous follow-up and education on adherence crucial for achieving optimal outcomes. 34. Given that hepatitis C can lead to hepatic encephalopathy, a condition characterized by confusion and altered consciousness due to liver dysfunction, monitoring and preventive strategies, including supplemental treatment to manage ammonia levels, are critical. 35. Exposure to hepatitis C does not confer protective immunity as seen in some other viral infections, thus individuals remain susceptible to future reinfections and should continue adopting preventive measures post-treatment. 36. Hepatitis C virus belongs to the Flaviviridae family, possessing a single-stranded RNA genome, with its genotype and viral load influencing clinical manifestation, natural progression, and response to treatment. 37. In patients with hepatitis C cirrhosis, careful management and regular monitoring of liver function are essential, as portal hypertension can lead to life-threatening variceal hemorrhage if not controlled properly. Direct-acting antivirals targeting protease, nucleotide polymerase, and NS5A proteins are the cornerstone of modern hepatitis C treatment regimens, disrupting viral replication at different stages to achieve sustained virologic response. Co-infection with hepatitis B and hepatitis C complicates clinical management as both viruses have the potential to cause liver damage, necessitating individualized treatment strategies and careful monitoring for reactivation. Hepatitis C testing is recommended for all individuals born between 1945 and 1965 in the United States, as this cohort, often termed baby boomers, demonstrates a significantly higher prevalence of the infection. Although previously thought incurable, advancements in hepatitis C research have highlighted the critical role of the host immune system, leading to innovative therapies exploiting both direct-acting antivirals and immunomodulatory effects. Individuals with advanced liver fibrosis from chronic hepatitis C are at an increased risk for cardiovascular diseases such as myocardial infarction, pointing to the need for comprehensive health monitoring beyond just liver function. Adequate nutritional support is paramount in managing hepatitis C, with an emphasis on maintaining healthy body weight, optimizing liver function, and potentially reducing inflammation through a well-balanced diet. In pediatric hepatitis C infections, though rare, early diagnosis and treatment are key to preventing disease progression and ensuring long-term liver health, as children generally respond well to direct-acting antiviral regimens. Researchers continue to explore potential therapeutic vaccines for hepatitis C, focusing on stimulating the body's immune response to prevent infection or aiding in viral clearance in those already infected. Hepatitis C treatment adherence remains crucial in achieving viral eradication, as missing doses or incomplete therapy can lead to suboptimal outcomes and increased risk of developing drug-resistant virus strains. While telemedicine has expanded access to hepatitis C care, contributing to improved treatment uptake in remote or underserved areas, ongoing challenges include ensuring adequate patient follow-up and managing compliance. The social stigma associated with hepatitis C can be a barrier to diagnosis and treatment. Therefore, public health initiatives must address misconceptions and educate communities to foster an environment conducive to seeking care. Recent efforts in mapping the hepatitis C genome have provided insights into viral diversity and mechanisms of persistence, paving the way for more effective and targeted therapies that could potentially lead to the virus's eradication. Understanding the role of liver stiffness measurement via transient elastography offers a non-invasive method to assess liver fibrosis in hepatitis C patients, aiding in diagnosis and monitoring disease progression without the need for liver biopsy. Parkinson's disease, a neurodegenerative disorder, primarily results from the death of dopamine-producing neurons in the substantia nigra, a region of the midbrain crucial for controlling smooth movements, leading to the hallmark symptoms of tremors, rigidity, bradykinesia, and postural instability. Traditional diagnosis of Parkinson's disease relies heavily on clinical evaluation, where neurologists observe motor symptoms and response to dopaminergic therapy, but innovative approaches now include the use of DaTscan imaging to visualize dopamine transporter levels and differentiate Parkinson's from other movement disorders. 3. The pathophysiology of Parkinson's disease includes the misfolding and aggregation of alpha-synuclein proteins, forming Lewy bodies in neurons, which disrupt cellular processes and contribute to neuronal degeneration and the progressive nature of the disease. Four. Levodopa, a precursor to dopamine, remains the gold standard for symptomatic treatment of Parkinson's disease, its effectiveness rooted in its ability to replenish depleted dopamine levels in the brain, though long-term use may lead to motor complications such as dyskinesias. 5. Parkinson's disease non-motor symptoms, such as depression, anxiety, sleep disturbances, and cognitive decline, often precede motor symptoms and are increasingly recognized as key aspects of disease management due to their significant impact on quality of life. Six. Deep brain stimulation, DBS, an innovative surgical treatment for Parkinson's disease, involves the implantation of electrodes in the brain, typically targeting the subthalamic nucleus or globus pallidus internus, which modulates abnormal electrical impulses and alleviates motor symptoms. 7. Genetic factors play a critical role in Parkinson's disease, with mutations in genes such as LRRK2, PARK7, and GBA identified as contributors to familial cases, while emerging research explores gene therapy as a means to target these genetic components directly to slow disease progression. 8. The Braak staging model theorizes that Parkinson's disease pathology begins in the gut and olfactory system, moving upward to affect brain regions responsible for motor control, suggesting a potential biomarker in the early gastrointestinal symptoms for early diagnosis. 9. Exercise has been shown to have neuroprotective effects in Parkinson's disease by promoting neuroplasticity and improving motor function, with studies indicating that regular physical activity may slow the progression of the disease and enhance quality of life for patients. 10. The role of oxidative stress and mitochondrial dysfunction in Parkinson's disease pathogenesis is highlighted by evidence showing that impaired mitochondrial respiratory chain activity leads to increased production of reactive oxygen species, contributing to neuronal damage and disease progression. 11. Epidemiological studies have identified several environmental risk factors for Parkinson's disease, including exposure to pesticides, heavy metals, and industrial solvents, all of which are thought to inhibit mitochondrial function and contribute to neuronal cell death. 12. Impulsive and compulsive behaviors, known as impulse control disorders, are potential side effects of Parkinson's disease medications, particularly dopaminergic therapy, emphasizing the need for careful monitoring and potential behavioral interventions in susceptible individuals. 13. Neuroinflammation, characterized by activated microglia and increased levels of pro-inflammatory cytokines, is posited as a contributing factor in Parkinson's disease pathophysiology, offering a target for future therapeutic strategies aiming to dampen inflammatory responses in the brain. 14. Alpha-synuclein, a protein central to Parkinson's disease pathology, is not only involved in Lewy body formation but also in the disruption of synaptic vesicle trafficking and neurotransmitter release, which contributes to the complex network dysfunction observed in affected individuals. 15. The progression of Parkinson's disease is highly variable among individuals, with some experiencing rapid motor decline while others show a more gradual progression, underscoring the importance of personalized medicine approaches to tailor treatment plans and improve outcomes. 16. Retinal changes in Parkinson's disease, detectable through non-invasive optical coherence tomography, provide insights into neurodegenerative processes and have been proposed as potential biomarkers for early disease detection and monitoring of therapeutic effects. 17. Autophagy, the cellular process of degrading and recycling damaged components, is impaired in Parkinson's disease, leading to the accumulation of toxic proteins in damaged organelles, and therapeutic strategies aimed at enhancing autophagy are being explored as a means to halt disease progression. 18. Voice and speech disturbances, such as hypophonia and dysarthria, are common in Parkinson's disease due to the impact on motor coordination and respiratory control, and targeted speech therapy can significantly improve communication abilities and patient quality of life. 19. The gut-brain axis in Parkinson's disease is an emerging field of study, with research indicating that intestinal microbiota dysbiosis may influence neuroinflammation and alpha-synuclein propagation, offering potential therapeutic avenues that target gut health. 20. Neuroprotective strategies in Parkinson's disease focus on slowing disease progression through interventions that enhance neuronal survival, such as the use of antioxidants, anti-inflammatory compounds, and agents that stabilize mitochondrial function and cellular energy production. 21. LRRK2 inhibitors are a promising class of drugs under investigation in Parkinson's disease, aiming to mitigate the hyperactivity of the LRRK2 protein, which is implicated in both familial and sporadic cases, thereby reducing neuronal damage and potentially slowing the disease course. 22. Cognitive decline in Parkinson's disease, known as Parkinson's disease dementia, PDD, is associated with cortical and subcortical changes, with cholinesterase inhibitors like rivastigmine being utilized to manage cognitive symptoms and improve daily functioning in affected individuals. 23. The non-invasive technique of transcranial direct current stimulation, TDCS, is being explored as a therapeutic option in Parkinson's disease, with studies suggesting it can modulate cortical excitability and enhance motor learning, offering a complementary approach to traditional therapies. 24. Olfactory dysfunction is one of the earliest non-motor symptoms of Parkinson's disease, occurring in up to 90% of patients, and the loss of smell may precede the onset of motor symptoms by several years, providing a potential early marker for disease diagnosis. 25. Monoamine oxidase B, MAO-B, inhibitors, such as selegiline and rasagiline, improve Parkinson's disease motor symptoms by blocking the breakdown of dopamine in the brain, thereby prolonging its action and enhancing the efficacy of other dopaminergic treatments. 26. Dysphagia, or difficulty swallowing, affects approximately 50% of Parkinson's disease patients, posing significant risks of aspiration and malnutrition, and comprehensive management including dietary modifications and swallowing therapy is crucial for patient safety and quality of life. 27. REM sleep behavior disorder, RBD, is a sleep disorder commonly associated with Parkinson's disease, characterized by vivid dreams and lack of muscle atonia during REM sleep, and may serve as a prodromal marker indicating increased risk for developing Parkinson's or related neurodegenerative diseases. 28. Neurotrophic factors such as glial cell line-derived neurotrophic factor, GDNF, are being investigated for their ability to support neuron survival and axon growth in Parkinson's disease, with clinical trials exploring their potential as disease-modifying therapies. 29. The concept of freezing of gait in Parkinson's disease, where patients experience sudden episodes of immobility, is thought to arise from impaired neural circuits involved in locomotion, and rehabilitative strategies such as rhythmic auditory cues are employed to overcome these episodes. 30. Functional MRI, fMRI, studies in Parkinson's disease reveal altered connectivity patterns in brain networks responsible for motor and cognitive function, offering insights into disease progression and potential targets for non-pharmacological interventions such as cognitive training. 31. Histone deacetylase (HDAC) inhibitors are being explored as potential therapeutic agents in Parkinson's disease, aiming to modulate gene expression and protect neurons from degeneration by promoting a neuroprotective histone acetylation state. (32) The link between sleep disturbances and Parkinson's disease progression is being scrutinized, with poor sleep quality exacerbating both motor and non-motor symptoms, and interventions targeting sleep hygiene and disorders are shown to improve overall patient outcomes. (3) Balance dysfunction and fall risk in Parkinson's disease are linked to alterations in proprioceptive feedback and postural control, prompting the development of balance training programs that incorporate elements such as Tai Chi and dance to improve stability and reduce falls. (34) The fascinating phenomenon of neuroplasticity in Parkinson's disease, where the brain adapts to changes brought about by neurodegeneration, is being harnessed through interventions like cognitive behavioral therapy and task-specific rehabilitation to enhance functional outcomes. (35) Advances in wearable technology provide real-time monitoring of Parkinson's disease symptoms, enabling clinicians to obtain objective data on movement patterns, medication effectiveness, and disease progression, thus paving the way for personalized management strategies. (36) Anosmia, or loss of smell, in Parkinson's disease is thought to result from early deposition of alpha-synuclein in the olfactory bulb, providing a unique diagnostic clue that combines clinical observation with pathophysiological insight into the disease's early manifestations. (37) Neurovascular dysfunction in Parkinson's disease, characterized by alterations in the blood-brain barrier and cerebral blood flow, is proposed as a contributing factor in disease pathogenesis, prompting research into therapeutic strategies that target vascular health. (38) Apomorphine, a potent dopamine agonist, is used in Parkinson's disease to manage sudden, off episodes where motor symptoms re-emerge due to fluctuating medication levels, administered either subcutaneously or via continuous infusion for rapid symptom relief. (39) The role of iron accumulation and its interaction with alpha-synuclein in Parkinson's disease is garnering attention, as excess iron in the substantia nigra is thought to exacerbate oxidative stress and promote neurodegeneration, highlighting the potential for iron-targeted therapies. (40) Gastrointestinal dysfunction in Parkinson's disease, such as constipation and gastroparesis, is prevalent due to autonomic nervous system involvement, necessitating comprehensive management including dietary adjustments, prokinetic agents, and fiber supplements to alleviate symptoms. (41) The concept of neuroinflammation in Parkinson's disease extends beyond microglial activation, encompassing the detrimental role of peripheral immune system alterations, which may contribute to the progression of neurodegeneration and provide new avenues for therapeutic intervention. (42) The phenomenon of neurogenesis, or the generation of new neurons, remains impaired in Parkinson's disease, particularly in regions such as the hippocampus, prompting exploration of pharmacological and lifestyle interventions designed to stimulate this process and support brain regeneration. (43) Disruption in calcium homeostasis is implicated in Parkinson's disease pathophysiology, as abnormalities in calcium signaling and mitochondrial calcium overload are associated with neuronal death, and calcium channel blockers are being investigated for their neuroprotective potential. (44) Sexual dysfunction in Parkinson's disease, affecting both men and women, can result from a combination of neurochemical imbalances, medication side effects, and psychological factors, warranting a multidisciplinary approach that encompasses medical, psychological, and relationship counseling. (45) The use of cannabis derivatives, such as CBD oil, is under study for Parkinson's disease symptom management, with anecdotal evidence suggesting potential benefits for alleviating motor symptoms and anxiety, though rigorous clinical trials are needed to validate efficacy and safety. '46. The phenomenon of anosognosia, where patients with Parkinson's disease exhibit a lack of awareness of their motor impairments, may stem from altered neural connectivity in self-monitoring networks, complicating disease management and underscoring the need for caregiver support. '47. The gut microbiota's role in Parkinson's disease is a burgeoning area of research, with associations between specific bacterial strains and symptom severity suggesting that modulating gut flora through diet or probiotics may influence disease trajectory and improve patient outcomes. '48. Agonists targeting the adenosine A2A receptor are being developed for Parkinson's disease to exert neuroprotective effects, showing promise in reducing neuroinflammation and improving motor symptoms, potentially complementing existing dopaminergic therapies. '49. The emergence of wearable exoskeletons provides an innovative approach to assisting individuals with Parkinson's disease in maintaining mobility and independence, offering mechanical support and enhancing motor function through collaborative movement control. '50. Advances in precision medicine for Parkinson's disease focus on unraveling the individual genetic, environmental, and lifestyle factors contributing to disease variability, enabling the development of tailored treatment regimens that optimize therapeutic outcomes and mitigate side effects. '1. Dyslipidemia, a condition characterized by abnormal levels of lipids in the blood, is often a silent disorder that significantly increases the risk of cardiovascular diseases, including coronary artery disease and stroke, due to the accumulation of plaques in arteries, which can lead to atherosclerosis, permeated by elevated low-density lipoprotein, LDL, decreased high-density lipoprotein, HDL, and elevated triglycerides. '2. The diagnosis of dyslipidemia primarily involves a fasting lipid profile measurement which quantifies the levels of total cholesterol, LDL, HDL, and triglycerides in the blood, providing a comprehensive lipid assessment that aids clinicians in determining the risk of atherosclerotic cardiovascular disease in patients. '3. Statins, inhibitors of the enzyme HMG-CoA reductase, form the cornerstone treatment for dyslipidemia due to their potent LDL-lowering effects, which not only help to decrease the incidence of cardiovascular events but also have additional pleiotropic benefits such as improving endothelial function and reducing vascular inflammation. '4. Familial hypercholesterolemia, an inherited form of dyslipidemia typically caused by mutations in the LDL receptor gene, leads to dramatically elevated levels of cholesterol from birth and is characterized by early development of cardiovascular disease. Hence, early diagnosis and aggressive treatment with lipid-lowering therapies are crucial to improve long-term outcomes. 5. Lifestyle interventions, including dietary modifications such as reducing intake of saturated fats and trans fats, increasing soluble fiber, engaging in regular physical activity, and maintaining a healthy weight, play a fundamental role in managing dyslipidemia and serve as first-line strategies alongside pharmacotherapy. '6. Secondary causes of dyslipidemia, such as hypothyroidism, nephrotic syndrome, chronic kidney disease, type 2 diabetes mellitus, and the use of specific medications like corticosteroids, beta blockers, and antipsychotics, should be excluded during the clinical evaluation of patients, as these conditions or medications may exacerbate lipid abnormalities. 7. Niacin, also known as vitamin B3, can be used therapeutically to increase HDL cholesterol and lower triglycerides and LDL cholesterol levels. However, its use is often limited by side effects such as flushing, pruritus, and potential hepatotoxicity, which necessitates careful monitoring of liver function tests during treatment. 8. The role of omega-3 fatty acids, primarily found in fish oil, in the management of dyslipidemia centers on their ability to lower triglyceride levels, making them a useful adjunct therapy in hypertriglyceridemia, although their effect on LDL and HDL cholesterol is variable and requires further research for confirmation. 9. PCSK9 inhibitors, such as evolocumab and alirocumab, represent a novel class of lipid-lowering agents that work by inhibiting the degradation of LDL receptors, thus increasing hepatic uptake of LDL cholesterol from the blood, and are particularly beneficial for patients who are statin intolerant or have familial hypercholesterolemia requiring additional LDL reduction. 10. Insulin resistance, a key component of metabolic syndrome, contributes significantly to the development of dyslipidemia by altering lipid metabolism, leading to elevated triglycerides, reduced HDL cholesterol, and small dense LDL particles, which collectively promote atherogenesis, underscoring the importance of addressing insulin sensitivity in management strategies. 11. The use of fibric acid derivatives, or fibrates, such as fenofibrate and gemfibrozil, is primarily indicated for the treatment of severe hypertriglyceridemia due to their effectiveness in lowering triglyceride levels and modestly increasing HDL cholesterol, but care must be taken when co-administering them with statins due to the risk of myopathy and severe muscle damage. 12. Dyslipidemia in women, particularly post-menopause, may be affected by changes in hormonal levels, resulting in increased LDL cholesterol and decreased HDL cholesterol, thus necessitating sex-specific considerations in both the assessment and management of lipid disorders to prevent cardiovascular events. 13. Dyslipidemia can lead to non-alcoholic fatty liver disease, NAFLD, which is characterized by fat accumulation in the liver that can progress to non-alcoholic steatohepatitis, NASH, cirrhosis, and potentially liver failure, signifying a compelling reason for clinicians to address dyslipidemia aggressively in patients with or at risk for NAFLD. 14. In patients on statin therapy, routine monitoring of lipid levels and potential side effects is essential, as initial lifestyle and pharmacological interventions may need adjustments based on LDL cholesterol targets, which are personalized according to the patient's baseline cardiovascular risk factors and history of cardiovascular disease. 15. The dyslipidemia-related concept of atherogenic dyslipidemia encompasses a combination of high triglycerides, low HDL cholesterol, and an increased number of small dense LDL particles, which together heighten atherogenic potential and often require a multifaceted therapeutic approach, including advanced lipid profiling for accurate assessment. 16. Apolipoprotein B, ApoB, is an important determinant of atherogenic particle number, offering a more precise understanding of cardiovascular risk in dyslipidemia patients beyond traditional lipid panel measurements, thus becoming a valuable adjunct in lipid management for assessing risk and tailoring treatment strategies. 17. Elevated lipoprotein A, or LP, a genetically determined risk factor for cardiovascular disease, may contribute to residual cardiovascular risk in patients, even with optimized LDL cholesterol levels, justifying the need to consider it during risk evaluations and meditative insights into novel therapies aimed specifically at its reduction. 18. Inherited dyslipidemias, such as polygenic hypercholesterolemia, result from multiple genetic variations affecting lipid metabolism, which cumulatively elevate LDL cholesterol levels, underscoring the complexity of genetic contributions to dyslipidemia and highlighting the potential benefits of genetic screening in families with histories of premature cardiovascular diseases. 19. The relationship between dyslipidemia and inflammation is increasingly recognized, with chronic low-grade inflammatory processes thought to perpetuate lipid abnormalities and enhance the risk of atherosclerotic plaque formation. positing biomarkers like high-sensitivity C-reactive protein as potential targets for comprehensive cardiovascular risk assessments. The JUPITER trial demonstrated that the use of statins in patients with normal LDL cholesterol but elevated inflammatory markers such as high-sensitivity C-reactive protein significantly reduced cardiovascular events, suggesting a broader application of statin therapy beyond traditional criteria, particularly in dyslipidemia characterized by inflammatory states. The management of dyslipidemia in patients with HIV requires special consideration due to the lipid-altering effects of antiretroviral therapy and the inherent risk of cardiovascular disease within this population, necessitating tailored therapeutic approaches to balance viral suppression with optimal lipid and cardiovascular health. Dyslipidemia during pregnancy is not uncommon due to physiological changes in lipid levels but requires careful management, particularly when pre-existing lipid disorders are present, to avert complications like preeclampsia, necessitating risk-benefit analysis before pharmacological interventions, favoring lifestyle modifications for safety. The Diabetes Prevention Program highlights the role of comprehensive lifestyle modifications in preventing the progression of dyslipidemia, illustrating that interventions such as weight loss, dietary changes, and physical activity can significantly reduce fasting glucose and improve lipid profiles, thus reducing subsequent diabetes and cardiovascular disease risk. The prevalence of dyslipidemia is significantly higher in patients with chronic kidney disease due to alterations in lipid metabolism related to reduced kidney function, necessitating nuanced management strategies that address both cardiovascular protection and renal considerations, often necessitating cross-specialty collaboration. Plant stanols and sterols, natural substances found in small amounts in many fruits, vegetables, nuts, seeds, cereals, and legumes, can help lower LDL cholesterol levels by reducing cholesterol absorption in the intestine and are often incorporated in dietary strategies for managing mild dyslipidemia or supplementing pharmacotherapy. Ezetimibe, which functions by inhibiting the absorption of cholesterol in the small intestine, can effectively lower LDL cholesterol levels, especially when used in combination with statins, providing an option for patients who require additional LDL reduction but might be unable to tolerate higher statin doses. Secondary prevention trials such as PROVE-IT 22 have reinforced the concept of achieving more aggressive LDL cholesterol targets in patients with established cardiovascular disease, suggesting that the lower, the better paradigm applies to minimize recurrent cardiovascular events in high-risk dyslipidemic patients. Mediterranean-style diets, rich in monounsaturated fats from olive oil, nuts, and fish, have shown promising results in improving lipid profiles and reducing cardiovascular disease risk in patients with dyslipidemia, thus providing a culturally adaptable dietary pattern with a strong evidence base for health promotion. Director of the 7-country study, Incel Keys highlighted the association between dietary fat and cardiovascular disease, laying the groundwork for dietary guidelines that emphasize reduction of saturated fat intake to ameliorate dyslipidemia and decrease the incidence of atherosclerosis-related conditions. Adolescents with obesity are increasingly being identified with dyslipidemia, which necessitates strategies focused on comprehensive lifestyle interventions alongside consideration of pharmacotherapy in select cases, to address both current cardiovascular risk and potential future health implications. Emerging evidence about the lipid triad, high LDL cholesterol, high triglycerides, and low HDL cholesterol, underscores the need for multifactorial approaches in dyslipidemia management to address underlying metabolic abnormalities that may potentiate cardiovascular risk through synergistic pathophysiological mechanisms. 32. Statin-associated muscle symptoms, a common reason for statin discontinuation, require careful clinical evaluation to ensure compliance and persistent lipid-lowering benefits, while considering alternative dosing strategies, adjunctive non-statin therapies, or newer agents like PCSK9 inhibitors as potential substitutions. 3. The association of dyslipidemia with sleep apnea is becoming recognized, with disrupted sleep contributing to systemic inflammation and altered lipid metabolism. Hence, diagnosing and treating sleep apnea might mitigate dyslipidemic profiles and reduce cardiovascular risk in susceptible individuals. 34. Genetic testing in dyslipidemia can identify specific mutations causal of lipid abnormalities, offering pathway-based treatment approaches and enabling personalized risk assessment for offspring in families with hereditary dyslipidemias, with potential implications for proactive interventions in at-risk populations. 35. Patients with type 1 diabetes are not exempt from dyslipidemia, with the risk influenced largely by glycemic control and presence of diabetes-related complications, meriting comprehensive lipid management to thwart accelerated atherosclerosis even in the absence of traditional obesity-linked lipid aberrations. 36. The role of bile acid sequestrants such as cholestyramine, once a mainstay in cholesterol-lowering therapies, still persists today for lipid management, particularly in patients who require non-systemic intervention options or with contraindications to first-line lipid-lowering medications like statins. 37. Gender differences in response to dyslipidemia treatments may exist, with women potentially benefiting more from statin therapy than men in terms of cardiovascular risk reduction, highlighting the need for gender-specific research and personalized treatments to optimally address dyslipidemia-related risks. 38. Dyslipidemia is often part of a cluster of conditions in metabolic syndrome, including hypertension and insulin resistance, which together greatly intensify cardiovascular risk, mandating simultaneous, comprehensive management strategies to effectively modify the cardiovascular landscape in affected individuals. 39. Dyslipidemia in children and adolescents can herald future cardiovascular risks and is often exacerbated by obesity, contributing to early atherosclerotic changes and necessitating early lifestyle interventions and possible pharmacologic treatments to combat long-term cardiovascular health detriments. 40. Recent studies suggest a potential benefit of coenzyme Q10 supplementation in alleviating statin-associated myopathy, positing a role in improving muscle insulation and utilization of energy reserves, although more robust trials are needed to delineate its efficacy and safety in dyslipidemic management. 41. High-sensitivity C-reactive protein, HSCRP, although not a traditional marker of dyslipidemia, serves as an adjunctive biomarker for cardiovascular risk stratification in patients with lipid aberrations, potentially guiding therapeutic intensification where subclinical inflammation coexists. 42. In chronic inflammatory states such as rheumatoid arthritis, dyslipidemia presents unique challenges, as systemic inflammation can alter lipid metabolism, reciprocally increasing cardiovascular risk, therefore necessitating judicious therapeutic approaches that address both lipid abnormalities and underlying inflammation. 43. The lipid study solidified the benefit of statin therapy in secondary prevention by demonstrating substantial reduction in cardiovascular events among those with established coronary heart disease, irrespective of baseline cholesterol levels, affirming statin therapy's critical role in dyslipidemic cardiovascular risk mitigation. 44. The existence of mixed dyslipidemia, characterized by concomitant elevations in LDL and triglycerides and low HDL, demands a detailed lipid management plan that incorporates lifestyle changes, pharmacotherapy, and regular monitoring to thwart its complex contributory role in atherogenesis. 45. Ethnic differences influence dyslipidemia profiles and subsequent cardiovascular risk, necessitating that clinicians consider such disparities when developing and deploying preventive and therapeutic strategies to ensure efficacy that is tailored to diverse population settings. '46. Dyslipidemia management in the elderly is often nuanced by polypharmacy and altered drug metabolism, necessitating a judicious approach to lipid-lowering therapies to balance the benefits of cardiovascular risk reduction with potential adverse effects and drug interactions. '47. The British Heart Foundation emphasizes the importance of a tailored dietary approach, fine-tuning nutritional intake, paying close attention to macronutrient distribution and caloric composition, as first-line therapy in the management of dyslipidemia, emphasizing the utility of food-based interventions in healthcare. '48. Patients hospitalized for acute coronary syndromes can benefit from early initiation of statin therapy, which has been evidenced to rapidly stabilize vulnerable plaques, reduce inflammatory markers, and improve overall survival in the context of aggressive dyslipidemia management. '49. Alcohol consumption has a complex relationship with dyslipidemia, with moderate intake potentially increasing HDL cholesterol, yet excessive consumption poses cardiovascular risks through triglyceride elevation and hepatotoxicity, necessitating context-specific guidance on alcohol intake for lipid management. '50. Although dyslipidemia screening recommendations may vary, they generally advocate for routine lipid profiling beginning in adulthood, or earlier in those with family histories of premature cardiovascular disease, to facilitate timely identification and initiation of appropriate interventions to forestall progression of lipid-related cardiovascular damage. '1. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. '2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. '3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. '4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. '5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. '6. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. '7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. '8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification and patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. '22. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. '23. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. '24. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. '25. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. '26. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. '27. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. '28. Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. '29. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. '30. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. '31. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. '32. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. '33. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. '34. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. 35. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. (36) Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. (37) The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. (38) Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. (39) Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. (40) Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. (41) Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. (42) Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. (43) The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. (44) Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. (45) Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. (46) The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. (47) Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. (48) In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. 49. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. 50. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. One. Prostate cancer, most frequently diagnosed in men over 65, often begins its insidious course when normal prostate cells mutate their DNA, leading to uncontrolled growth influenced by male hormones like testosterone, creating a local lesion that can sometimes remain asymptomatic for years until peripheral nerves are affected, causing characteristic lower back pain or radical changes in urinary patterns. 2. The prostate-specific antigen (PSA) test, although controversial due to its potential for false positives, remains a crucial tool in the early detection of prostate cancer, with elevated levels suggesting the need for further investigative procedures such as a digital rectal exam, DRE, or magnetic resonance imaging (MRI) to visualize suspect areas within the gland. 3. One innovative area in prostate cancer treatment is the use of high-intensity focused ultrasound, HIFU, which precisely targets cancerous tissues via sound waves, thereby minimizing damage to surrounding healthy tissues, an advantage that is especially palpable in situations where traditional radiation therapy would pose a higher risk to neighboring structures. 4. In understanding the pathophysiology of prostate cancer, it's crucial to recognize the role of genetic alterations, such as PTEN loss or TMPRSS2-ERG fusion, which can drive aggressive phenotypes and underlie castration-resistant pathways, often necessitating the subsequent use of androgen receptor pathway inhibitors like enzalutamide. 5. The concept of active surveillance in prostate cancer acknowledges that many tumors grow so slowly that immediate treatment might be unnecessary. Thus, the patient undergoes regular monitoring for any indication of progression, often reserved for those with low-risk profiles to avoid the morbidities associated with premature intervention. 6. Multiparametric MRI has revolutionized the diagnostic landscape of prostate cancer, providing detailed images that not only help in defining the tumor's size and extent, but also direct targeted biopsies, offering greater accuracy over traditional random biopsy approaches, especially in distinguishing significant cancers from indolent ones. 7. The genetic landscape of prostate cancer is varied, with tumors often exhibiting a stable genome compared to other malignancies, yet exhibiting mutations in BRCA1 and BRCA2 genes that confer heightened aggressiveness and poorer outcomes, necessitating careful consideration of family history in the clinical context. 8. Prostate cancer pathophysiology can involve transitions from androgen-dependent to androgen-independent states, a conundrum that complicates treatment, enhancing the importance of novel therapies like PARP inhibitors, which exploit DNA repair vulnerabilities specific to cancer cells, thereby increasing the sensitivity of the tumors to subsequent therapies. 9. Proton beam therapy offers a cutting-edge approach for treating prostate cancer, using proton particles that deposit most of their energy directly in the tumor, sparing surrounding tissues with remarkable precision and reducing common side effects like urinary or bowel dysfunction compared to more conventional photon-based radiotherapy. 10. Understanding prostate cancer metastasis requires an appreciation for the molecular changes that allow tumor cells to detach and traverse bodily systems, particularly the lymphatic pathways leading to nearby lymph nodes and bones, where they establish secondary growths, often necessitating systemic treatment modalities beyond localized therapy. 11. The Gleason scoring system remains a cornerstone in predicting prostate cancer behavior, assigning a score based on glandular patterns observed under a microscope, where higher scores indicate a greater degree of aberration, aiding in tailoring management strategies to individual patient risk levels. 12. Androgen deprivation therapy, ADT, has long been a mainstay in the management of advanced prostate cancer, aiming to reduce circulating testosterone through either surgical orchiectomy or pharmaceutical agents such as GnRH agonists, which ultimately starve the cancer of its growth-promoting hormones. 13. Immunotherapy, such as the use of sipuleucel T, represents a novel frontier in prostate cancer treatment, whereby a patient's immune cells are engineered to recognize and combat prostate cancer cells, offering a personalized approach that can extend survival in select patients with advanced disease. 14. There is growing evidence that the microbiome, particularly within the gut, may play an influential role in prostate cancer development and progression, with certain microbial compositions potentially modulating systemic inflammation and hormonal balances that encourage or suppress oncogenic pathways. 15. Radioligand therapy, targeting prostate-specific membrane antigen, PSMA, provides a promising avenue for metastatic prostate cancer, leveraging radioactive isotopes bound to molecules that selectively attach to cancer cells, delivering lethal doses of radiation while sparing healthy tissue to a greater extent than traditional methods. 16. Transperineal prostate biopsy, performed under ultrasound guidance, minimizes infection risk compared to transrectal approaches, and provides more comprehensive sampling of the prostate, enhancing diagnostic precision especially in previously biopsied individuals with persistently elevated PSA levels. 17. Obesity has been implicated in the pathogenesis of more aggressive prostate cancer forms, potentially due to increased levels of inflammatory cytokines and insulin-like growth factors, which may promote tumor growth, highlighting the importance of lifestyle interventions as adjuncts in the prevention and management of prostate cancer. 18. The influence of dietary patterns on prostate cancer risk and progression has gained attention, with studies suggesting that diets rich in tomatoes, due to their lycopene content, and polyphenol-rich foods like green tea, may confer protective effects through their antioxidant and anti-inflammatory properties. 19. Focal therapy, including cryoablation and laser thermal therapy, targets prostate cancer lesions with precision, potentially offering a middle ground between active surveillance and radical treatments, aiming to eradicate cancerous tissues while preserving prostate function and patient quality of life. 20. Circulating tumor cells, CTCs, and DNA, ctDNA, are emerging biomarkers in the blood that may offer real-time insights into prostate cancer dynamics, potentially guiding treatment decisions and prognostication by reflecting tumor burden and molecular changes in response to therapy. 21. Radiotherapy advancements now permit hypofractionated regimens for prostate cancer, where higher doses per session shorten treatment duration, maintaining efficacy while offering greater convenience and reducing time spent by patients undergoing therapy, demonstrating comparable side effect profiles to conventional schedules. 22. The phenomenon of neuroendocrine differentiation in prostate cancer, often occurring in the setting of advanced, treatment-resistant disease, represents a shift in tumor phenotype, where cells acquire neuroendocrine-like features that are less reliant on androgen receptors, complicating therapeutic approaches, and often indicating a poorer prognosis. 23. Dietary supplementation with vitamin D has been investigated for its potential role in reducing prostate cancer risk and progression, given that this nutrient is thought to influence cellular differentiation and proliferation, yet evidence remains mixed, warranting further study to elucidate its impact fully. 24. Magnetic resonance imaging ultrasound (MRI-US) fusion biopsy technology allows for the precise targeting of suspicious areas within the prostate identified on MRI, providing increased accuracy over traditional biopsy techniques, potentially reducing the number of necessary samples and improving cancer detection rates. 25. The advent of genomic profiling in prostate cancer has facilitated the identification of actionable mutations, enabling targeted therapies such as those aimed at the PI3K, AKT, mTOR pathway, which are currently being explored in clinical trials to determine their efficacy in improving outcomes in certain genetic subpopulations. '26. Early-stage prostate cancer may be asymptomatic, but as the disease progresses, symptoms such as difficulty urinating, blood in urine or semen, and erectile dysfunction can develop, emphasizing the importance of regular screening and early intervention to mitigate the impact on quality of life. '27. Hormone-refractory prostate cancer, also known as castration-resistant prostate cancer, CRPC, occurs when the disease progresses despite androgen deprivation, necessitating the use of additional therapies such as chemotherapy with docetaxel or cabazitaxel, which target rapidly dividing cancer cells through distinct cytotoxic mechanisms. '28. The relationship between chronic inflammation and prostate cancer has been a focal point in research, with inflammatory conditions potentially leading to genetic mutations over time, thus providing a fertile ground for cancer development, encouraging explorations into anti-inflammatory compounds as preventive measures. '29. Prostate cancer risk is significantly augmented by family history, with men having a first-degree relative diagnosed with prostate cancer being about twice as likely to develop the disease themselves, suggesting a substantial genetic component that could inform personalized screening strategies. '30. The use of 5-alpha reductase inhibitors in prostate cancer prevention is predicated on their ability to block the conversion of testosterone to dihydrotestosterone, a potent androgen that drives prostatic growth, though these medications are typically reserved for specific cases due to potential side effects. '31. The complexity of the tumor microenvironment in prostate cancer, including interactions between cancer cells, stromal cells, and extracellular matrix components, plays a crucial role in disease progression, influencing tumor growth, resistance to treatment, and metastatic potential, thus providing a rich target for novel therapeutic strategies. '32. Bone-targeted therapies such as bisphosphonates and denosumab play a pivotal role in managing bone metastasis in prostate cancer, working to reduce skeletal-related events by inhibiting osteoclast-mediated bone resorption, thereby enhancing patient quality of life and potentially extending survival. '33. Epidural spinal cord compression is a critical complication of metastatic prostate cancer that requires immediate medical intervention, often involving steroids, radiotherapy, or surgery to alleviate pressure on the spinal cord, thus preventing irreversible neurological damage and preserving functional status. '34. Prostate cancer staging with radiolabeled tracers like choline, or more recently PSMA, in positron emission tomography (PET) scanning, significantly improves detection of both local and distant metastasis, providing a comprehensive picture of disease burden that informs subsequent treatment planning. '35. Contemporary surgical techniques, such as robotic-assisted laparoscopic prostatectomy, have revolutionized prostate cancer surgery by offering enhanced dexterity and visualization, thereby improving outcomes related to oncological control, continence, and erectile function compared to traditional open procedures. '36. Chemoprevention trials in prostate cancer are exploring the use of dietary agents such as soy isoflavones and selenium, hypothesized to exert protective effects through modulation of hormonal and inflammatory pathways, though findings to date remain inconclusive and warrant further investigation. (37) Prostate cancer cell dormancy represents a significant clinical challenge, as disseminated tumor cells may remain quiescent for years before reactivation, complicating treatment strategies and necessitating ongoing research into the triggers of dormancy and potential interventions to eliminate dormant cells. (38) In the landscape of personalized medicine, molecular subtyping of prostate cancer is becoming increasingly important, with classification systems identifying distinct subsets of the disease based on genetic and molecular signatures, which can guide targeted therapeutic interventions and prognostic assessments. (39) The impact of psychosocial factors on prostate cancer outcomes is profound, with stress, depression, and lack of social support been associated with poorer survival, reinforcing the importance of holistic approaches that incorporate mental health and well-being support alongside traditional clinical care. (40) The risk stratification of prostate cancer recurrence post-treatment is enhanced by tools such as the Cancer of the Prostate Risk Assessment (CAPRA) score, which evaluates pre- and post-treatment variables to predict the likelihood of biochemical recurrence, thereby informing ongoing patient monitoring and management decisions. (41) In the exploration of resistance mechanisms, prostate cancer research has unveiled the role of aberrant CRIP signaling and DNA repair processes in conferring treatment resistance, emphasizing the need for combination regimens targeting multiple pathways to delay or overcome resistance in advanced cases. (42) The role of somatic mutations in genes such as SPOP, FOXA1, and CHD1 is being elucidated in the context of prostate cancer, with these mutations associated with specific clinicopathological features and treatment responses, offering the potential for enriched patient stratification in clinical trials. (43) In the realm of advanced imaging, 3D histological reconstruction from biopsy samples provides a deeper insight into the spatial arrangement of cancerous tissues within the prostate, offering potential improvements in understanding tumor biology and enhancing the precision of treatment planning. (44) Genetic counseling and testing for hereditary prostate cancer syndromes, particularly in families with BRCA mutations, are crucial components of risk assessment and management, enabling tailored screening protocols and consideration of prophylactic measures in high-risk individuals. (45) The use of metabolism-targeted therapies, such as inhibitors of fatty acid synthase or those impacting mitochondrial function, represents a burgeoning frontier in prostate cancer treatment, aiming to exploit the metabolic adaptations that cancer cells undergo to support rapid proliferation. (46) Tracking therapeutic responses in prostate cancer through advanced biomarkers, such as changes in circulating microRNA profiles, provides a non-invasive tool to monitor disease dynamics in real time, enabling adjustments to therapeutic regimens in response to detected changes. (47) In assessing and managing the side effects of prostate cancer treatments, integrative approaches combining conventional medical treatment with complementary methods such as acupuncture or yoga may offer relief from therapy-related symptoms, such as fatigue and anxiety, enhancing overall quality of life. 48. Ongoing research into the prostate cancer stem cell hypothesis suggests that tumorigenesis may be driven by a subset of stem-like cells capable of self-renewal and resistance to conventional therapies, presenting a profound challenge but also a potentially transformative target in the quest for more effective long-term treatments. 49. In the journey of a patient with prostate cancer, survivorship programs play an essential role in addressing long-term health outcomes, focusing on lifestyle modifications, routine health screenings, and psychological support as part of an integrated approach to life beyond cancer. 50. Advancements in cryobiopsy for prostate cancer allow for the preservation of tissue architecture and viability for extensive histopathological analyses, providing critical insights into tumor heterogeneity and molecular characterizations that guide personalized treatment plans and novel research directions. One. Esophageal cancer is a malignancy arising from the esophagus characterized by two main histological types: squamous cell carcinoma, which typically affects the upper portion of the esophagus and is strongly associated with smoking and alcohol consumption, and adenocarcinoma, which often develops in the lower part of the esophagus and is linked to chronic gastroesophageal reflux disease and Barrett's esophagus. 2. The pathophysiology of esophageal cancer involves the uncontrolled proliferation of cells lining the esophagus, often initiated by chronic irritation or inflammation caused by factors such as tobacco, alcohol, and gastroesophageal reflux, which over time can lead to genetic mutations and the development of neoplasms. 3. Early-stage esophageal cancer is often asymptomatic or presents with subtle symptoms like difficulty swallowing, dysphagia, which is frequently noticed with solid foods and can progressively worsen to include liquids as the tumor grows, causing obstruction within the esophageal lumen. 4. Diagnosis of esophageal cancer commonly involves upper endoscopy with biopsy for histological examination, offering direct visualization of the mucosal abnormalities, combined with imaging techniques such as CT and PET scans to assess tumor staging and metastatic spread. 5. The most significant risk factor for esophageal adenocarcinoma is chronic gastroesophageal reflux disease, GERD, which can cause Barrett's esophagus, a precancerous condition marked by the metaplastic transformation of normal squamous epithelium to columnar-lined epithelium over time. 6. Squamous cell carcinoma of the esophagus is more prevalent in certain geographic regions such as East Asia and Eastern Africa, with dietary influences, consumption of very hot beverages, and nutritional deficiencies playing contributory roles in its etiology. 7. Treatment for esophageal cancer varies based on the stage and location of the tumor but generally involves a combination of surgery, radiation, and chemotherapy, with esophagectomy being the mainstay curative approach for localized tumors, while systemic chemotherapy is pivotal for metastatic disease. 8. Barrett's esophagus represents a premalignant condition in which the squamous epithelium of the distal esophagus is replaced by intestinal columnar epithelium, increasing the risk of developing esophageal adenocarcinoma due to chronic acid exposure and inflammation. 9. Endoscopic ultrasound, EUS, serves as a critical tool in the staging of esophageal cancer, allowing for detailed assessment of tumor penetration into the esophageal wall and surrounding lymph nodes, which is crucial for planning effective treatment strategies. 10. The prognosis of esophageal cancer varies significantly by stage at diagnosis, with localized disease offering the best chance of cure, whereas advanced or metastatic disease is associated with a poor prognosis and a 5-year survival rate of less than 20%. 11. Symptomatic treatments for esophageal cancer may include esophageal dilation or stenting to alleviate obstructive symptoms, thereby improving swallowing and nutritional intake, especially in cases where the tumor is unresectable or the patient is unfit for surgery. 12. Molecular markers and genetic profiling are gaining attention in the prognosis and targeted therapy of esophageal cancer, with HER2 overexpression and PD-L1 expression being examples of biomarkers that can influence treatment plans, including the use of targeted therapies like trastuzumab or immune checkpoint inhibitors. (13) Smoking cessation is crucial in reducing the risk of esophageal squamous cell carcinoma, as tobacco smoke contains numerous carcinogens that contribute to the development of various intraepithelial lesions and malignant transformations in the esophagus. (14) The role of the p53 tumor suppressor gene is pivotal in esophageal carcinogenesis, with mutations in this gene frequently encountered in both adenocarcinomas and squamous cell carcinomas, leading to impaired cell cycle regulation and increased susceptibility to neoplastic transformation. (15) Nutritional support is a key component of managing esophageal cancer, especially when advanced disease or treatment side effects compromise oral intake, necessitating interventions such as enteral feeding or supplementation to maintain adequate nutrition and weight. (16) Esophageal leiomyoma is the most common benign esophageal tumor, often asymptomatic and discovered incidentally on imaging, and differs from malignant lesions by its smooth muscle origin and low potential for malignant transformation. Surgical removal is warranted only if symptomatic. (17) PET cord scanning is invaluable for detecting metabolic activity and assessing distant metastasis in esophageal cancer, giving comprehensive information on disease spread that cannot be obtained through conventional imaging alone, thereby influencing decisions on the need for neoadjuvant therapy. (18) Alcohol use is a major risk factor for esophageal squamous cell carcinoma, with a dose-dependent relationship indicating that higher alcohol intake significantly elevates the risk of developing this type of cancer, emphasizing the importance of moderation or avoidance in at-risk populations. (19) Chemoradiotherapy can serve as a neoadjuvant treatment for esophageal cancer, intending to shrink the tumor preoperatively, improve the surgical outcome, and address microscopic metastatic disease, particularly in patients with locally advanced but still resectable tumors. (20) The development of minimally invasive esophagectomy (MIE) techniques has revolutionized the surgical management of esophageal cancer, offering reduced postoperative morbidity, faster recovery times, and comparable oncological outcomes to traditional open surgical approaches. (21) The expression of matrix metalloproteinases (MMPs) in esophageal cancer correlates with aggressive tumor behavior and metastatic potential, as these enzymes degrade extracellular matrix components, facilitating tumor invasion and spread, making them potential targets for therapeutic intervention. (22) Regular monitoring through endoscopic surveillance is critical for patients with Barrett's esophagus to detect dysplastic changes early, allowing for timely intervention strategies aimed at preventing progression to esophageal adenocarcinoma, including endoscopic resection or ablation techniques. (23) Dysphagia, or difficulty swallowing, is often one of the earliest and most common presenting symptoms of esophageal cancer, primarily resulting from tumor-induced luminal narrowing, progressing from solids to liquids as the disease advances, warranting prompt diagnostic evaluation. (24) The incidence of esophageal adenocarcinoma has been rising in Western countries, likely related to increased prevalence of obesity and gastroesophageal reflux disease, highlighting the role of lifestyle modification and surveillance in at-risk populations to curb this trend. 25. Adenocarcinoma of the esophagus frequently exhibits overexpression or amplification of the HER2/Neu oncogene, which has made the trastuzumab-based therapeutic regimen a viable option for improving outcomes in HER2-positive esophageal cancer, similar to its use in breast cancer. 26. Genetic syndromes such as tylosis, characterized by palmoplantar keratoderma, are associated with esophageal cancer, particularly squamous cell carcinoma, underscoring the importance of genetic counseling and early surveillance in affected families due to their markedly increased risk. 27. The role of E-cadherin, a cell adhesion molecule, is significant in esophageal cancer, with loss of its expression being linked to epithelial to mesenchymal transition, increased invasiveness, and metastatic potential, suggesting its potential utility as a prognostic marker. 28. Achalasia, a primary esophageal motility disorder, increases the risk of esophageal squamous cell carcinoma due to long-standing stasis and inflammation, making periodic endoscopic surveillance vital in patients with this condition to detect early neoplastic changes. 29. Proton pump inhibitors, PPIs, are commonly prescribed to manage gastroesophageal reflux disease and can play a role in preventing progression to Barrett's esophagus and esophageal adenocarcinoma by significantly reducing acid exposure and subsequent esophageal inflammation. 30. The overexpression of VEGF, a potent angiogenic factor, in esophageal cancer correlates with poor prognosis due to its role in promoting tumor angiogenesis and growth, making it a potential target for anti-angiogenic therapies such as bevacizumab in the treatment of advanced disease. Photodynamic therapy, PDT, is an endoscopic treatment option for early-stage esophageal cancer or dysplasia in Barrett's esophagus, utilizing photosensitizing agents activated by light to destroy cancerous cells with minimal damage to surrounding healthy tissue. Multidisciplinary management of esophageal cancer, incorporating input from gastroenterologists, oncologists, surgeons, radiologists, and nutritionists, is essential to delivering comprehensive care tailored to individual patient needs and maximizing therapeutic outcomes. Epstein-Barr virus, EBV, has been implicated in certain cases of esophageal squamous cell carcinoma, with studies suggesting a possible etiological role, though the exact mechanisms of oncogenesis remain unclear and warrant further investigation to establish causation. The assessment of esophageal tumor margins post-resection is critical to ensure complete excision and prevent local recurrence, often involving frozen section analysis intraoperatively to guide the surgical approach and achieve clear margins for optimal oncological outcomes. Targeted therapies, such as monoclonal antibodies and small molecule inhibitors, are increasingly explored in esophageal cancer treatment, with ongoing research focusing on biomarkers like EGFR, MET, and PD-1/PD-L1 pathways to enhance response rates and survival benefits. Monitoring treatment response in esophageal cancer often involves serial imaging studies, including CT or PET scans, combined with clinical evaluation of symptom resolution, providing key insights into therapeutic effectiveness and facilitating timely adjustments in management plans. Obesity is a known risk factor for esophageal adenocarcinoma, primarily through its association with gastroesophageal reflux and subsequent Barrett's esophagus, emphasizing the importance of weight management and lifestyle modifications in lowering cancer incidence in overweight populations. Human papillomavirus, HPV, has been investigated for its potential role in esophageal squamous cell carcinoma, with some studies identifying HPV DNA in tumor tissue, yet its significance remains controversial, and additional research is needed to clarify its impact on esophageal carcinogenesis. The use of serological markers, such as squamous cell carcinoma antigen, SCC-AG, provides supplementary information in monitoring and prognosticating esophageal squamous cell carcinoma, although their utility is limited by specificity and the need for further validation. Brachytherapy, a form of internal radiation therapy, can be employed as a palliative treatment in esophageal cancer, particularly in advanced or recurrent disease, to provide symptomatic relief from dysphagia and improve the quality of life, especially when external beam radiation is not feasible. Robotic-assisted esophagectomy offers a modern surgical approach with advantages including enhanced precision, reduced blood loss, and shorter hospital stays compared to traditional methods, though it requires specialized training and equipment, contributing to its limited availability. Chronic esophagitis, resulting from prolonged gastroesophageal reflux, can cause progressive cellular alterations, ultimately leading to Barrett's esophagus and increasing the risk for esophageal adenocarcinoma, hence the importance of early and effective management of reflux symptoms. The gut microbiome's role in esophageal cancer is an emerging field of study, with research suggesting that dysbiosis or alterations in the microbial balance may influence carcinogenesis, although the precise mechanisms and implications for prevention and therapy remain to be fully elucidated. Neoangiogenesis, the formation of new blood vessels, is crucial for esophageal tumor growth and progression, often driven by factors like VEGF, making anti-angiogenic agents an appealing therapeutic option to limit nutrient supply and impair tumor expansion in advanced cancer stages. Inflammatory mediator overproduction, such as prostaglandins, in chronic reflux esophagitis can exacerbate tissue damage and increase cancer risk, supporting the use of anti-inflammatory drugs, like COX-2 inhibitors, in potentially reducing the progression to esophageal cancer. Salvage surgery is sometimes employed in esophageal cancer for recurrent disease following chemoradiation, offering the possibility of disease control or cure when initial non-surgical treatments fail, though it is associated with higher morbidity and requires careful patient selection. Nanotechnology applications in esophageal cancer encompass drug delivery systems aimed at enhancing therapeutic efficacy and reducing systemic toxicity, utilizing nanoparticles to target cancer cells more precisely, representing a burgeoning area of research with promising potential. Esophageal cancer screening is not widely implemented due to the lack of a sufficiently sensitive and cost-effective method for the general population, although high-risk groups, such as those with Barrett's esophagus, may benefit from regular endoscopic surveillance to identify early malignancies. Dysregulation of cyclooxygenase 2, COX2, expression in esophageal cancer is associated with increased proliferation and resistance to apoptosis, providing a rationale for using COX2 inhibitors as a potential therapeutic strategy to enhance treatment response and inhibit tumor progression. Cryotherapy is an emerging endoscopic treatment for early esophageal cancer or precancerous lesions, utilizing extreme cold to ablate dysplastic tissue with minimal invasiveness and complications, offering an alternative to more invasive surgical options in select patients. Lung cancer remains the leading cause of cancer-related deaths worldwide, attributed to the late-stage diagnosis often seen in patients, with over 85% being non-small cell lung cancer, NSCLC, which can be further subdivided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, each presenting with distinct histological features that demand different therapeutic strategies and have varied genetic mutations, such as EGFR, ALK, and KRAS, crucial for targeted therapies' effectiveness. Two, smoking has long been established as the primary risk factor for lung cancer development, with carcinogens in tobacco leading to chronic inflammation and genetic mutations in lung tissues over years. Yet an intriguing fact is that about 10 to 15% of lung cancer cases occur in never smokers, often linked to genetic predispositions or environmental exposures like radon, asbestos, and air pollution, highlighting the complexity and multifactorial nature of lung cancer pathogenesis. 3. Early detection of lung cancer significantly improves prognosis but is notoriously challenging due to the asymptomatic nature of early stages, making low-dose computed tomography, LDCT, a valuable tool for high-risk populations, as studies have shown that annual LDCT screenings can reduce lung cancer mortality by up to 20% by catching malignancies that are still amenable to curative interventions such as surgery or localized treatments. 4. Small cell lung cancer, SCLC, although accounting for only 15% of lung cancer cases, is a formidable foe due to its aggressive nature, characterized by rapid growth and early metastasis, necessitating a treatment approach that includes a combination of chemotherapy and radiation. Yet ongoing research is exploring the potential of immunotherapy, particularly checkpoint inhibitors, to exploit the high mutational burden of SCLC to enhance immune recognition and destruction of cancer cells. 5. The role of liquid biopsies is gaining prominence in lung cancer management for its ability to non-invasively capture circulating tumor DNA, ctDNA, from peripheral blood, providing real-time insight into tumor genetics, monitoring treatment response, and detecting minimal residual disease or resistance mutations, thereby personalizing therapy and allowing for swift adjustments in clinical strategy. 6. Immunotherapy has revolutionized the treatment landscape for NSCLC, with pioneering drugs like pembrolizumab and nivolumab targeting PD-1, PD-L1 or CTLA-4 pathways, reactivating the immune system to target cancer cells, and in some cases, leading to durable responses where traditional chemotherapies have failed. Emphasizing the genetic and immunologic diversity of NSCLC as significant determinants of therapeutic success. 7. The interplay of genetics and lifestyle in lung cancer risk is an area of intense investigation, with polymorphisms in genes such as TP53, CYP1A1, and GSTM1 shown to modulate individual susceptibility to carcinogens, and studies suggest that epigenetic modifications, induced by chronic exposure to tobacco smoke, lead to aberrant gene silencing that can drive tumorigenesis, expanding the horizon for potential preventative and therapeutic interventions aimed at modifying gene expression tools. 8. The ALK gene rearrangement is a critical oncogenic driver in approximately 3 to 7% of NSCLC cases, particularly in younger non-smokers presenting with adenocarcinoma, and the development of targeted ALK inhibitors like crizotinib, ceritinib, and alectinib has transformed these patients' treatment protocols, achieving significant response rates by specifically disrupting the aberrant signaling cascade responsible for unchecked cellular proliferation. 9. Palliative care plays an essential role in advanced lung cancer management by addressing symptom burdens such as pain, dyspnea, and anxiety, often through a multidisciplinary approach that integrates both medical and psychosocial interventions, including pharmacological therapies like opioids for pain relief and dexamethasone for brain metastasis, alongside holistic support that aims to improve quality of life and patient dignity at all care stages. 10. Research into the tumor microenvironment of lung cancer indicates that stromal cells, immune cells, and the extracellular matrix interact intricately with cancer cells to facilitate tumor growth, metastasis, and resistance to therapy, resulting in increased interest in therapeutic strategies that target these interactions, such as VEGF inhibitors, which aim to disrupt angiogenesis and normalize tumor vasculature, enhancing drug delivery and efficacy. 11. The discovery of MET exon 14 skipping mutations has opened new avenues for targeted therapy in NSCLC, which occur in about 3% of patients and are amenable to MET inhibitors like capmatinib and tepotinib, leading to improved clinical outcomes by preventing the degradation of MET receptor tyrosine kinases and thus disrupting oncogenic signaling responsible for tumor growth and survival. 12. Advances in artificial intelligence have shown promise in lung cancer diagnosis, specifically in analyzing imaging data with improved precision over traditional radiologic interpretation, empowering early detection and prognosis determination by identifying subtle patterns and quantifying tumor characteristics that could escape the human eye, thereby enhancing diagnostic accuracy and personalizing treatment strategies. 13. The EML4-ALK fusion, resulting from chromosomal rearrangements in NSCLC, underscores the importance of precision oncology, as these molecular aberrations can be effectively targeted by specific tyrosine kinase inhibitors, exemplifying the paradigm shift towards tailoring cancer treatment based on individual genetic profiles rather than a one-size-fits-all approach, ultimately improving patient outcomes through personalized medicine. 14. The development of pembrolizumab, a PD-1 inhibitor, as frontline treatment for metastatic NSCLC expressing PD-L1 is greater than or equal to 50% marks a significant milestone in immunotherapy, as it highlights the role of predictive biomarkers in guiding therapy, leading to substantial improvements in survival compared to chemotherapy and representing a critical step toward optimized personalized cancer care. 15. Radiomic analysis of lung cancer imaging scans offers groundbreaking opportunities for extracting quantitative features related to tumor phenotype and microenvironment, facilitating innovative research into biomarkers that may predict treatment response, disease progression, or patient outcomes, thus opening pathways to novel prognostic tools that integrate seamlessly with clinical workflows. 16. Lung cancer's somatic genome landscape reveals compelling insight into epigenetic changes, such as aberrant DNA methylation and histone modification profiles, which contribute to oncogenesis by deregulating gene expression and promoting a cancer-favorable environment, suggesting that therapeutic strategies targeting epigenomic alterations could offer efficacious alternatives to conventional treatments, contingent upon tailored genomic analyses. 17. Despite significant advances in understanding lung cancer pathophysiology, curative treatments remain elusive for many patients due to metastasis. However, recent efforts in precision mapping the metastatic cascade indicate that organotropism, influenced by genetic mutations and microenvironmental interactions, could be exploited to develop novel interventions that interrupt metastatic colonization and offer potential pathways for therapeutic breakthroughs. 18. Lung cancer screening guidelines have evolved to incorporate risk-based models that consider multiple factors beyond age and smoking history, such as family history and genetic predispositions, providing a more comprehensive assessment of individual risk and optimizing screening efficacy, which is crucial for early detection that may translate into significant reductions in disease-related morbidity and mortality. 19. Preclinical models of lung cancer, particularly patient-derived xenografts and organoids, have become indispensable tools in the research community, offering platforms that closely mimic human tumors' microenvironment and genetic landscape, facilitating the evaluation of novel therapeutic agents and the testing of combination regimens, ultimately accelerating the translation of basic research findings into clinical practice. 20. Waldenstrom macroglobulinemia's treatment approach emphasizes symptom management and targeted therapy, with medications like ibrutinib, a Bruton tyrosine kinase inhibitor, showing promise in clinical trials by directly interfering with B-cell receptor signaling pathways, thereby inducing apoptosis and reducing tumor burden, redefining therapeutic outcomes for patients with this rare type of lymphoma. 21. Recent studies highlight that gender disparities in lung cancer incidence and outcomes may be influenced by differential hormonal effects, with estrogens potentially promoting carcinogenesis through receptor-mediated pathways, which introduces the potential of using anti-estrogen therapies, commonly employed in breast cancer, as adjuncts in specific lung cancer treatment regimens to exploit these sex-specific pathways. 22. Personalized cancer vaccines are an exciting frontier in the immunotherapy landscape for lung cancer, wherein neoantigen profiles unique to a patient's tumor are harnessed to elicit robust immune responses, potentially transforming treatment paradigms by boosting the efficacy of existing immunotherapeutics and providing individual-specific anti-tumor immunity that adapts to evolving tumor landscapes. 23. Molecular profiling of lung cancer tumors has revealed tumor mutational burden, TMB, as a key biomarker for predicting response to immunotherapy, which underscores the potential to stratify patients more effectively, allowing clinicians to identify those likely to benefit from checkpoint inhibitors and sparing non-responders from unnecessary treatment's adverse effects, thereby optimizing therapeutic efficiency and patient outcomes. 24. There's growing recognition of the impact of racial and ethnic disparities in lung cancer treatment outcomes, with social determinants of health playing a significant role. Research indicates that genetic differences in access to care contribute to varying responses in health outcomes, advocating for a more inclusive approach in clinical trials to ensure treatment modalities are effective across diverse populations. 25. Digital pathology and the adoption of whole slide imaging in lung cancer diagnostics herald a transformative era, leveraging machine learning algorithms to refine diagnostic accuracy, reduce inter-observer variability, and facilitate the integration of histopathological data with molecular and clinical findings, which promises to enhance pathologists' capabilities and further precision oncology initiatives. 26. Lung cancer's immune resistance mechanisms, including the induction of regulatory T cells and the upregulation of immune checkpoints, pose substantial challenges to sustained immunotherapeutic efficacy, encouraging the exploration of combination therapies that include immune modulators, anti-angiogenics, or targeted agents designed to potentially overcome these resistive barriers and enhance therapeutic response. 27. The heterogeneity of tumor nodules and non-uniform expression of genetic aberrations within a single lung cancer lesion can complicate therapeutic decision-making. Therefore, advanced molecular imaging techniques, such as fluorodeoxyglucose (FDG) PET scans, are invaluable in providing comprehensive metabolic and functional information that complements traditional imaging and biopsy, facilitating more informed clinical judgments. 28. Autophagy, a cellular process for degrading and recycling cellular components, has a paradoxical role in lung cancer progression, with emerging research suggesting that while autophagy can suppress initial tumor development by alleviating oxidative stress, it may also support established tumors by fulfilling metabolic demands and promoting cell survival under therapeutic stress, thus representing a potential therapeutic target with dual implications. 29. The intersection of precision oncology and big data analytics in lung cancer research capitalizes on advanced computational methods to integrate multi-omics datasets, encompassing genomics, proteomics, and metabolomics, ultimately decoding the complex biological networks that drive carcinogenesis and treatment resistance, offering a pathway to discover innovative biomarkers and facilitate the development of individualized therapeutic strategies. 30. The interplay between infectious agents and lung cancer risk is illustrated by persistent infections with oncogenic pathogens like HPV and EBV. which contribute to carcinogenic processes through mechanisms such as chronic inflammation and immune evasion, suggesting that preventive measures including vaccination and antiviral therapies represent a potential avenue for lung cancer risk reduction in specific populations. 31. In lung cancer research, emphasis has been placed on elucidating the role of cancer stem cells, CSCs, in tumor initiation, resistance, and relapse, as these cells possess self-renewal capabilities and are often impervious to conventional therapies, driving ongoing efforts to identify CSC-specific markers and signaling pathways that could be harnessed for targeted elimination, thereby achieving more durable remissions. 32. The emergence of liquid biopsy technologies that detect RNA splicing variants and fusion transcripts offers a novel dimension to lung cancer diagnostics, enabling the identification of actionable targets and monitoring of molecular dynamics beyond genomic DNA alterations, thus expanding the arsenal for personalizing treatment protocols and improving patient management through minimally invasive means. 3. Lung cancer rehabilitation programs are gaining traction as essential components of comprehensive care, focusing on physical reconditioning, nutritional support, and psychosocial interventions that address the multifaceted needs of patients, ultimately enhancing functional independence, reducing symptom burden, and fostering improved health-related quality of life in individuals undergoing or recovering from cancer treatment. 34. The discovery that specific subtypes of lung adenocarcinoma exhibit a unique genomic and metabolic profile, including aberrant Krebs cycle enzyme activity and nucleotide metabolism, highlights a novel dimension of metabolic reprogramming, propelling research efforts towards exploiting these vulnerabilities through targeted metabolic inhibitors as a promising adjunctive approach in the battle against lung cancer. 35. In the era of digital health, lung cancer care is benefiting from interconnected systems and real-time data tracking, whereby wearable devices and mobile health applications facilitate patient monitoring and adherence to treatment plans, offering clinicians actionable insights and empowering patients with tools for actively participating in their care, consequently improving treatment outcomes and patient satisfaction. 36. Lung cancer's dynamic heterogeneity and evolution under therapeutic pressures underscore the value of spatial transcriptomics, an emerging field that integrates gene expression data with histopathology to map the spatial distribution of cellular states within tumor microenvironments, providing critical insights into the mechanisms of tumor progression and resistance, ultimately informing innovative therapeutic strategies. 37. In addition to tobacco smoking, evidence is emerging on the carcinogenic potential of emerging tobacco products such as electronic cigarettes and water pipes, which similarly deliver carcinogens that can induce DNA damage and promote lung cancer, thus establishing robust regulatory frameworks and increasing public awareness of their potential long-term health impacts remains pivotal to lung cancer prevention efforts. 38. Radiotherapy plays a critical role in the curative and palliative landscape of lung cancer treatment, with technological advancements in conformal radiotherapy including intensity-modulated radiation therapy, IMRT, and stereotactic body radiation therapy, SBRT, enabling precise delivery of radiation to tumors while sparing healthy tissue, significantly improving local control and minimizing side effects in lung cancer patients. 39. Lung cancer treatment increasingly leverages computational modeling and simulations to predict tumor behavior in response to different therapeutic regimens, allowing for a proactive and adaptive treatment approach that accounts for tumor characteristics, patient-specific factors, and potential resistance mechanisms, thereby optimizing clinical outcomes and minimizing toxicity through personalized treatment planning. 40. Understanding the role of fibroblast growth factor receptors, FGFRs, in lung cancer has prompted the development of FGFR inhibitors, as aberrations in FGFR signaling pathways contribute to tumorigenesis and resistance. Targeting these pathways offers a new treatment modality, with ongoing clinical trials investigating the efficacy of FGFR inhibitors in combination with other therapies aiming to enhance therapeutic responses. 41. Effective management of lung cancer-related cachexia, characterized by progressive weight loss and muscle wasting, necessitates a comprehensive approach that integrates nutritional support, physical activity, pharmacologic interventions like appetite stimulants and anabolic agents, and the early identification of metabolic derangements to mitigate cachexia's impact on treatment tolerance and overall patient prognosis. 42. The exploration of tumor neoantigens, peptides derived from tumor-specific mutations, provides a promising arena for cancer vaccine development in lung cancer, offering the ability to generate robust patient-specific immune responses with the potential to prevent metastasis and induce durable remissions, reflecting the ongoing shift towards precision immunotherapy approaches tailored to individual tumor profiles. 43. The increasing recognition of exosomal cargo as a trove of biomarkers in lung cancer has fueled research into their potential for diagnostics and therapeutics, as these extracellular vesicles carry molecular signatures reflective of the tumor's genetic and phenotypic state, offering insights into metastasis, immune modulation, and resistance mechanisms, and potentially serving as delivery vehicles for targeted therapies. 44. In the context of lung cancer's treatment landscape, the application of quantum computing holds promise for accelerating drug discovery and optimizing treatment protocols by enabling the rapid simulation of complex molecular interactions at an unprecedented scale, potentially uncovering novel therapeutic targets and revolutionizing the design of drug regimens to outpace tumor evolution and drug resistance. 45. Emerging research on the lung cancer microbiome suggests that microbial composition may influence carcinogenesis through mechanisms such as immune modulation and metabolite production, implicating certain bacterial species in tumor progression and resistance, and prompting investigations into microbiome-targeted therapies that could disrupt these processes and enhance the efficacy of existing treatment modalities. 46. The continual evolution of targeted therapies has sparked interest in combination strategies that simultaneously address multiple oncogenic drivers in lung cancer, with a focus on overcoming resistance by incorporating novel agents that act synergistically or sequentially to inhibit compensatory pathways, thus extending the duration of therapeutic efficacy and delaying disease progression. 47. The intricate relationship between chronic obstructive pulmonary disease, COPD, and lung cancer is evident, as COPD serves as an independent risk factor with shared pathogenic mechanisms like chronic inflammation and epigenetic alterations, emphasizing the importance of integrated management approaches that concurrently address both conditions to improve patient outcomes through comprehensive medical care. 48. Genetic counseling and testing have become integral components of lung cancer care, especially for patients with a family history suggestive of hereditary cancer syndromes, providing valuable information for risk assessment, early detection strategies, and personalized treatment planning, and empowering individuals to make informed decisions about their health management. 49. The convergence of lung cancer and aging research has highlighted that cellular senescence and age-related immune decline play critical roles in tumor progression and treatment response, prompting investigations into senolytic therapies and rejuvenation of immune function as promising strategies to enhance the therapeutic arsenal against lung cancer while addressing the complexities of cancer in the elderly population. 50. The integration of molecular imaging techniques in lung cancer surgery, such as intraoperative fluorescence-guided resection, offers the potential for enhanced precision in identifying tumor margins and residual disease, thereby improving surgical outcomes and reducing recurrence rates through tailored resections that maximize tumor removal while preserving healthy tissue function. 1. Gastric ulcers, a common form of peptic ulcers, occur when the protective mucosal lining of the stomach is damaged, most often due to Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, resulting in symptoms like burning stomach pain, bloating, and nausea, and are diagnosed through endoscopy and treated with proton pump inhibitors, antibiotics, and lifestyle modifications to reduce stress and dietary irritants. 2. Inflammatory bowel disease, IBD, encompassing Crohn's disease and ulcerative colitis, is characterized by chronic inflammation of the gastrointestinal tract, with Crohn's affecting any part from mouth to anus and ulcerative colitis limited to the colon and rectum, presenting with symptoms such as abdominal pain, diarrhea, weight loss, and fatigue, and requiring a combination of diagnostic imaging, endoscopic evaluation, and serological markers for diagnosis and management with anti-inflammatory drugs, immunosuppressants, and occasionally surgery. 3. Irritable bowel syndrome, IBS, a functional gastrointestinal disorder, manifests with symptoms of abdominal pain, bloating, diarrhea, and constipation, often triggered by stress, hormonal changes, or certain foods, but lacks structural abnormalities, making diagnosis reliant on exclusion of other conditions and ROM-IB criteria, with treatment focused on dietary modifications, stress management, and pharmacological agents such as fiber supplements, antispasmodics, and laxatives to alleviate symptoms and improve patient quality of life. 4. Celiac disease is an autoimmune disorder triggered by ingestion of gluten, a protein found in wheat, barley, and rye, leading to small intestinal villus atrophy and malabsorption, manifesting with symptoms like diarrhea, bloating, weight loss, and fatigue, and diagnosed through serologic testing for antibodies such as tissue transglutaminase IgA, with confirmation via duodenal biopsy. Strict lifelong adherence to a gluten-free diet is the cornerstone of treatment to alleviate symptoms and prevent complications such as osteoporosis and malignancy. 5. Gastroesophageal reflux disease, GERD, occurs when stomach acid frequently flows back into the esophagus, irritating its lining and leading to symptoms such as heartburn, regurgitation, and difficulty swallowing, often due to lower esophageal sphincter relaxation or hiatal hernia, and can cause complications like esophagitis or Barrett's esophagus if untreated. Diagnosis is based on clinical presentation, pH monitoring, and endoscopy, with lifestyle modifications, antacids, and proton pump inhibitors forming the backbone of treatment. 6. Acute pancreatitis, an inflammatory condition of the pancreas, is commonly caused by gallstones or alcohol intake, presenting with sudden onset severe epigastric pain radiating to the back, nausea, vomiting, and elevated serum amylase and lipase levels. It is diagnosed through clinical evaluation and imaging studies such as CT scan, and management involves supportive care with fluid resuscitation, pain control, and avoidance of oral intake to rest the pancreas, while addressing the underlying etiology to prevent future attacks. 7. Barrett's esophagus is a condition in which the normal squamous epithelium of the distal esophagus is replaced by columnar-lined epithelium due to chronic gastroesophageal reflux disease, GERD, increasing the risk for esophageal adenocarcinoma, and is often asymptomatic, diagnosed through endoscopic biopsy revealing intestinal metaplasia. Surveillance with periodic endoscopy and management of reflux through lifestyle modification and proton pump inhibitors are critical for reducing carcinoma risk. 8. Diverticulitis occurs when small bulging pouches, or diverticula, in the digestive tract lining become inflamed or infected, typically presenting with abdominal pain, fever, and altered bowel habits, often in the lower left quadrant, and a diet low in fiber and high in refined foods is a major risk factor. It is diagnosed with imaging such as CT scan, and treatment involves bowel rest, antibiotics, and dietary adjustments, with surgery reserved for recurrent or complicated cases. Nine. Hepatitis, an inflammation of the liver, can be caused by viral infections, notably hepatitis A, B, C, D, and E, alcohol, drugs, or autoimmune disease, presenting with symptoms such as jaundice, abdominal pain, fatigue, and elevated liver enzymes, and diagnosis involves serological testing and liver function tests, with treatment tailored to the etiology, such as antiviral drugs for chronic viral hepatitis, abstinence from alcohol, immunosuppressants for autoimmune hepatitis, and lifestyle modifications to preserve liver function. 10. Gallstones, or cholelithiasis, are solid particles that form in the gallbladder from bile components, often due to supersaturation of cholesterol, biliary stasis, or increased bilirubin, and are largely asymptomatic but can cause biliary colic, cholecystitis, pancreatitis, or cholangitis if obstructive. Diagnosis is confirmed by ultrasound, and management ranges from observation to laparoscopic cholecystectomy, especially in symptomatic cases or complications. 11. Ulcerative colitis is a form of inflammatory bowel disease that specifically affects the colon and rectum, causing continuous colonic mucosal inflammation beginning in the rectum and extending proximally, with symptoms including bloody diarrhea, abdominal cramping, and urgency, diagnosed through colonoscopy and histopathological examination, and treated with aminosalicylates, corticosteroids, immunomodulators, and biologic agents to induce and maintain remission, with colectomy as a surgical option for refractory or complicated disease. 12. Crohn's disease is an inflammatory bowel disease that can affect any part of the gastrointestinal tract from mouth to anus, characterized by transmural inflammation, skip lesions, and complications such as strictures, fistulas, and abscesses, presenting with abdominal pain, diarrhea, weight loss, and nutritional deficiencies. Diagnosis is made through endoscopic evaluation, imaging, and biopsy, and management involves anti-inflammatory medications, biologics, nutritional support, and, when necessary, surgical intervention to manage complications or treatment resistance. 13. Hepatic encephalopathy is a complex neuropsychiatric syndrome resulting from liver dysfunction, often triggered by acute or chronic liver disease, marked by confusion, altered level of consciousness, and asterixis, due to buildup of neurotoxic substances like ammonia, and diagnosed clinically and supported by blood ammonia levels. Management focuses on reducing ammonia production and absorption with lactulose and antibiotics, addressing precipitating factors, and consideration of liver transplantation in severe or refractory cases. 14. Achalasia is a motility disorder of the esophagus characterized by failure of the lower esophageal sphincter to relax and absent or impaired peristalsis, leading to symptoms of progressive dysphagia for solids and liquids, regurgitation, and chest pain, with diagnostic confirmation via esophageal manometry, barium swallow, and endoscopy. Treatment options include pneumatic dilation, surgical myotomy, and pharmacologic therapies such as botulinum toxin injections to relieve obstruction and improve swallowing function. 15. Clostridioides difficile infection is a significant cause of antibiotic-associated diarrhea, resulting from disruption of normal colonic microbiota, typically due to broad-spectrum antibiotic use, leading to toxin-mediated colitis with symptoms of watery diarrhea, fever, and abdominal pain, confirmed by stool toxin assays or PCR. Management involves cessation of the offending antibiotic, initiation of oral vancomycin or fidaxomicin, and infection control measures, with fecal microbiota transplantation considered in recurrent cases. 16. Celiac disease requires lifelong adherence to a gluten-free diet to manage symptoms and prevent complications, as it is an autoimmune disorder where ingestion of gluten leads to small intestinal mucosal injury, malabsorption, and symptoms like diarrhea, anemia, and neurological issues, confirmed by serologic testing for specific antibodies and duodenal biopsy showing villus atrophy, with diligent dietary management necessary to improve patient outcomes and quality of life significantly. 17. Colorectal cancer screening, crucial for early detection and improved survival, involves methods such as fecal occult blood testing, fecal immunochemical tests, sigmoidoscopy, and colonoscopy beginning at age 45 to 50 for average-risk individuals, aiming to identify and remove precancerous polyps and detect cancer at an early, more treatable stage, with high-risk individuals requiring earlier and more frequent screening intervals based on personal or family history and genetic factors. 18. Wilson's disease is a rare genetic disorder characterized by excessive copper accumulation in the body due to defective hepatic copper transport, leading to hepatic, neurologic, and psychiatric manifestations, often with Kayser-Fleischer rings on examination, and diagnostic confirmation includes serum ceruloplasmin, 24-hour urinary copper excretion, liver biopsy, or genetic testing. It is managed with copper chelating agents such as D-penicillamine or trientine, and zinc therapy to prevent disease progression and maintain normal copper balance. 19. Portal hypertension, most commonly resulting from cirrhosis, is characterized by increased pressure in the portal venous system, leading to complications such as variceal bleeding, ascites, and hepatic encephalopathy, with diagnosis made by assessing clinical signs and using imaging modalities like Doppler ultrasound and hepatic venous pressure gradient measurement, while treatment aims at lowering portal pressure through beta blockers, endoscopic variceal ligation, TIPS, transjugular intrahepatic portosystemic shunt, and managing underlying liver disease. 20. Lactose intolerance is the inability to digest lactose, a sugar found in milk and dairy products, due to deficient levels of the enzyme lactase produced by the small intestine, resulting in symptoms like bloating, diarrhea, and abdominal pain after consuming lactose-containing foods, diagnosed by hydrogen breath test, lactose tolerance test, or lactase gene testing, and managed through dietary modifications, lactose-free products, and lactase enzyme supplements to improve symptoms and dietary tolerance. 21. Gastrointestinal bleeding can present as hematemesis, melena, or hematochezia, with upper GI bleeding most commonly caused by peptic ulcers, esophageal varices, and Mallory-Weiss tears, while lower GI bleeding often results from diverticulosis, colorectal cancer, or hemorrhoids. Diagnosis involves endoscopic evaluation, imaging, and laboratory tests assessing hematologic and coagulation status, while management depends on stabilization with intravenous fluids and blood products, endoscopic hemostatic procedures, and treating the underlying cause. 22. Dumping syndrome, often seen post-gastric surgery, occurs when ingested food moves too quickly from the stomach into the small intestine, causing early and late postprandial symptoms such as nausea, bloating, abdominal cramps, diarrhea, dizziness, and tachycardia, and is mitigated by dietary changes focusing on smaller, more frequent meals with reduced simple carbohydrates, along with medications to retard gastric emptying or surgery in refractory cases to restore normal gastric physiology. 23. Zollinger-Ellison syndrome is a rare condition characterized by gastrin-secreting tumors, gastrinomas, situated primarily in the pancreas or duodenum, leading to hypersecretion of gastric acid, peptic ulcer disease, and diarrhea, with diagnosis supported by elevated fasting gastrin levels, stomach pH measurement, and imaging studies to locate gastrinomas. Treatment includes high-dose proton pump inhibitors to control acid secretion, and surgical resection or somatostatin analogs for tumor management. 24. Giardiasis is a common protozoal infection of the small intestine caused by Giardia lamblia, transmitted by contaminated water or food, leading to symptoms such as diarrhea, flatulence, stomach cramps, and weight loss. Diagnosis is confirmed by stool examination for cysts or trophozoites, antigen detection, or PCR testing, and it is treated effectively with antiparasitic agents like metronidazole or tinidazole, emphasizing the importance of safe drinking water and hygienic practices to prevent transmission. 25. Hepatocellular carcinoma, the most common primary liver cancer, often arises in the background of chronic liver disease and cirrhosis secondary to hepatitis B or C infection, alcohol abuse, or non-alcoholic fatty liver disease, presenting insidiously with weight loss, jaundice, and abdominal mass. Diagnosis is achieved through a combination of imaging modalities like ultrasound or MRI and serum alpha-fetoprotein measurement, with treatment options ranging from surgical resection, transarterial chemoembolization, local ablative therapies, to systemic treatments including kinase inhibitors and immunotherapy. (26) Constipation, a common digestive complaint, is characterized by infrequent bowel movements or difficulty evacuating stools, often due to inadequate dietary fiber, fluid intake, physical inactivity, or medications, and can be functional or secondary to underlying disorders like irritable bowel syndrome or neurological conditions. Management includes dietary modifications to increase fiber and water, behavioral interventions to establish regular bowel habits, and pharmacological treatments such as laxatives, stool softeners, or prokinetic agents to relieve symptoms and ensure regular bowel activity. 27. Non-alcoholic fatty liver disease, NAFLD, is the hepatic manifestation of metabolic syndrome, characterized by fat accumulation in the liver, which can progress to non-alcoholic steatohepatitis, NASH, fibrosis, and cirrhosis, associated with obesity, diabetes, dyslipidemia, and hypertension. Diagnosis involves imaging studies like ultrasound or MRI, and serological testing to exclude other liver diseases, while management focuses on lifestyle modifications, including dietary changes, physical activity, weight loss, and pharmacologic interventions targeting insulin resistance and hepatic inflammation. 28. Gastric cancer, often adenocarcinoma, is a malignancy arising from the stomach lining, associated with risk factors such as Helicobacter pylori infection, smoking, dietary factors, and certain genetic syndromes, presenting with vague symptoms like abdominal pain, weight loss, nausea, and early satiety, typically diagnosed through endoscopy with biopsy and staging through CT or PET scans. Management depends on the stage and may involve surgical resection, chemotherapy, radiation, and targeted therapies, with a focus on early detection and intervention to improve prognosis. 29. Bile acid malabsorption can lead to chronic diarrhea and stearia due to excessive bile acids reaching the colon after conditions such as ileal resection, Crohn's disease, or idiopathic causes. Diagnosis is often clinical, supported by a Say CAT scan or response to bile acid sequestrants, and management involves dietary modifications alongside medications like cholestyramine or colesevelam to bind unabsorbed bile acids in the gastrointestinal tract and reduce diarrhea. 30. Appendicitis is the inflammation of the vermiform appendix, often due to obstruction by fecaliths or lymphoid hyperplasia, presenting acutely with periumbilical pain that localizes to the right lower quadrant, accompanied by nausea, vomiting, and fever, with diagnosis supported by clinical examination, laboratory tests, and imaging like ultrasound or CT scan. Surgical removal via appendectomy, typically performed laparoscopically, is the definitive treatment to prevent complications such as perforation and peritonitis. 31. Primary sclerosing cholangitis, PSC, is a chronic liver disease characterized by progressive inflammation and fibrosis of the bile ducts, leading to strictures, cholestasis, and eventual cirrhosis, often associated with inflammatory bowel disease, particularly ulcerative colitis. Diagnosis is confirmed using cholangiography revealing a beaded appearance of biliary ducts, and management focuses on symptom relief, monitoring for complications, and liver transplantation in advanced cases, as no specific curative medical therapy exists. 32. Hemochromatosis is an iron overload disorder, predominantly genetic, characterized by excessive intestinal iron absorption and deposition in various organs, leading to symptoms including fatigue, arthralgia, diabetes, and skin hyperpigmentation, with diagnosis confirmed by elevated serum ferritin, transferrin saturation, and genetic testing for HFE mutations, while management involves regular phlebotomy to normalize iron levels and prevent organ damage, with liver biopsy used to assess the extent of hepatic fibrosis or cirrhosis. Intussusception is a condition where a segment of the bowel telescopes into an adjacent segment, commonly seen in infants, resulting in symptoms such as sudden abdominal pain, vomiting, and current jelly stools, with diagnosis often confirmed by ultrasound showing the characteristic target sign. Treatment may involve air or contrast enema reduction, which is both diagnostic and therapeutic, with surgical intervention necessary in cases of failed non-operative reduction or signs of bowel necrosis or perforation. 34. Esophageal cancer, most commonly squamous cell carcinoma or adenocarcinoma, presents with progressive dysphagia, weight loss, odynophagia, and hoarseness, primarily affecting men over women, and associated with risk factors like tobacco use, alcohol consumption, Barrett's esophagus, and achalasia. Diagnosis requires endoscopy with biopsy and imaging for staging, while treatment varies by stage, including surgical resection, chemoradiotherapy, and palliative care to manage symptoms and improve quality of life. 35. Gastric polyps are growths found on the stomach lining, often discovered incidentally during endoscopy, and can be non-neoplastic, such as hyperplastic polyps, or neoplastic, like adenoma, with potential to progress to cancer. Management involves histological assessment via biopsy, with surveillance and removal of neoplastic polyps, especially those with high-grade dysplasia, to prevent malignant transformation, alongside evaluation for underlying conditions such as chronic gastritis or atrophic gastritis. 36. Steatohepatitis, characterized by liver inflammation and damage due to lipid accumulation, is an intermediate stage between simple fatty liver and cirrhosis, commonly seen in alcohol abuse, alcoholic steatohepatitis, or as part of non-alcoholic fatty liver disease, NAFLD, diagnosed through liver function tests and imaging showing fat infiltration, possibly confirmed with biopsy. Management focuses on lifestyle adjustments like weight reduction and abstinence from alcohol or steatosis-inducing agents to halt progression and prevent cirrhosis. 37. Intestinal obstruction can be caused by mechanical factors such as adhesions, hernias, or neoplasms, or functional issues like ileus, resulting in symptoms of abdominal pain, vomiting, distension, and constipation. Diagnosis is based on clinical examination and imaging, particularly abdominal X-ray or CT scan showing dilated bowel loops, air fluid levels, and potential transition points, while management often requires hospitalization for fluid and electrolyte replacement, bowel rest, and surgery when indicated, particularly in complete or strangulated obstructions. 38. Dyspepsia, often known as indigestion, encompasses chronic or recurrent upper abdominal discomfort or pain, typically related to eating, and may be functional, peptic ulcer related, or indicative of underlying biliary or pancreatic disorders. Diagnosis involves clinical evaluation, exclusion of alarm features, and possible endoscopy, with treatment consisting of lifestyle adjustments, dietary changes, and pharmacologic agents such as acid suppressants or prokinetics, tailored to patient response and underlying etiology. 39. Eosinophilic esophagitis is a chronic immune-mediated disease characterized by eosinophil infiltration in the esophagus, leading to symptoms like dysphagia and food impaction, triggered by food allergens or environmental factors. Diagnosis is confirmed by endoscopic findings of rings or furrows and a high eosinophil count in esophageal biopsies, with management involving dietary elimination, proton pump inhibitors, and topical corticosteroids to reduce inflammation and prevent structural changes in the esophagus. 40. Gastric emptying disorders, such as gastroparesis, involve delayed gastric emptying without an obstructive cause, leading to symptoms of nausea, vomiting, early satiety, and bloating, often associated with diabetes mellitus, post-surgical conditions, or idiopathic origins. Diagnosis requires gastric emptying scintigraphy to measure retention, and treatment focuses on dietary modifications, glycemic control in diabetic patients, and medications like prokinetics or antiemetics to manage symptoms effectively and enhance gastric motility. (41) Peritonitis, an inflammation of the peritoneum, usually due to bacterial infection from gastrointestinal perforation, rupture of an abdominal organ, or dialysis complications, presents with severe abdominal pain, tenderness, rigidity, and systemic symptoms like fever or shock, diagnosed by clinical examination and supported by laboratory tests and imaging. Prompt treatment involves broad-spectrum antibiotics and often surgical intervention to address the underlying cause and drain infectious material or perform necessary repairs. (42) Hepatorenal syndrome is a functional kidney failure complication associated with severe liver disease like cirrhosis, characterized by intense renal vasoconstriction and reduced renal perfusion, with criteria for diagnosis including cirrhosis with ascites and exclusion of other causes of renal dysfunction. Management includes addressing precipitating factors, using vasoconstrictors to improve renal function, and considering liver transplantation when feasible to provide long-term resolution through improved liver function. 43. Short bowel syndrome results from extensive surgical resection of the small intestine, causing malabsorption, diarrhea, and malnutrition due to insufficient intestinal absorptive surface, necessitating a multidisciplinary approach involving dietary adjustments, vitamin and mineral supplementation, and medications such as antidiarrheals or proton pump inhibitors. In severe cases, patients may require parenteral nutrition or surgical interventions like bowel lengthening procedures to improve nutritional status and quality of life. 44. Hemorrhoids are swollen vascular structures in the anal canal, often associated with increased intra-abdominal pressure from straining during defecation or prolonged sitting, manifesting as rectal bleeding, pain, pruritus, and palpable masses, classified into internal or external hemorrhoids based on location. Management includes dietary modifications to increase fiber intake, topical treatments, sclerotherapy, rubber band ligation, and surgical hemorrhoidectomy for persistent or complicated cases requiring resolution. 45. Mesenteric ischemia, involving reduced blood flow to the intestines, can be acute due to arterial embolism, thrombosis, or chronic from atherosclerotic disease. It presents with severe abdominal pain, particularly postprandial in chronic cases, often coupled with fear of eating leading to significant weight loss. Diagnosis relies on a combination of clinical suspicion, laboratory tests, and imaging modalities such as CT angiography, while management involves prompt revascularization, anticoagulation, and surgical intervention tailored to the underlying cause and clinical stability of the patient. (46) Diverticulosis refers to the presence of diverticula in the colon, often asymptomatic but identified incidentally during imaging or colonoscopy, related to increased intraluminal pressure and chronic low-fiber diet. While benign, they can lead to complications such as diverticulitis or bleeding, with management emphasizing dietary fiber intake to prevent progression and regular monitoring for symptoms indicating complications, which may need further medical or surgical intervention. 47. Autoimmune hepatitis is a chronic inflammatory liver disease characterized by immune-mediated hepatocytic injury, with diagnostic features including elevated liver enzymes, positive serology for autoimmune antibodies, such as ANA, SMA, or LKM1, and liver biopsy showing interface hepatitis with lymphoplasmacytic infiltrate. Treatment requires immunosuppression, typically starting with corticosteroids like prednisone, often in combination with azathioprine, to induce and maintain remission and prevent disease progression to cirrhosis or liver failure. 48. Gastroparesis, often idiopathic or associated with underlying conditions like diabetes mellitus, involves delayed gastric emptying leading to symptoms such as nausea, vomiting, early satiety, and bloating without mechanical obstruction. Diagnosis is confirmed by gastric emptying scintigraphy and exclusion of structural causes, with management focused on dietary modifications, glycemic control, prokinetic medications like metoclopramide, and symptomatic relief through antiemetics or gastric electrical stimulation in refractory cases. SIBO, small intestinal bacterial overgrowth, is characterized by an increased number or alteration of bacteria in the small intestine, leading to symptoms like bloating, diarrhea, abdominal pain, and malabsorption. Diagnosis involves breath tests, such as lactulose or glucose, and treatment includes antibiotics such as rifaximin or metronidazole, probiotics, and addressing underlying anatomical or motility disorders to prevent recurrence and maintain a balanced gut microbiome. Pyloric stenosis, typically seen in infants, involves hypertrophy of the pyloric muscle, causing gastric outlet obstruction with projectile vomiting, dehydration, and failure to thrive, diagnosed through ultrasound revealing elongation and thickening of the pylorus. Treatment is surgical, with pyloromyotomy to relieve obstruction and restore normal feeding and hydration status, emphasizing the importance of early recognition and intervention to prevent severe electrolyte imbalances and nutritional deficits. 1. Esophageal cancer is a malignancy arising from the esophagus characterized by two main histological types: squamous cell carcinoma, which typically affects the upper portion of the esophagus and is strongly associated with smoking and alcohol consumption, and adenocarcinoma, which often develops in the lower part of the esophagus and is linked to chronic gastroesophageal reflux disease and Barrett's esophagus. The pathophysiology of esophageal cancer involves the uncontrolled proliferation of cells lining the esophagus, often initiated by chronic irritation or inflammation caused by factors such as tobacco, alcohol, and gastroesophageal reflux, which over time can lead to genetic mutations and the development of neoplasms. Early-stage esophageal cancer is often asymptomatic or presents with subtle symptoms like difficulty swallowing, dysphagia, which is frequently noticed with solid foods and can progressively worsen to include liquids as the tumor grows, causing obstruction within the esophageal lumen. Diagnosis of esophageal cancer commonly involves upper endoscopy with biopsy for histological examination, offering direct visualization of the mucosal abnormalities, combined with imaging techniques such as CT and PET scans to assess tumor staging and metastatic spread. The most significant risk factor for esophageal adenocarcinoma is chronic gastroesophageal reflux disease, GERD, which can cause Barrett's esophagus, a precancerous condition marked by the metaplastic transformation of normal squamous epithelium to columnar-lined epithelium over time. Squamous cell carcinoma of the esophagus is more prevalent in certain geographic regions such as East Asia and Eastern Africa, with dietary influences, consumption of very hot beverages, and nutritional deficiencies playing contributory roles in its etiology. Treatment for esophageal cancer varies based on the stage and location of the tumor but generally involves a combination of surgery, radiation, and chemotherapy, with esophagectomy being the mainstay curative approach for localized tumors, while systemic chemotherapy is pivotal for metastatic disease. Barrett's esophagus represents a premalignant condition in which the squamous epithelium of the distal esophagus is replaced by intestinal columnar epithelium, increasing the risk of developing esophageal adenocarcinoma due to chronic acid exposure and inflammation. Endoscopic ultrasound, EUS, serves as a critical tool in the staging of esophageal cancer, allowing for detailed assessment of tumor penetration into the esophageal wall and surrounding lymph nodes, which is crucial for planning effective treatment strategies. 10. The prognosis of esophageal cancer varies significantly by stage at diagnosis, with localized disease offering the best chance of cure, whereas advanced or metastatic disease is associated with a poor prognosis and a 5-year survival rate of less than 20%. 11. Symptomatic treatments for esophageal cancer may include esophageal dilation or stenting to alleviate obstructive symptoms, thereby improving swallowing and nutritional intake, especially in cases where the tumor is unresectable or the patient is unfit for surgery. 12. Molecular markers and genetic profiling are gaining attention in the prognosis and targeted therapy of esophageal cancer, with HER2 overexpression and PD-L1 expression being examples of biomarkers that can influence treatment plans, including the use of targeted therapies like trastuzumab or immune checkpoint inhibitors. 13. Smoking cessation is crucial in reducing the risk of esophageal squamous cell carcinoma, as tobacco smoke contains numerous carcinogens that contribute to the development of various intraepithelial lesions and malignant transformations in the esophagus. 14. The role of the p53 tumor suppressor gene is pivotal in esophageal carcinogenesis, with mutations in this gene frequently encountered in both adenocarcinomas and squamous cell carcinomas, leading to impaired cell cycle regulation and increased susceptibility to neoplastic transformation. 15. Nutritional support is a key component of managing esophageal cancer, especially when advanced disease or treatment side effects compromise oral intake, necessitating interventions such as enteral feeding or supplementation to maintain adequate nutrition and weight. 16. Esophageal leiomyoma is the most common benign esophageal tumor, often asymptomatic and discovered incidentally on imaging, and differs from malignant lesions by its smooth muscle origin and low potential for malignant transformation. Surgical removal is warranted only if symptomatic. 17. PET cord scanning is invaluable for detecting metabolic activity and assessing distant metastasis in esophageal cancer, giving comprehensive information on disease spread that cannot be obtained through conventional imaging alone, thereby influencing decisions on the need for neoadjuvant therapy. 18. Alcohol use is a major risk factor for esophageal squamous cell carcinoma, with a dose-dependent relationship indicating that higher alcohol intake significantly elevates the risk of developing this type of cancer, emphasizing the importance of moderation or avoidance in at-risk populations. 19. Chemoradiotherapy can serve as a neoadjuvant treatment for esophageal cancer, intending to shrink the tumor preoperatively, improve the surgical outcome, and address microscopic metastatic disease, particularly in patients with locally advanced but still resectable tumors. 20. The development of minimally invasive esophagectomy (MIE) techniques has revolutionized the surgical management of esophageal cancer, offering reduced postoperative morbidity, faster recovery times, and comparable oncological outcomes to traditional open surgical approaches. 21. The expression of matrix metalloproteinases (MMPs) in esophageal cancer correlates with aggressive tumor behavior and metastatic potential, as these enzymes degrade extracellular matrix components, facilitating tumor invasion and spread, making them potential targets for therapeutic intervention. 22. Regular monitoring through endoscopic surveillance is critical for patients with Barrett's esophagus to detect dysplastic changes early, allowing for timely intervention strategies aimed at preventing progression to esophageal adenocarcinoma, including endoscopic resection or ablation techniques. 23. Dysphagia, or difficulty swallowing, is often one of the earliest and most common presenting symptoms of esophageal cancer, primarily resulting from tumor-induced luminal narrowing, progressing from solids to liquids as the disease advances, warranting prompt diagnostic evaluation. 24. The incidence of esophageal adenocarcinoma has been rising in Western countries, likely related to increased prevalence of obesity and gastroesophageal reflux disease, highlighting the role of lifestyle modification and surveillance in at-risk populations to curb this trend. 25. Adenocarcinoma of the esophagus frequently exhibits overexpression or amplification of the HER2/Neu oncogene, which has made the trastuzumab-based therapeutic regimen a viable option for improving outcomes in HER2-positive esophageal cancer, similar to its use in breast cancer. 26. Genetic syndromes such as tylosis, characterized by palmoplantar keratoderma, are associated with esophageal cancer, particularly squamous cell carcinoma, underscoring the importance of genetic counseling and early surveillance in affected families due to their markedly increased risk. 27. The role of E-cadherin, a cell adhesion molecule, is significant in esophageal cancer, with loss of its expression being linked to epithelial to mesenchymal transition, increased invasiveness, and metastatic potential, suggesting its potential utility as a prognostic marker. 28. Achalasia, a primary esophageal motility disorder, increases the risk of esophageal squamous cell carcinoma due to long-standing stasis and inflammation, making periodic endoscopic surveillance vital in patients with this condition to detect early neoplastic changes. 29. Proton pump inhibitors (PPIs) are commonly prescribed to manage gastroesophageal reflux disease and can play a role in preventing progression to Barrett's esophagus and esophageal adenocarcinoma by significantly reducing acid exposure and subsequent esophageal inflammation. 30. The overexpression of VEGF, a potent angiogenic factor, in esophageal cancer correlates with poor prognosis due to its role in promoting tumor angiogenesis and growth, making it a potential target for anti-angiogenic therapies such as bevacizumab in the treatment of advanced disease. 31. Photodynamic therapy, PDT, is an endoscopic treatment option for early-stage esophageal cancer or dysplasia in Barrett's esophagus, utilizing photosensitizing agents activated by light to destroy cancerous cells with minimal damage to surrounding healthy tissue. 32. Multidisciplinary management of esophageal cancer, incorporating input from gastroenterologists, oncologists, surgeons, radiologists, and nutritionists, is essential to delivering comprehensive care tailored to individual patient needs and maximizing therapeutic outcomes. 3. Epstein-Barr virus, EBV, has been implicated in certain cases of esophageal squamous cell carcinoma, with studies suggesting a possible etiological role, though the exact mechanisms of oncogenesis remain unclear and warrant further investigation to establish causation. 34. The assessment of esophageal tumor margins post-resection is critical to ensure complete excision and prevent local recurrence, often involving frozen section analysis intraoperatively to guide the surgical approach and achieve clear margins for optimal oncological outcomes. 35. Targeted therapies, such as monoclonal antibodies and small molecule inhibitors, are increasingly explored in esophageal cancer treatment, with ongoing research focusing on biomarkers like EGFR, MET, and PD-1/PD-L1 pathways to enhance response rates and survival benefits. 36. Monitoring treatment response in esophageal cancer often involves serial imaging studies, including CT or PET scans, combined with clinical evaluation of symptom resolution, providing key insights into therapeutic effectiveness and facilitating timely adjustments in management plans. 37. Obesity is a known risk factor for esophageal adenocarcinoma, primarily through its association with gastroesophageal reflux and subsequent Barrett's esophagus, emphasizing the importance of weight management and lifestyle modifications in lowering cancer incidence in overweight populations. Human papillomavirus (HPV) has been investigated for its potential role in esophageal squamous cell carcinoma, with some studies identifying HPV DNA in tumor tissue. Yet its significance remains controversial, and additional research is needed to clarify its impact on esophageal carcinogenesis. The use of serological markers, such as squamous cell carcinoma antigen (SCC-AG), provides supplementary information in monitoring and prognosticating esophageal squamous cell carcinoma, although their utility is limited by specificity and the need for further validation. Brachytherapy, a form of internal radiation therapy, can be employed as a palliative treatment in esophageal cancer, particularly in advanced or recurrent disease, to provide symptomatic relief from dysphagia and improve the quality of life, especially when external beam radiation is not feasible. Robotic-assisted esophagectomy offers a modern surgical approach with advantages including enhanced precision, reduced blood loss, and shorter hospital stays compared to traditional methods, though it requires specialized training and equipment, contributing to its limited availability. Chronic esophagitis, resulting from prolonged gastroesophageal reflux, can cause progressive cellular alterations, ultimately leading to Barrett's esophagus and increasing the risk for esophageal adenocarcinoma, hence the importance of early and effective management of reflux symptoms. The gut microbiome's role in esophageal cancer is an emerging field of study, with research suggesting that dysbiosis or alterations in the microbial balance may influence carcinogenesis, although the precise mechanisms and implications for prevention and therapy remain to be fully elucidated. Neoangiogenesis, the formation of new blood vessels, is crucial for esophageal tumor growth and progression, often driven by factors like VEGF, making anti-angiogenic agents an appealing therapeutic option to limit nutrient supply and impair tumor expansion in advanced cancer stages. Inflammatory mediator overproduction, such as prostaglandins, in chronic reflux esophagitis can exacerbate tissue damage and increase cancer risk, supporting the use of anti-inflammatory drugs, like COX-2 inhibitors, in potentially reducing the progression to esophageal cancer. Salvage surgery is sometimes employed in esophageal cancer for recurrent disease following chemoradiation, offering the possibility of disease control or cure when initial non-surgical treatments fail, though it is associated with higher morbidity and requires careful patient selection. Nanotechnology applications in esophageal cancer encompass drug delivery systems aimed at enhancing therapeutic efficacy and reducing systemic toxicity, utilizing nanoparticles to target cancer cells more precisely, representing a burgeoning area of research with promising potential. Esophageal cancer screening is not widely implemented due to the lack of a sufficiently sensitive and cost-effective method for the general population, although high-risk groups, such as those with Barrett's esophagus, may benefit from regular endoscopic surveillance to identify early malignancies. Dysregulation of cyclooxygenase 2 (COX2) expression in esophageal cancer is associated with increased proliferation and resistance to apoptosis, providing a rationale for using COX2 inhibitors as a potential therapeutic strategy to enhance treatment response and inhibit tumor progression. Cryotherapy is an emerging endoscopic treatment for early esophageal cancer or precancerous lesions, utilizing extreme cold to ablate dysplastic tissue with minimal invasiveness and complications, offering an alternative to more invasive surgical options in select patients. One, colon cancer, also known as colorectal cancer, is characterized by malignant growths that arise in the lining of the large intestine, initiated by genetic mutations and environmental factors, progressing in a multi-step sequence from benign polyps to invasive cancer, and is heavily influenced by lifestyle factors such as diet and physical activity. 2. The clinical presentation of colon cancer commonly includes symptoms like rectal bleeding, changes in bowel habits such as diarrhea or constipation, unintended weight loss, and persistent abdominal discomfort, though early-stage colon cancer is often asymptomatic, highlighting the importance of regular screening for early detection. One vital innovation in colon cancer screening is the fecal immunochemical test, FIT, a non-invasive test that detects hidden blood in stool using antibodies specific to human hemoglobin, offering a highly sensitive option for annual screening that enhances early detection and reduces mortality significantly. 4. The pathophysiology of colon cancer is deeply rooted in the adenoma-carcinoma sequence, where benign adenomatous polyps undergo genetic alterations, such as APC, KRAS, and P53 mutations, leading to dysplastic changes and progression to carcinoma, underscoring the importance of polypectomy in interrupting this sequence. 5. Surgical resection remains the cornerstone of curative treatment for localized colon cancer, with the extent of surgery tailored to the cancer's location and stage. Minimally invasive techniques like laparoscopic or robotic surgery are increasingly used for their benefits in reducing postoperative recovery time and complications. 6. Adjuvant chemotherapy, particularly with fluoropyrimidines such as 5-fluorouracil in combination with oxaliplatin, is indicated for stage 3 colon cancer following surgery to eliminate microscopic remnants of cancer cells, decreasing recurrence risk and improving survival outcomes, although it is generally not recommended in stage 1 cases. 7. Recent breakthroughs in genetic testing have unveiled the role of mismatch repair, MMR, gene mutations and microsatellite instability, MSI, in colon cancer, leading to the implementation of universal MSI testing in patients with newly diagnosed colon cancer to guide immunotherapy decisions. 8. Targeted therapies have revolutionized the management of metastatic colon cancer, particularly monoclonal antibodies like bevacizumab, which inhibits vascular endothelial growth factor, VEGF, and thus tumor angiogenesis, and cetuximab, which targets the epidermal growth factor receptor, EGFR, depending on the tumor's ROS mutation status. 9. Immunotherapy has emerged as a pivotal treatment strategy for mismatch repair deficient colon cancer, particularly using immune checkpoint inhibitors such as pembrolizumab, which enhance the host immune response against tumor cells and are primarily useful in patients with metastatic and unresectable disease. 10. Colonoscopy is the gold standard in colon cancer screening, allowing for direct visualization and removal of precancerous polyps, and while sedation is typically employed to enhance patient comfort, advances such as virtual colonoscopy using CT imaging are being explored for those who cannot undergo conventional techniques. 11. A groundbreaking approach in the prevention of colon cancer involves the use of aspirin, which has been shown through studies such as the CAP, Colorectal Adenoma Carcinoma Prevention Program, trials, to reduce adenoma formation and consequently, cancer incidence in individuals with hereditary cancer syndromes. 12. Surveillance colonoscopy protocols post-polypectomy or cancer resection are critical and are tailored based on the initial findings, such as polyp number, size, and histological characteristics, to monitor for new polyp formation or recurrence of cancer, showing the dynamic nature of the surveillance landscape. (13) A lesser-known presentation of colon cancer is the occurrence of paraneoplastic syndromes, where the cancer produces substances leading to remote effects such as Trousseau's syndrome, characterized by unexplained venous thrombosis, emphasizing the need to consider malignancy in atypical clinical presentations. (14) Genetic syndromes such as Lynch syndrome, hereditary non-polyposis colorectal cancer, characterized by germline mutations in MMR genes, predispose individuals to early-onset colon cancer, stressing the importance of genetic counseling and testing for at-risk families to implement appropriate surveillance strategies. (15) Emerging data suggests the pivotal role of the gut microbiome in colon cancer development, where dysbiosis and the presence of certain bacterial species such as Fusobacterium nucleatum can enhance tumorigenesis by creating a pro-inflammatory environment, offering potential new avenues for prevention and treatment. (16) A unique manifestation of advanced colon cancer is the formation of malignant bowel obstruction, where the tumor obstructs intestinal flow, requiring urgent intervention that may involve surgical resection, endoscopic stenting, or decompression via nasogastric tubes to alleviate symptoms and improve patient quality of life. (17) Tumor markers such as carcinoembryonic antigen, C, play a critical role in monitoring colon cancer treatment response and recurrence, especially in metastatic cases, although their nonspecific nature makes them less valuable for initial diagnosis, highlighting the nuance in biomarker utilization. (18) A significant innovation in personalized medicine for colon cancer involves the use of circulating tumor DNA, ctDNA, as a non-invasive biomarker that has shown promise in identifying minimal residual disease, guiding adjuvant therapy decisions, and providing real-time insights into tumor dynamics and resistance mechanisms. (19) Occupational risk factors for colon cancer, such as sedentary work environments and prolonged sitting, have been identified as contributing to increased risk, emphasizing the need for public health interventions that encourage regular physical activity as a preventive measure alongside dietary modifications. (20) In a novel approach to colon cancer treatment, radiofrequency ablation and cryoablation are being used selectively to target and destroy hepatic metastasis, demonstrating the expansion of local ablative technologies in providing additional options for patients with limited metastatic disease. (21) Advances in imaging, such as diffusion-weighted MRI, have improved the preoperative assessment of colon cancer by offering superior soft tissue contrast, enabling more accurate staging and involvement of surrounding structures, which directly influences surgical planning and prognostication. (22) Recognizing the impact of diet and nutrition on colon cancer, studies indicate that high fiber intake, along with diets rich in fruits, vegetables, and whole grains, contributes to a lower risk of cancer development through mechanisms involving fecal bulk increase and reduction of intestinal transit time. (23) Quality of life assessments are integral to the management of colon cancer, where tools like the EORTC-QLQC30 questionnaire are employed to evaluate the patient's well-being and functional status, ensuring holistic care that extends beyond mere survival to encompass physical, emotional, and social health. (24) Colon cancer incidence has demonstrated a concerning rise in younger adults, under the age of 50, attributed to a combination of lifestyle factors and genetic predispositions, prompting a re-evaluation of screening guidelines to potentially lower the age at which screening initiates for average-risk individuals. 25. The role of inflammation in colon cancer is highlighted by conditions such as ulcerative colitis and Crohn's disease, where chronic inflammation induces dysplastic changes, necessitating a rigorous surveillance program and prophylactic colectomy considerations to mitigate cancer risk in these high-risk populations. 26. Epigenetic alterations, such as DNA methylation and histone modification, contribute significantly to colon cancer pathogenesis by silencing tumor suppressor genes, representing potential targets for novel therapeutic interventions aimed at reversing these changes to restore normal cellular function. 27. Herbal medicines and dietary supplements are being explored for their potential chemopreventive properties in colon cancer, with compounds like curcumin and resveratrol showing promising results in preclinical models, although clinical validation is required to confirm their efficacy and safety. 28. Disparities in colon cancer outcomes have been observed among different racial and socioeconomic groups, likely due to variations in access to healthcare, screening, and treatment options, highlighting the urgent need for equitable health policies and targeted interventions to bridge these gaps. 29. Integrated care models involving multidisciplinary teams have become a cornerstone in colon cancer treatment, ensuring that patients receive coordinated and comprehensive care that spans surgical, medical, and supportive services, optimizing treatment outcomes and patient satisfaction. 30. The ability of colon cancer to metastasize to distant organs such as the liver and lungs chiefly stems from its adaptation to evade immune surveillance and spread through the lymphatic and vascular systems, presenting a major challenge that necessitates systemic therapy alongside local control measures. 31. Increasing evidence suggests that vitamin D, owing to its role in cell growth regulation and immune function, may play a protective role in preventing colon cancer, with ongoing research assessing its supplementation as a potential intervention to reduce cancer risk in deficiency states. 32. Patients with colon cancer have shown improved prognostic outcomes with regular follow-up and implementation of survivorship care plans, which include adherence to surveillance protocols, healthy lifestyle adoption, and management of long-term treatment effects, according to guidelines from oncology societies. 3. Advanced genomic profiling techniques, such as next-generation sequencing, have unveiled the complex mutational landscape of colon cancer, identifying actionable mutations and resistance mechanisms, paving the way for precision oncology strategies tailored to each patient's unique tumor profile. 34. The implementation of enhanced recovery after surgery, ERAS, protocols in colon cancer surgery has been instrumental in reducing hospital stay lengths and postoperative complications by emphasizing early mobilization, optimal nutrition, and multimodal analgesia, reflecting a shift towards patient-centered surgical pathways. 35. Lynch syndrome-associated colon cancers typically manifest a distinct pathological phenotype, characterized by poor differentiation, lymphocytic infiltration, and mucin production, contributing to differential prognosis and therapy response compared to sporadic colon cancers, underscoring the importance of molecular classification. 36. Circulating microRNAs, small non-coding RNA molecules, are emerging as promising biomarkers for early detection, prognosis, and monitoring therapeutic response in colon cancer, with their stability in bodily fluids enabling non-invasive testing advancements that could significantly transform current diagnostic practices. 37. An intriguing area of research is the role of ferroptosis, a type of programmed cell death characterized by iron-dependent lipid peroxidation, in colon cancer, offering a potential target for novel treatments aimed at inducing cancer cell death through this unique pathway. 38. The risk of metachronous colon cancer necessitates vigilant surveillance in patients with a history of colon cancer resection, as the development of new primary cancers in the remaining intestine remains a possibility, and adherence to tailored follow-up schedules is essential for early detection and intervention. 39. Nutrigenomics, the study of gene-diet interactions, is gaining traction in colon cancer research, where genetic variants may affect individual responses to dietary components, potentially informing personalized dietary recommendations that could mitigate cancer risk or progression. 40. Radiotherapy, although not a primary treatment for colon cancer due to the radiosensitivity of surrounding tissues, can be utilized in specific scenarios such as in cases of local recurrence or for palliation of symptoms, particularly when surgery and chemotherapy are not feasible options. 41. Bowel function and quality of life after colon cancer surgery are significant concerns, with some patients experiencing altered bowel habits and fecal incontinence, necessitating preoperative counseling, pelvic floor rehabilitation, and dietary interventions to address these complications effectively. 42. The discovery of cell-free DNA, released from apoptotic or necrotic tumor cells into the bloodstream, has garnered attention as an invaluable tool for non-invasive surveillance and early detection of recurrence in colon cancer patients undergoing surveillance post-treatment. 43. Advances in three-dimensional, 3D printing technologies have found applications in colon cancer surgical planning, allowing for the creation of patient-specific anatomical models that aid in complex resection strategies, enhancing preoperative assessment and intraoperative guidance. 44. A novel therapeutic avenue being investigated involves monoclonal antibodies targeting claudins, a family of proteins overexpressed in colon cancer that contribute to tumor invasiveness and heterogeneity, showing potential in preclinical studies for slowing disease progression and enhancing standard treatment. 45. Colon cancer prevention initiatives have increasingly targeted modifiable risk factors such as obesity, which is associated with chronic inflammation and insulin resistance, with interventions promoting healthy weight management showing promise in reducing incidence rates and improving overall population health outcomes. 46. Emotional and psychological support for colon cancer patients, often overshadowed by the focus on physical treatment, plays a vital role in comprehensive care, as demonstrated in studies highlighting improved treatment adherence and quality of life when mental health resources are integrated into oncology care pathways. 47. Explorations into the role of long non-coding RNAs, LNCRNAs, in colon cancer have revealed their influence on gene expression regulation and tumor progression, offering a rich target landscape for potential therapeutic interventions aimed at modulating these non-coding regions to impede cancer development. 48. Prehabilitation programs, focused on optimizing physical and nutritional status before colon cancer surgery, have emerged as an innovative approach to improve postoperative outcomes, reducing complications, and enhancing recovery times, in line with trends towards enhancing patient resilience. 49. Colon cancer's survival outcomes have been positively impacted by the adoption of sentinel lymph node mapping, a surgical technique initially used in other malignancies, which aids in precise staging and the determination of lymph node involvement, aiding in treatment decision-making and prognostication. 50. Recent advances in organoid technology, allowing cultivation of patient-derived tumor cells in 3D cultures, have provided a powerful platform for personalized medicine in colon cancer, enabling drug testing, genetic studies, and understanding resistance mechanisms on patient-specific tumor models. 1. A staggering diversity of microbial symbionts thrives within the human gastrointestinal tract, with the gut microbiota encompassing trillions of bacteria that wield profound influence over digestion and overall health. Yet disruptions in this microbiome, such as through antibiotics or a Western diet, can precipitate conditions like inflammatory bowel disease, irritable bowel syndrome, and metabolic disorders, emphasizing the importance of maintaining microbial balance for gastrointestinal homeostasis. 2. Crohn's disease, a type of inflammatory bowel disease, manifests with transmural inflammation that can affect any part of the gastrointestinal tract from mouth to anus, often leading to complications such as strictures, fistulas, and nutrient malabsorption despite its immune-modulated pathophysiology being not entirely understood. Innovative biologic therapies targeting TNF-alpha and other inflammatory mediators have significantly improved patients' quality of life. 3. Gastroesophageal reflux disease, GERD, represents a chronic condition characterized by the retrograde flow of stomach contents into the esophagus, leading to symptoms such as heartburn and regurgitation, with potential complications including esophagitis and Barrett's esophagus, and lifestyle modifications like dietary changes and elevation of the head during sleep are often first-line therapies, supplemented by proton pump inhibitors to reduce acid production when necessary. 4. Celiac disease is an autoimmune disorder where ingestion of gluten leads to damage in the small intestine, with specific genetic markers HLA-DQ2 and HLA-DQ8 playing central roles in pathogenesis, and strict adherence to a gluten-free diet is currently the sole management strategy, underscoring the need for vigilance in identifying hidden sources of gluten to prevent malabsorption and related complications such as osteoporosis and anemia. 5. Acute pancreatitis, often precipitated by gallstones or excessive alcohol intake, involves the autodigestion of pancreatic tissue by prematurely activated digestive enzymes, and while mild cases may resolve with supportive care like hydration and fasting, severe forms can result in necrosis and systemic inflammatory response syndrome, necessitating intensive medical interventions and sometimes surgical debridement. 6. Irritable bowel syndrome, IBS, is a functional GI disorder characterized by a combination of abdominal pain, bloating, and altered bowel habits without any detectable organic cause, distinguishing itself with the brain-gut interaction being pivotal in its pathophysiology, and a personalized approach to treatment incorporating dietary adjustments, like low FODMAP diet, psychological support, and specific medication targets hallmark symptoms. 7. Peptic ulcer disease is primarily caused by Helicobacter pylori infection or chronic use of nonsteroidal anti-inflammatory drugs, leading to erosions in the gastric or duodenal mucosa due to imbalances between protective and aggressive gastric factors, and eradication of H. pylori through antibiotic regimens or cessation of offending NSAIDs, coupled with acid suppression therapy, typically results in ulcer healing and symptom resolution. 8. Diverticulosis refers to the presence of herniations or pouches in the colonic wall that become inflamed or infected, resulting in diverticulitis, a condition characterized by acute abdominal pain, fever, and digestive disturbances, highlighting dietary fiber's role in prevention and antibiotics or, in severe cases, surgery's necessity for resolving complications like perforations or fistulas. 9. Chronic liver disease can culminate in portal hypertension, a condition where increased pressure in the portal venous system leads to complications such as esophageal varices, splenomegaly, and ascites, with non-invasive elastography providing a modern diagnostic tool for assessing liver stiffness and therapeutic advancements like TIPS procedure offering significant relief and management options. 10. Gallstones are crystalline concretions formed in the gallbladder due to imbalances in the composition of bile, with cholesterol stones being the most prevalent type in the Western world. And while many remain asymptomatic, if a stone obstructs the cystic duct, it can lead to cholecystitis, biliary colic, or pancreatitis, necessitating potential cholecystectomy as a definitive treatment. 11. The human gastrointestinal system displays a fascinatingly complex layered structure with the enteric nervous system operating as a second brain, capable of autonomous function in orchestrating peristalsis and secretion, with neuronal interconnectivity and neuromodulators reminiscent of the central nervous system, asserting its foundational role in maintaining digestive function and influencing emotional states. Cirrhosis, the final common pathway for a myriad of chronic liver diseases, results from progressive fibrosis and nodular regeneration within the liver parenchyma, ultimately compromising hepatic function and leading to complications such as jaundice, coagulopathy, and hepatic encephalopathy, with liver transplantation remaining the only curative option for end-stage cirrhosis despite ongoing advancements in antifibrotic therapies. Malabsorption syndromes are marked by defective nutrient absorption in the intestine, with conditions like lactose intolerance and tropical sprue affecting various digestive processes, leading to symptoms such as diarrhea, weight loss, and nutritional deficiencies, and they necessitate both accurate differential diagnosis via tests like breath hydrogen and stool analysis, as well as targeted dietary and pharmacological interventions. Gastric cancer, predominantly adenocarcinoma, poses a major global health concern with risk factors including H. pylori infection, dietary influences, and genetic predispositions, often presenting in late stages due to nonspecific early symptoms, but advances in endoscopic surveillance techniques, alongside surgical and chemotherapeutic modalities, have provided tangible improvements in early detection and patient survival outcomes. Functional dyspepsia, a chronic disorder characterized by upper abdominal discomfort and related symptoms, presents without an underlying structural cause, challenging clinicians with its complex interplay of gastric motility disturbance, visceral hypersensitivity, and psychosocial factors, thus mandating a multifaceted approach that may include prokinetics, acid suppression, and psychological therapies like cognitive behavioral therapy. Hepatitis C, a blood-borne viral infection that predominantly targets hepatocytes, can progress silently to chronic liver disease and cirrhosis over decades, but recent developments in direct-acting antiviral agents have revolutionized its management, providing cure rates above 95% and reducing the incidence of liver-related complications, thereby offering a beacon of hope for managing viral-induced liver diseases. Hepatic encephalopathy, resulting from the buildup of neurotoxic substances like ammonia due to liver dysfunction, manifests with a spectrum of neurological impairments ranging from confusion to coma in advanced cases, and treatment strategies focus on reducing ammonia levels using lactulose or rifaximin, alongside addressing the precipitating factors like infections or dehydration to prevent flares of this debilitating condition. Clostridium difficile infection is a leading cause of healthcare-associated diarrhea due to alteration of normal gut flora following antibiotic usage, and the hallmark pseudomembranous colitis can progress to severe fulminant colitis, necessitating prompt recognition and management with oral vancomycin or fidaxomicin, and fecal microbiota transplantation has emerged as an innovative therapy for recurrent cases. Barrett's esophagus, a precursor for esophageal adenocarcinoma, results from chronic gastroesophageal reflux causing metaplasia of the esophageal lining, with endoscopic surveillance and biopsy forming the cornerstone of monitoring, and advanced interventions like radiofrequency ablation or endoscopic mucosal resection in selected cases offer potential measures to mitigate cancer progression risk. Intussusception occurs when one segment of intestine telescopes into another, causing bowel obstruction and ischemia if untreated, predominantly affecting young children who present with classic triad of intermittent abdominal pain, current jelly, stools, and a palpable abdominal mass, with treatment often involving a therapeutic enema or surgical intervention to resolve the obstruction. 21. Non-alcoholic fatty liver disease encompasses a spectrum from simple steatosis to non-alcoholic steatohepatitis, reflecting fat accumulation in hepatocytes primarily linked to metabolic syndrome. Features such as obesity, insulin resistance, and dyslipidemia, demanding lifestyle modifications as the primary therapeutic approach, while pharmacological interventions focusing on insulin sensitizers show promise in reversing hepatic steatosis and inflammation. 22. Helicobacter pylori's unique spiral morphology and urease production enable survival and colonization within the acidic gastric environment, causing chronic gastritis, peptic ulcers, and being a recognized carcinogen associated with gastric cancer, making eradication regimens combining multiple antibiotics and acid suppression pivotal in reducing its clinical burden and preventing associated gastric malignancies. 23. Acute appendicitis, the most common surgical emergency, results from obstruction and subsequent infection of the appendix leading to inflammation and potential perforation, presenting with periumbilical pain migrating to the right lower quadrant, and timely diagnosis and surgical intervention, typically in the form of appendectomy, remain crucial to avoid complications like peritonitis or abscess formation. 24. Hirschsprung's disease is a congenital condition resulting from the absence of ganglion cells in the distal colon, leading to functional bowel obstruction and chronic constipation in neonates, with rectal biopsy being the definitive diagnostic tool, and surgical resection of the aganglionic segment forming the cornerstone of treatment to restore normal bowel function and prevent enterocolitis. 25. Autoimmune hepatitis, characterized by chronic inflammation of the liver due to immune-mediated attack on hepatocytes, presents with varied symptoms from asymptomatic elevations in liver enzymes to fulminant hepatic failure, and although precise etiology remains elusive, treatment typically involves immunosuppression with corticosteroids and azathioprine to control inflammation and prevent progression to cirrhosis. 26. Esophageal achalasia, a disorder of esophageal motility characterized by impaired relaxation of the lower esophageal sphincter and loss of peristalsis, presents with progressive dysphagia to solids and liquids, and high-resolution manometry aids its diagnosis, with treatment options including pneumatic dilation, surgical myotomy, or peroral endoscopic myotomy offering symptomatic relief and improving esophageal function. 27. Microscopic colitis, comprising collagenous and lymphocytic variants, is an inflammatory bowel condition causing chronic watery diarrhea with normal endoscopic findings, but distinctive histopathological features on biopsy, and management generally involves cessation of potential offending agents like NSAIDs, with budesonide providing effective resolution of symptoms in many cases. 28. Zollinger-Ellison syndrome is a rare disorder caused by gastrin-secreting tumors, usually in the pancreas or duodenum, leading to gastric acid hypersecretion and recurrent peptic ulcers, with gastrin levels and imaging for tumor localization aiding in diagnosis, and management encompasses not only acid suppression but also surgical resection or somatostatin analogs to control hormone production. 29. Gluten sensitivity, a non-celiac adverse response to gluten ingestion, presents with symptoms overlapping with irritable bowel syndrome, including abdominal discomfort and bloating, without the autoimmune component seen in celiac disease, necessitating exclusion of other potential causes, and a gluten-free diet often providing symptomatic improvement, although the long-term necessity of dietary restrictions remains a topic of ongoing research. 30. Incarcerated inguinal hernias present when a segment of intestine becomes trapped within the inguinal canal, risking obstruction and ischemia, with acute presentation involving localized pain, irreducible mass, and possible systemic signs if strangulation occurs, and urgent surgical intervention is imperative not only to release the incarcerated bowel but also to repair the hernia to prevent recurrence. 31. Gastritis refers to inflammation of the gastric mucosa, which may be acute or chronic, and although often asymptomatic, it can manifest with epigastric pain, nausea, or bloating, with etiological factors ranging from infection by H. pylori to NSAID use and alcohol consumption, highlighting the importance of addressing the underlying cause alongside acid suppression to facilitate mucosal healing. (32) Hemochromatosis, a genetic disorder characterized by excessive iron absorption and accumulation in tissues, leads to organ damage, particularly in the liver, heart, and pancreas. Presenting with liver cirrhosis, diabetes, and skin pigmentation changes, an early diagnosis facilitated by genetic testing allows for effective management through regular phlebotomy to prevent long-term complications. (3) Gastrointestinal stromal tumors, GISTs, are mesenchymal tumors arising predominantly in the stomach or small intestine, characterized by mutations in the KIT or PDGFRA genes, and present with nonspecific symptoms such as gastrointestinal bleeding or pain, with management advancing significantly through the use of imatinib, a tyrosine kinase inhibitor, besides surgical resection for localized disease.